Okay, it's about 1 minute after 9. Let's go on and get started. I want to be respectful of everybody's time. So we will call this edition of the Interim Sunset Subcommittee Legislative Commission to order. Madam Secretary, please call the roll.
Morning. Senator Brooks?
Here.
Senator Pickard? Assemblyman Daly?
Here.
Assemblyman Ellison?
Present.
Assemblywoman Howdigi?
Here.
Ms. Brown?
Present.
Mr. Cheney? Ms. Rankin?
Here.
And Chair Spearman.
Here, and Mr. Margarejo, please forgive me. I said, Madam Secretary, I'm so used to doing that when we open the meeting, so please forgive me. Okay. So welcome everyone, and I want to thank you all for the for all the work that you've done this time. I know it's been a bit of a challenge because we are operating in a different environment, but I want to say thank you anyway and appreciate all that you're doing. Let's look at some housekeeping measures. Please keep your microphone on mute when you're not speaking to minimize background noise. I would also caution you that if there are others in your office, your home office, wherever you are, please remind them if they stand behind you, they will be on camera, and whatever they have on or not will be visible. So make sure that you let your family and friends know that. Cesar Margarejo is a committee policy analyst, and I want to appreciate him for calling the roll for us today. Please mark all of the members present. I believe they are, with the exception of Mr. Pickard, Senator Pickard, and his absence is excused unless his commitment finishes earlier this morning. Minutes of the meeting are produced in a summary format and are not verbatim. Meeting materials can be accessed on the subcommittee's webpage. Anyone who would like to receive electronic notification and access to the subcommittee's agendas, meetings, and final report can do so by signing up on the Nevada Legislative website. There will be a public comment period at the beginning and the end of the meeting, and public comment is limited to 3 minutes per speaker. I want to remind everyone that during public comment, we listen and we do not remark. We listen and we do not ask or answer questions. This virtual meeting format is important to keep everyone safe, and I want the public to know that we are intent on doing just that. We'll be provided in 4 different ways if you want to participate. Number 1, you can call, and the number is 66900-6833. That's 669-900-6833. Then enter the meeting ID number is 947-8284-7575. Or you may email comments to sunset@lcb, that's Lima Charlie Bravo, .state.nv.us. You might also mail your written comments to the Research Division, 401 South Carson Street, Carson City, Nevada, 89701. Or you may fax them to 775-684-6600. So with that, let's get started. Our first agenda item will be public comment. Broadcast, do we have anyone holding for public comment?
Chair Spearman, the line is open and working. There are no callers at this time.
We'll wait just a couple more minutes, okay?
Sounds good, thank you.
we'll go on and get started. Reminder to myself, remember to turn off the mute. So today is the final meeting of the 2019-2021 interim for the Sunset Subcommittee, and the subcommittee will be taking action on the 15 boards, commissions, and councils that were reviewed during this interim. It is not customary for the subcommittee to accept testimony during a work session. If representatives from those 15 boards, commissions, and councils wish to comment before the work session, they should do so during the public comment, and if the subcommittee member has a question that must be answered before voting. So I will ask that a representative from the entity respond to the question during the work sessions. Public comment, as I said before, is limited to 3 minutes per speaker. LCB broadcast and production services staff will interact with those making public comment and provide testimony to facilitate the meeting. We'll go now to agenda item number 3, and that is approval of the minutes.
Move for the approval.
Who said that?
John Ellison.
Okay, moved by Assemblyman Ellison. Do I have a second?
Second.
Second by Vice Chair Hardigy. Any questions? All those in favor, please say aye.
Aye.
All opposed? So now we're moving on to agenda item number 4 on the state occupational licensing boards.
Good morning. Do I have you on, G? Perfect. So good
Someone
morning. Hi. So this is Maita Sanchez. I am the Policy and Grants Analyst over at the Governor's Office of Workforce Innovation. We're here this morning just to provide a quick update on the State Occupational Licensing Review and Reform Grant that we have been working on. We have some slides here to guide the conversation. So just quickly, we will be doing a review, just touching base on the literature review, the roundtable events, and some work that the American Institute Research, AIR, has been doing around the occupational licensing database, and some data collection efforts that they've been partaking in. So moving forward, just a quick overview. So Owen is right now in the process of re-examining the licensure requirements for the state. Our focus really is on our efforts to better serve our dislocated workers, our transitioning service members, and our veterans. Overall, with the help of AIR, we want to identify existing policies that really create an unnecessary barrier within the labor market. At the end of our work, what we're hoping to walk away with is with an actionable plan that really expands access to and improves portability and reciprocity for our selected occupations that we've been reviewing with AIR. So we really, within the Owen team, we've leveraged a working team that meets monthly to really touch base on the different projects that we're working on. Some of you are actually part of that working team, and really provide us with kind of deep dives into the challenges and really to help us inform our work. So participation in those meetings are monthly, and they've been really, really helpful for our team and for myself, really, in our efforts to collect information and provide reports. So last Sunset Subcommittee meeting, Mr. Collenberg from our office had brought forward a literature review for review. I just wanted to bring some attention to that. So since the last meeting, we have made revisions to that literature review, and we've provided that as an attachment here. Most changes you'll find on page 9. We wanted to provide a broader picture of some of the barriers to entry. So the report now includes, just briefly, some examples of bills that where a maximum allowable licensing related fees were increased in 2019. So it includes some additional information. to really draw out that distinction between the maximum allowable fee and the fees currently being charged. So page 9. Also, just a quick note on page 15 in regard to Senate Bill 186 that was mentioned from 2019, that did not actually get enacted for the physical therapy compact. Just an FYI, that was actually amended before final passage. So currently, I was told that BDR 153 submitted by Senator Ganser for the 2021 session will actually bring forth that request. So note that we will be going back to this literature review that you currently have and making that change as well to reflect that update. So moving forward, some of the work that we are going to be doing here in the next few months. So we have an upcoming roundtable. The purpose of this second roundtable that we will be doing is to really kind of better understand the current state of information reporting and data sharing between our occupational licensing boards and our state agencies. As you can see here, we currently have 6 state agencies and 4 licensing boards on our invite list that we will be asking to attend this roundtable to kind of contribute to that conversation. So on the next slide, just a little bit more information. This upcoming roundtable is slated for September 15th. So in a couple of weeks, it's going to be a 3-hour session with 2 discussion deep dives that we will be asking our participants to weigh in on. Just as a note, at the end of this roundtable, we will be submitting a summary, a bit of a high-level summary as to the information that we were able to collect from those participants, and that will be provided to our OL working team, which is slated to meet on the 23rd, so the week after. So just quickly here, within those 3 hours, within that first slot of discussion or breakout session that our participants will be participating in, we will be asking them to kind of discuss the need for reporting requirements, the frequency, any challenges associated with those requirements, and then we'll ask them about the mode in which information is reported by the boards and received by the state agency. So kind of allowing them to do a deep dive into that. As part of the second breakout, we'll ask them to kind of explore the extent to which information sharing occurs and any concerns they might have around it. We really want to ask them about their reporting related supports that they might benefit from, and to kind of weigh in on whether or not they may benefit from a structured data system that would promote data sharing and what that might look like. And again, we will be providing that information to the working team via a summary at the end of that, similar to the one from the first roundtable. So moving forward, we also have one final roundtable before wrapping up this grant. It's currently slated for October, date still to be determined. This roundtable is really more of a focus group format. Our audience really will be those who have experienced licensing, and again, we'll be leveraging and bringing this information forth to the working team that meets monthly and asking them for their input as we kind of flesh out those discussion questions, the agenda, who should attend the roundtable. And again, this discussion, this format, we will really kind of dive into identifying existing barriers with this particular audience. So that will be in October, and more information will come out as we kind of flesh out that agenda. So moving forward, I'm going to go ahead and kick this over to G. G's going to go ahead and touch upon some of the work that they've been doing with their data collection activities with Owen and dig into that. So G, when you're ready.
Thank you, Maida. Good morning, everyone. My name is G. Reggae, and I'm a researcher at American Institutes for Research, and I also serve as the project director from AIR for the Occupational Licensing Project. I'd like to share some updates on the AIR team's data collection activities. So AIR is developing an occupational licensing database. This database contains information for 110 occupations, and we're collecting information on 59 data elements, which includes collecting information on entry requirements, training and education requirements, license renewal requirements, and reciprocity. The information is being collected from publicly available sources, including the licensing board website. We're also collecting occupational licensing information on a subset of 25 occupations for 5 comparison states. Now, these states were identified in the 2017 Institute of Justice report as being the least burdensome. In that report, these states were ranked by combining the number of licensing requirements and the average burden of licensing requirements. So this could really help the state think about areas where the licensing system may have incorporated undue burden. The 25 occupations identified are from in-demand industries such as healthcare, education, and construction. In terms of current activities, the AIR team has completed data collection for the 110 occupations in the database. We're now collecting information for comparison states and those comparison occupations. In terms of next steps, once the data collection efforts are completed, we will analyze the differences in occupational licensing practice and policies between Nevada and the comparison states. We'll also compare licensed occupations across Nevada's in-demand industries, for example, healthcare and construction. Our deliverable for this piece of the project is a report on the analysis of occupational licensing data in Nevada overall and by industry, and comparisons between Nevada and selected states. And our deliverable will be submitted to Owen in December of 2020. That concludes my update of AIR's data collection activities. Thank you.
So that does conclude our update on the occupational licensing reform grant. Does anyone have any questions?
Thank you. Members, are there any questions?
Good.
Any questions? Seeing none, and it looks like the next occupational board meeting is going to be September the 15th. Is that
So
correct?
the next roundtable will be September 15th. The monthly meeting will be September 23rd. So for this month, we did send out an email update just because there wasn't quite much to catch up on. But for next month, yes, September 23rd.
Members? Any questions? Seeing none.
Fantastic.
Seeing none, let's move on. And broadcast, if you all do me a favor, and let's keep the grid up just in case someone wants to ask a question after we leave a particular section. That way I can see if someone waves their hand. So if we just keep the grid up and not spotlight the speaker, that would be great. For some reason my screen is acting up, but anyway, here we go. Our next agenda item is Nevada Occupational Licensing and the Governor's Office of Workforce Innovation. Thank you. Just a moment. This item is an action item, is labeled as an action item, but no action is required. And if there's something that the subcommittee wishes to do or to act, we can discuss that. So the two boards that I asked to provide the update are presented by Sarah Bradley, Deputy Executive Director of the Board of Medical Examiners, and Kathy Denauer, Executive Director, State Board of Nursing. The information submitted by both presenters is uploaded to the subcommittee's webpage, and I would like both Ms. Bradley and Ms. Denauer to provide the subcommittee a brief review of the information that they submitted in case there are any questions from the members. It's encouraging to see that 1,928 waivers submitted to the Board of Medical Examiners and 1,190 waivers submitted to the State Board of Nursing. So Ms. Bradley, please begin.
I do have an updated number since we provided that, and so the total now is 1,945 waivers. And then I do have a breakdown for you as well. So we received 1,741 from physicians, medical doctors, and then 153 from physician assistants, 42 from respiratory care, practitioners, respiratory care, and then 9 from perfusionists. And I don't think I had the breakdown when I submitted before, so that's new information. And other than that, I believe that the information that I provided answered the questions that Chair Spearman had, and if there's any questions, I'm happy to answer them.
Members, any questions? So I have one, and I know that you provided an extensive amount of information, but I'm still curious as to what the difference is with respect to waivers for physicians during the governor's emergency declaration, and what that would mean if that were to carry over into after the declaration is over, into a regular period.
Well, right now, the way it works, based on the directive and our reading of the directive, individuals submit that waiver. And I think I provided a link to the form. So they submit that waiver, and then we are filing those waivers so that we have a record of them. But they're not being vetted and licensed as a traditional applicant would be. So they're not actually licensed in Nevada under this waiver. They just have the permission to practice during the emergency. And so for a regular applicant, we would have a full application with their information, including social security number, things like that. We would have the child support declaration that I believe is required by federal law, and we've adopted it into Nevada law as well, and other things regarding their education, things like that. So under these waivers, they're saying that they are licensed and in good standing in another state, and that they would like to come here, or at least have the ability to work here during the emergency situation. So we're not verifying, we don't know where they went to school or what their status really is. We're just relying on the form, and we are, again, having those for records, so in case we had a problem or a concern, or we needed to do an investigation, we would have some information about who is here. So I guess I would say, to me, the processes are very, very different. And we really don't know very much about these people. We know just what they've told us. We're not, for a regular applicant, we get transcripts from school. We get a lot more information from them. And if they're licensed in another state, we would actually get like a letter from that other state certifying, let's say it's California. We would get a letter from the board in California saying, Dr. Smith is in good standing in California and has been licensed since X, whatever time frame. We don't have that for these applicants. We're relying, or not applicants, these individuals. We're relying on their attestations in the form that's provided.
Jurisdiction, discipline.
So, and it would be harder to discipline them, I would say, if we did have a complaint, and I've thought about this, how we would do it. I mean, I think what would happen is we would have a consumer tell us there was a problem with what one of these individuals has done, and we would need to work with their licensing board in that other state. I think the directive requires that they practice within the limits of their competency, so we might be able to do something there. But it would be it would be a challenge, I think, to figure out how to handle a situation if there was a problem with a consumer.
So here's my concern.
Okay.
They are vetted to the extent of their scope of practice, but there's that you do during this time that you would do if we were not under an emergency declaration?
These individuals, I would say, aren't vetted at all. The only vetting that is occurring is that they're completing a form that we have available online, and they're signing it and indicating that everything on the form is true. And we're accepting the form. And the way we read the directive, they don't even have to wait for us to give an approval or anything. Although there are some people that have asked, can you let us know you received the form? And we say, yes, we received the form, thank you, But no, I mean, I wouldn't say these individuals are vetted at all. We're relying on the information that they provide in the form. I hope it's true. We can't say that it is in every instance. And the directive itself tells people, it tells the individuals submitting this for this approval, it tells them that they must stay within the limits of their competency. So that's the directive from the governor to anybody who's coming in under this emergency, that they are instructed to do that. And I guess my hope was that could kind of help the public, because it specifically says in the directive they're not limited to their specialty. So in other words, the way I read that is if someone is, for example, an OB/GYN doctor, they're not required to stay in that field, but they have to make sure that whatever they do in Nevada, they're actually competent to do. And that's really, and that's a direction from the governor in the order. So I guess I would say they're not vetted. I would also say we don't know whether any of these individuals have practiced in Nevada. We only know that they've submitted the form. I hope that they're helping Nevada citizens, but we don't know that.
So how long would it normally take someone, if they were applying for a license, to be licensed in Nevada? When you're looking at
from the minute that we have a completed application, it's that day or the next day. The delay sometimes is that it takes a little while to get a completed application. And what I mean by that is we get the application on the form, but sometimes it takes some time for the school to send transcripts or for the individual to send all of the information that they need to with the application. So I think our time frame, the last numbers I saw were I want to say an average of 2 months. But again, that's any delay there is that we don't have a completed application. Once we have the completed application, we do issue the license within that next day, if not that same day. Now, for people who are applying under the Interstate Medical Compact, which I think I referred to in an answer to another question that you asked for us for today, in that it's very quick. That is done through the compact, and so individuals there basically have, it's almost like ready to go, if that makes sense. They have, they're a member of the compact, they have designated a principal licensure state, and then they can come to Nevada, and I think those take a matter of days, maybe 3 days, 5 days. It doesn't take very many days, and the only thing we're waiting on in those is we get a letter from the jurisdiction where they're at that just says Dr. Smith is licensed, for example, in whatever the state is, and then based on that, we issue the license. So the compact is very fast, and we do really think that the compact has helped people be able to move more freely between states and to come to Nevada and practice. And I believe the legislature enacted that, I want to say in 2017, and that's in 629A, and so we're really glad to have that. Oh, 15?
Yeah, 15.
Yeah, sorry.
So I still don't know that I understand, and please forgive me. Doctors are admitted to practice here in Nevada because there is an emergency declaration. And they're not vetted like they would be if we were not under an emergency declaration. And my question is, why couldn't whatever you're doing now to make sure that the public is safe? Because as I reflect on the times that we've asked those, we've talked about shortening the licensing period. It was always about, we have to make sure that we're protecting the public. And so what is it that you're doing now that assures the public that they are protected, and the doctor who is working in a facility can do so properly and not put their lives in jeopardy? I'm trying to understand if there is one, and right now I don't really see one.
I can't say that we're doing anything under the emergency directive that does ensure the public's safety, not like we would for an applicant. I mean, literally, we are receiving a form that they are signing. That's it. That's the only thing we have. We don't know who they are. We're not doing a background check on them. We don't know for sure that they're licensed. I mean, they're telling us they are in the form. It's our understanding based on the directive, and we were looking pretty hard at the plain language of the directive, that the governor didn't want there to be any delay, and that they are to notify, the way the directive reads, they're to notify the licensing board that they're wanting to come to Nevada and practice during this time period. And then again, in the directive, he says that they don't have to stay within their specialty, but they do have to ensure that what they do is within the limits of their competency. So we aren't doing anything other than receiving the form and really, you know, I guess, and we're not the only board that's handling these waivers. And I believe that the other boards have read the language the same way we have, that it's not our job to do a background check. You know, we don't do fingerprints, we don't check their transcripts or their licensure in another state. We're not doing those things because we were under the impression that this was to be essentially an immediate thing. They submit the form and now they have the ability to come to Nevada and practice. So I guess I would say we're not doing anything other than receiving the form and filing that form for our records.
Chair Spearman, it's Hannah Brown, if I may add something. I'm on the Valley System Board, and I know that you know, when medical professionals are seeking employment, we do a full and thorough investigation. And I think all the states have waived that to a great extent because of the shortage of medical professionals during this time. So I understand the process that's being used. You're pretty much taking their word for, I did graduate from Yale Medical School.
Thank you, Ms. Brown. Okay, I'll move on. I have some other questions, but I'll do that offline. Okay, so any questions from the members?
Senator Spearman, this is Senator Brooks.
Yes.
I have a question.
Mm-hmm.
And so I completely understand from a licensing standpoint, the waiver and what's happening at from a licensure and at the board level. Do you know, and Ms. Brown's question kind of led me to think of this. Do you know what the employer is actually doing from a vetting standpoint? Are they, you know, before they hire a medical professional during this emergency period, are employers still looking into backgrounds and things like that, even though they've gotten their licensure under the emergency waiver during this emergency situation?
You know, I don't know, and I would say they don't have their licensure, so we want to be clear. They're not actually licensed in Nevada, but they're able to work in Nevada during this time period. You know, I don't know. I think that would be a good question for the Nevada Hospitals Association. I did have an occasion to reach out to them recently, and I can ask that. I mean, I guess I would just think from a common sense perspective, they would want to make sure that they had some information about individuals if you're a hospital that you might be hiring, but I really don't know.
I think the difference is they're not hiring, they're allowing them to work for a limited period of time.
Thank you. I'll talk to the hospital association. That's a good suggestion. I'm just curious what the employer themselves are doing.
And thank you for that differentiation. The purpose of my question was really to find out why it takes so long if we are not in an emergency declaration, and why we can basically ensure the public that it is safe during emergency declaration. So that's it. I understand that this only happens during emergency. I understand that. My question really goes to the heart of, whenever we talk about shortening the licensing period, what I usually hear is that it takes time and they don't want to shorten that period because they want to make sure that the public is safe. And so with that, I'll just leave it alone. That's because that's the genesis. I do understand the difference between, you know, the governor's directive and what that says, and they're able to practice here. They're not necessarily licensed. I get that. I just don't understand why whatever the procedure is now to make sure people are safe can't be transferred into post-emergency declaration time. But that being said, that's all that I have. Any other questions, members? Okay. So, Mr. Nauer? Thank you.
Good morning.
Mr. Nauer, please.
Yes. Good morning.
Good
Good
morning.
morning, Senator Spearman and members of the committee. I'm Kathy Denauer, Executive Director for the Board of Nursing, for the record. And I've submitted to you, to the committee, a response to the request that you had with regards to what we are doing with COVID, during COVID, and with regards to the waivers. We have received 1,190 waivers, and that has been broken down by specialty, by APRN, RNs, licensed practical nurses, and we included nursing assistants about a month or two ago in discussions with the governor's office and our nursing students. So that is the list, the breakdown of the waivers that we have, and I'm happy to answer any questions that you may have.
Members, any questions? Seeing none. Thank you, ma'am.
You're welcome. Thank you.
Thank you. So we will move now to agenda item number 6, reports from the medical examiners regarding licensing and practice changes. Sorry about that. Reports from the Board of Medical Examiners and the Nevada Funeral and Cemetery Services Board regarding delay of death reporting. On June 30th, 2020, the subcommittee reviewed the Board of Medical Examiners and the Nevada Funeral and Cemetery Services Board. And in response to questions raised by the subcommittee at that meeting, both boards have submitted in writing suggestions to improve the timeliness of death reporting. Their responses are uploaded in the subcommittee's webpage, and it is my understanding that the following representatives from those two boards are with us here today, and I would ask that they provide a brief summary of the suggestions they submitted. And those representatives are Sarah Bradley, Deputy Executive Director, Medical Board of Examiners, and Jennifer Kent, Executive Director, Nevada Funeral and Cemetery Services Board. So again, Ms. Bradley, please begin.
Hello, am I unmuted? Oh, okay, I think I'm unmuted, I apologize. So we did submit a summary of comments here. We did have I think a productive conversation with Ms. Kant at the Nevada Funeral and Cemetery Services Board. And then subsequent to sending my response, I did get some information from the Nevada Hospital Association regarding this issue. So the summary of the comments that we submitted basically is we think there's a need for more education on this. The board has received some complaints over the years, as has, of course, the Nevada Funeral and Cemetery Services Board. And one thing we both kind of agreed on is it seems like people aren't, I say doctors and other medical professionals aren't always aware of the requirements, both for the timeliness. And also, I think sometimes there's a question, and this kind of goes into my second point. Sometimes there's a question on who should sign or who's responsible to sign when more than one person is involved in a person's care. So it's not uncommon in a hospital setting, for example, for multiple, for example, physicians to be treating a patient. And so sometimes it can be unclear. We're aware of one situation where the death certificate was delayed in part due to a dispute between two individuals regarding who was responsible to sign. And so there might be an opportunity for the State Board of Health to help clarify that in regulation in NAC 440. The other thing we identified is that sometimes there is a potential, I think, for confusion at the hospital setting because the law currently says that if the physician, and I believe it also includes nurse practitioner who is attending a death, is not going to be available within 48 hours, that the hospital should make sure that either the chief medical officer of the facility or an associate physician, and it also actually includes physician assistant, I believe, in that provision, as long as they have access to the medical records, they can actually sign the certificate. And it doesn't seem like there's always a clear policy on that from what we were able to identify. And so one thing we want to start doing is if and when we get complaints on this regarding a hospital or other situation like that where it's a medical facility, that we make sure we let the Bureau of Healthcare Quality and Compliance know about that situation. The other thing we identified is that improved communication between the entities that deal with this issue might be helpful because then we can share information, especially roadblocks or other things that we're seeing. And one thing I know I've found in my time working for the state, I think sometimes we think we communicate well, but we don't always. And so we want to make sure that we're including the Board of Health, the Registrar of Vital Statistics, the Bureau of Healthcare Quality and Compliance, the Nevada Board of Nursing, the Nevada State Board of Osteopathic Medicine, our board, and the Nevada Funeral and Cemetery Services Board so that we can work together on this when issues come up. And then the last thing we wanted to say was that the board does review and investigate complaints regarding its licensees, including when violations of this type are alleged. And we also do our best to reach out kind of proactively if we get inquiries about this to try to help get that certificate signed. There are times we've reached out and called, and at least in our experience, there's been, again, they weren't always aware that they needed to do it. I did get some information, though, last week from the Hospital Association, and there's some concern that seems like based on the system. So I don't know if everyone's aware, but the death certificate system is electronic and it's online. And apparently the system isn't always easy to access. And so we receive information that the system's not always accessible on all computers. There's issues with connectivity. It doesn't work on iPads or Macs. And so if providers, medical providers are using iPads or Mac laptops, they have to come to the hospital to complete the certificate. And so that sometimes is hard for them to do. And it's also not user-friendly, and sometimes there's issues with it, so they have to delete it and reload it. Apparently, the website configuration also requires that the computer security level be set at a low level, and so that's sort of a concern from a security perspective regarding the computer. So I think one of the recommendations we're getting from the Hospital Association is that the online system be improved so that it's more accessible and works better in that hospital setting as far as access for computers. And that's what I have. Thank you.
Thank you. Any questions, members? I just have a couple because it seems that the delay is probably more along the lines of the capacity for updated technical assistance. So has there been any discussion about how to get that fixed? What do we need to do to fix it? Because right now, if it's a problem and we're having issues with respect to computers, level of security, that sort of thing, what are we doing to fix that, if anything?
Well, I haven't had a chance to reach out to the Department of Public and Behavioral Health because I believe that's where the vital statistics is, as far as in state government. I just received that information from the Nevada Hospital Association last week, so on Friday. And so my plan was to reach out to them to just pass that on. They may already know that, I'm not sure. My guess is that would be a funding issue for them. If they had funding available, they might be able to improve that system. And then the other thing we wanted to do, and I believe our Chief of Investigations may have already done this, I need to check with him. We wanted to reach out to the Bureau of Healthcare Quality and Compliance just to make sure they were aware that this is an issue and something we're looking at, because they do license the hospitals, and to let them know that we will be sending them complaints regarding this. You know, just so that they have them too, because one of our thoughts was we can't really tell a hospital what to do, but if there's hospitals that need to have, you know, a better policy or procedure in place, if that's truly what's lacking, and it could be in some instances, we're not sure, we want to make sure we let them know. So we want to let them know ahead of time we're going to be sending them that information if and when we receive it. And so that's another thing regarding hospitals. So yes, we will reach out to them this week to try to at least let them know regarding this situation.
Thank you. Thank you. Members? Okay. Thank you, Ms. Bradley. Ms. Kent, please begin.
Thank you. After the last subcommittee meeting, I did reach out to the various funeral homes, asking them if they, you know, were indeed still having issues with doctor signing. And I did provide those funeral homes that answered. I kind of did a spreadsheet for you of their responses. And as you can see, it's still a problem. I did have conversations, as Sarah Bradley stated, and definitely I think we can do a better job with some communication on some of these issues. And the medical board gave me information on a particular individual within the medical board that I can forward to the funeral homes if they are having instances with specific doctors signing, and they will assist. So that's good news. Now, in addition to that, though, I would say that there is somewhat of a general consensus when you talk to funeral directors who are ultimately responsible for, you know, finalizing the death record, that the process could be a lot better if the cause of death was required to be signed off on before that individual even left the hospital. And that way you wouldn't have the situations where the doctor leaves, is not back at that hospital for maybe a week. But I do think that that would require a change to the EDRS system, and that might be a funding issue, I don't know. Last I had talked to one of the individuals within Vital Records, an individual named Jason Lewis, who's not there anymore, but he had stated they were actually trying to work on a mobile app for EDRS where the doctors could actually go in on their phone and sign the death records, because as Sarah mentioned, it is correct that the system is not available on a Mac or an iPad at this point in time. So I think that is another upgrade that would probably help compliance as well. And I just want to state to everyone, I mean, we're willing to be a part of any meetings, any trainings, just whatever we need to do to facilitate making the system better and faster, and everyone working together to ensure that death records get signed timely for the citizens. I don't know if anyone has any questions for me.
Members, any questions?
I do.
Assemblyman Ellison.
Thank you, Madam Chairman. I like the idea if we can get the signatures on the phone apps, but the problem is, how long are we talking before we can implement such a program? Right now, it's some of these things are getting bogged down a lot, and mostly some of the veterans and the benefits where they can actually bury or cremate or whatever. So do you have any idea how long it's going to take to implement a program where we could do it by the phone? If not, then maybe we need to do something else.
You know, I don't know. I'm certain I can certainly reach out to Vital Records. I mean, they're the ones that oversee the EDRS system. And so they would be the ones who could answer the questions on where they are, in any of these processes, or if they have planned changes or what's been budgeted or not. And I'm happy to reach out to them, but they would be the ones to have that information.
Follow up, Madam Chairman. Could you please let us know, what you find out, and either, get it to staff or to, us personally, or whatever we got to do. But I think it's important to know, because if not, then we need to look at a BDR or something to make some changes, or maybe look at the board. We're having a lot of problems. Thank you.
Absolutely. Yeah, thank you.
Thank you, Assemblyman. Board, any other questions? Committee, any other questions from anyone? Okay, thank you, Ms. Kent.
Thank you.
So both of these boards are on our work session today. However, there's an actionable agenda item, and I would entertain a motion from the subcommittee to act on some of these suggestions right now. Specifically, I would entertain a motion to send a letter to the Board of Medical Examiners to urge it to communicate to all its licensees through its 1 newsletter, 2 website, and 3 outreach presentations regarding both registrations in Nevada's electronic death registry system and the required timelines for death reporting. Do I have a motion?
So moved.
Someone so moved?
Second.
Chair? Okay. Moved by Vice Chair Howdigay. Anyone else second?
Second.
Second by Assemblyman Ellison. Any questions? All those in favor, aye. Aye. All opposed, nay. And the motion carries. The second recommendation would be to send a letter to the State Board of Health to consider clarifying by regulation who is responsible to sign the death certificate when multiple physicians and/or advanced practice registered nurses have provided care to a patient who later dies. Do I have a motion?
So moved. Vice Chair Howdigay.
I have a motion by Vice Chair Howdigay. Do I have a second?
Second.
Second. No.
Second from Senator Brooks. Any questions? All in favor? Aye. Aye.
Aye.
Opposed? And the motion carries unanimously. Third recommendation is to send a letter to the Nevada Hospital Association to raise awareness of the importance of timely death reporting and the requirements per Nevada Administrative Code 440.160, that all deaths be certified within 48 hours, and send a letter to certain parties to encourage their continued discussion to improve the timeliness of death reporting, including increasing awareness, Senate Bill 291 of the 2017 legislative session, and as it amends NRS 440.470, authorize the attending physician or attending advanced practice registered nurse to initiate the record of death and provide the required information at the time of death. And this letter should be addressed to the State Board of Health, State Registrar of Vital Statistics, the State Board of Nursing, the Board of Medical Examiners, the Nevada Funeral and Cemetery Services Board, the State Board of Osteopathic Medicine, the Bureau of Healthcare Quality and Compliance, Department of Health and Human Services. So all of that is together. Do I have a motion?
So moved. Vice Chair Howdigay.
Have a motion by Vice Chair Howdigay. Second?
Second.
Second, Senator Brooks. Questions? All those in favor say aye. Aye.
Aye.
Opposed? And the motion carries. Thank you. I'm really hoping that what we do, the result of these letters will begin to expedite because, as Assemblyman Ellison just reiterated, a lot rides on these death certificates, especially for families of veterans. It's true for everyone, but in addition to Social Security, veterans' families have to go that extra step so that the things that should be afforded to them upon their death and burial can happen. So I'm really hoping that we can fix this within the next session. So, thank you. Now let's go into our work session. Any questions by the committee members?
Yeah, I do, ma'am.
Okay. Yeah. Can we go back to the
Yeah.
grid? Can we go back to the grid so I can see everyone? Thank you. Zimmerman?
A question, the speaker keeps going on and off on this, but on the number 4, on the item for the cemetery board, service board, it seems like they're having a hard time keeping members. And the other thing is they're not doing follow-up. So if you ask for something to be followed up, we're not responding to this. I don't know if we can get staff to get them to come forward and give us this information. I know we got a board meeting coming up, but I'd like you to be aware that we're starting to see some problems there that's not doing any kind of follow-ups, and mostly for our funeral services for our veterans. And I have a problem with that.
You would like staff to do something and
Well, I think if they let them know that, we're really looking at these boards, and the follow-ups is so important. And if you give them direction, say, hey, we need to know about a certain thing coming up or going on, or trying to get a quorum is almost impossible. So I think we need to put them on notice. We need to watch this and see if they're going to do follow-ups or what are they going to do.
And we probably need to include something on that order with the letter that we send. But for the time being, I believe that the funeral board is still here. Funeral services and cemetery services, they're still here. So please take note of that. And again, I agree with you. This is problematic. The thing that I'm more concerned with is the fact that there are some technical things that are in the process that, if we improve them, would probably greatly truncate the time that it takes to get the death certificate to those who need it, to the families, et cetera. So I'm really concerned with that, and want to make sure that we're looking at that, because whatever we need to do to make sure that that happens, I think that we should. And if that requires a BDR, then we can probably look at that too. So thank you.
Thank you.
Thank you.
This is not a question, it's a statement. I think this is, it's imperative that this issue is corrected, because this is not the time to be dragging your feet with someone when they're going through a difficult time of this nature. And especially for our veterans and people that are dependent on this country, that have given their lives for this country.
So
and that was just a statement. I didn't need to.
That's okay. Thank you, Ms. Brown. So Assemblyman Ellison, in retrospect, I think what you're saying is that what we have voted to do may not cover all the bases, and perhaps we need to include one more action item.
I agree, ma'am. And some of the problems we're having, if they can't get a quorum, they need to get the people off there and get somebody on there that is going to serve. And the other thing is, and when you ask for a follow-up, you're not getting it. There's several that we put in and we haven't seen nothing. So I'd like, what have we got to do? If we got to do a follow-up, they're going to hit the roundtable. Maybe that could be an issue that could go on to the roundtable also.
So would you like to put that in a form of a motion?
Yes, ma'am.
Okay. State the motion, please.
The motion is that this could be considered as a roundtable discussion with the governor's office, and then also that a letter be sent to the funeral the Veterans Cemetery Organization to look at the members that are not been present and try to replace them if possible.
Can we look also at the Nevada Department of Veterans Services?
I agree.
Included?
Yeah, and to amend that to the Veteran Services.
Okay. Okay, committee, you've heard the motion. Any questions? All those in favor say aye.
I think we need a second, Madam Chair.
Okay,
I'll second.
yes, Vice Chair, I'm sorry, Vice Chair Hadigi.
I'll second. I think we needed a second.
Okay, Vice Chair Hadigi seconds. Is there a, oh, we had a motion, Vice Chair Hadigi seconds. Do we have questions? All those in favor say aye.
Aye.
All opposed? And the motion carries unanimously. Thank you. And thank you, Assemblyman Ellison, for that. I appreciate it. Thank you, Ms. Camp, and thank you, Ms. Bradley. Appreciate it. I would just say, given the last item that we approved, that hopefully there'll be some movement on that before we have to take action, so that there would be a more positive report that goes to the governor's office. So with that, let us go now to agenda item number 7, which is our work session. A discussion and possible recommendations relating to terminating, continuing, modifying, or consolidating boards and commissions. We will now start the work session portion of the meeting. Nevada Revised Statute 232B.220 requires the subcommittee to review not less than 10 boards and commissions, each legislative interim, and determine whether the board or commission should be terminated, modified, consolidated with another board or commission, or continued. Please refer to your work session document and the subcommittee's policy analysis. This reading will begin with the first board. And let me say this, I know that there are, because I've received some calls, there are some who are concerned about whether or not there'll be action taken to consolidate, terminate, or whatever with the board. It has been my experience in the last 2 years that the way we've been operating has not been prudent with respect to making sure that the citizens of Nevada are getting the very best service that they could possibly get. And with the way this goes, I would also note that change is usually difficult, but if we have to make changes, then we will make the changes, because our primary objective is to make sure that the citizens of Nevada have the type of access to information, to boards, to processes, policies, and other procedures, to make sure that that is as streamlined as possible, and to make sure that boards are being responsive when people call, when they write a letter, if there are questions or concerns. And then you go back to Assemblyman Ellison's statement earlier, to make sure that if we ask for something, that we get that information as soon as possible. So with that, excuse me, I'm going to ask Ms. Reedy, please begin.
Thank you, Chair Spearman. My name is Jennifer Rudy. I am a Chief Principal Policy Analyst with the Research Division of the Legislative Council Bureau. And it has been my pleasure to serve as the primary committee policy analyst for the Sunset Subcommittee of the Legislative Commission during the 2019-2021 interim. The LCB is a nonpartisan agency, and as such, I neither oppose nor advocate for legislative action. The work session document is prepared at the direction of the chair, and it is uploaded to the subcommittee's webpage for this meeting. While there are 9 members at the subcommittee, as you notice, there are only 6 legislative members who are the voting members of the committee. And as noted by Chair Spearman, the Nevada Revised Statutes 232B.220 requires the subcommittee to review a minimum of 10 boards and commissions each interim to determine whether the board or commission would be, as she said, terminated, modified, consolidated with another board or commission, or continued. In addition to these actions, the subcommittee may take other actions. One of the more common additional actions taken by the subcommittee in past interims has been to send a letter to the board or commission to request certain actions be taken. And oftentimes that includes reporting back to the subcommittee the following interim on any issues of concern that the subcommittee might have. One other important thing to note before proceeding with the work session is that the subcommittee is not authorized to request bill drafts. However, it reports its recommendations to the Legislative Commission, and the Legislative Commission may then choose to submit bill draft requests on behalf of the subcommittee. There were 15 boards, commissions, and councils reviewed by the subcommittee. And in case you were wondering, they are not listed in any particular order on the work session document. That said, I will begin by reviewing the first one listed. The first one listed is the State Board of Parole Commissioners. The 1957 legislature transferred parole functions from the State Board of Pardons and Parole Commissioners to the newly created State Board of Parole Commissioners. The board is comprised of 7 members, and it falls within the Department of Public Safety. The board reported no vacancies at the time of its review by the Sunset Subcommittee on February 21st. This was the first time the subcommittee had ever reviewed the board. However, the board did request, as you'll recall, the form that the Sunset Subcommittee mails out to all the boards and commissions and councils that are to be reviewed includes a question about any requested changes. And there were some requested changes submitted by the board, and they are listed on the work session document. The first is to amend NRS 213.1243. As the board explained, the board establishes a program of lifetime supervision of sex offenders to commence after any period of probation or any term of imprisonment and any period of release on parole. It sets the conditions for lifetime supervision of sex offenders, which is generally the last interaction the board has with these particular cases, unless there is a request to modify a condition of lifetime supervision of sex offenders. In these particular cases, unlike parole, if an individual allegedly violates the conditions of lifetime supervision of sex offenders, a district court judge must determine this, not the board. Therefore, the board suggested it would be better for the district court judge to impose the sentence for the underlying crime, and that the conditions of lifetime supervision be imposed after any period of probation or term of imprisonment and any period of release on parole. If the individual allegedly violates the conditions, he or she appears back before a district court judge, not the State Board of Parole Commissioners. The second requested statutory change was to amend NRS 10885 on or before January 1st of each odd-numbered year. The board is to provide a comprehensive review of the standards adopted regarding risk assessment. The board has used a validated risk instrument since 2003. The parole risk instrument is based on the recidivism measure of new felony convictions within 3 years of release from incarceration. The board contracts with an outside consultant to perform the revalidation of the guideline. The cost to perform each revalidation has ranged from $20,000 to $25,000. The board requested that the statute be amended to require the review every 4 years, which would allow enough time to gather data and conduct a proper review. However, subsequent to its review by the Sunset Subcommittee, the board did reach out and said after further discussion by the board would ask that the review occur at least every 5 years. That would be the second statutory change. And then the third item that they requested would not require a statutory change. It would instead be a letter to the Office of Finance, Office of the Governor, the Senate Committee on Finance, and the Assembly Committee on Ways and Means to request a change to the unclassified pay bill. Specifically, the Executive Secretary position prescribed by NRS 213.1085 is inadvertently being paid at the rate of an executive assistant. At its meeting on April 19th, 2018, the board approved the request to correct the position title to Executive Secretary as listed in the NRS and approved the recommended increase commensurate with the position. However, the change was not included in the pay bill of the 2019 legislature. So the questions that are posed after each board, commission, and council in the work session document do not necessarily require separate motions, but they are listed separately to assist the subcommittee in its deliberations and final action. The questions are, should the board be terminated or continued? And then if the subcommittee recommends terminating the board, should it be consolidated with another entity or have its duties transferred to another entity? And then if the subcommittee recommends continuing the board, does the subcommittee want to recommend any changes concerning the board? And so that is the part where it says if the subcommittee recommends continuing the board, does the subcommittee want to recommend any changes concerning the board? Where you could also include in the motion any of those three or other recommended changes to the board. That makes sense. That's, oh, and I'm sorry, the Krista Rico and Kathy Baker from the state board are also available by teleconference if the subcommittee should have any questions that the board should be answering. Thank you.
Great. So, subcommittee, are there any questions?
Yes, ma'am, I do.
Who's that?
Sorry to be a pain.
Okay.
You know, I went to a couple board hearings in the last year and a half. And as being there observant to see what's going on, problem I see is people travel from all over the state to go in there to listen to what the board hearings got to say, but they do not allow any kind of testimony whatsoever. So even under public comments. So I really feel that that's a situation that needs to be addressed, mostly with a lot of these people from Clark County that have people drive all the way from the rules to go about an issue to see if they'd make parole or a pardon to be considered, but they don't allow the family to discuss in any involvement whatsoever. And I think without that, it creates a problem, and it's not unfair to not only the individual, but the families. And I brought that up with some of the staff down there, and they just said that's the way it is. And I disagree with that. Maybe legal can explain why they can do that. But to me, when people travel across a whole state and sit there and watch it, but yet they can't participate whatsoever.
So is that a question? Would you like a response?
Yes, I would, because if not, then maybe I'd like to get with you about BDR to make that change. But there was a Spanish couple that was there from Las Vegas, and the family's all from Elko. But they went out there, and there was a general or a lieutenant colonel that was there. There was all kinds of individuals that wanted to give testimony, and they wouldn't even consider it. So I'd like to know if that's something that can be changed, or if that's something the board is doing. Maybe you can answer that.
Hi, this is Eileen O'Grady from Legal. There's a specific.
Hey, can you speak up, please?
Okay, sorry. There's a specific exception in the open meeting law for meetings of the State Board of Parole Commissioners.
Ms. O'Grady, your microphone, I don't know if your microphone is turned down or.
Now?
It's a little bit better.
Okay, I'll try to speak louder. There's an exception in the open meeting law for meetings of the State Board of Parole Commissioners when acting to grant, deny, continue, or revoke parole. So that's why they have that exception from the open meeting law.
Madam Chair, may I, through you, I don't think that's sufficient, the open meeting law. I do agree with the assemblyman that that if people feel they need to participate and they put themselves in a position to be heard, that I would like to hear a motion that be changed. And I'm not a voting member, but I would certainly like to see that changed. Because people do change, and if they've made the effort to change and they have support from family members that are willing to help them, then I think it's fair that they are heard.
Madam Chairman, and I totally agree. I think that's so important for at least to get it on the record, why they traveled all these distances. And there's exceptions to everything. Doesn't mean you got to accept it, but there is. And I'd like to see that changed if possible. That those individuals can speak, even if it's for a time limit of 2 minutes or something.
So I guess question would be, Ms. O'Grady, maybe you can answer that because you read from the open meetings law, but it seems to me that if people do make the effort to travel a long distance, and unfortunately, we don't have a 4-lane highway directly from south to the north or versa vice. So the trip is not like, let's jump in the car and get this done in 30 minutes. So how do we accommodate for family members, community members, maybe members of the faith community who would like to say something on behalf of the currently incarcerated person? How do we make allowances for that? What do we need to do?
Eileen O'Grady again. I mean, you can amend the exception somewhat, or perhaps, I mean, maybe the board could give some reasons why that exception is there, because it's there. I mean, there are very limited exceptions to the open meeting law, and I'm not sure how long that one's been there, but it's for a purpose. So maybe they can respond to that.
Okay, so if we can amend it, then that seems like it's probably the best course of action.
Madam Chair, could we hear
Yes.
from I believe Ms. Rudy said that we have people from the board here, right? Could we hear from them? I'd like
Sure.
to know why it was changed to that, because I agree. I think that, I mean, if our open meeting laws are there so that people could participate, so we shouldn't be limiting their participation. Their voice should be heard. So I'm curious as to know why that was changed, why they made that exception. Could we hear from them? Is that okay?
Yeah, oh, yeah. And just before they answer, let me just say this. If we need to amend it, if we take a motion to amend it today and there are other areas that need to be covered, I just want to make sure that whatever we do today, we can make sure that we cover the entire spectrum of Assemblyman Ellison's question and Ms. Brown's comments. So we have someone from the board here today.
Madam Chair, while we're waiting, can I just add to the question? And that is simply whether or not they have the authority to allow the testimony or the comments irrespective of that exception. I suspect that they have the authority to take testimony or comment from anybody they choose, even though that exception might exist. Maybe Ms. O'Grady can answer that question.
Yes, I agree. I mean, they have an exception, so they can handle it however they want to handle their meetings.
Madam Chairman?
Yes.
Yeah, and I didn't see that. I seen that I never seen a board that was actions the way it's taken. So I know they could probably do that. But when you got somebody that's a lieutenant colonel that leaves and drives 5 hours one direction just to say a couple words and denied, they wouldn't even bring it up for discussion. So I think it's got to be an issue that says that, if there's a comment period, with a limited time, I think that should be discussed. But just to deny or not to even bring it up, I think that's unjust.
I agree. And let me,
Madam Chair,
yes.
this is Chris Dorico with the Parole Board. I'm sorry, I hit a wrong button here, and I might be able to provide some information for the subcommittee, if you would so like, or answer some of these questions in order to assist all of you.
Yes, please.
So I hear who I believe to be Mr. Ellison speaking about the testimony by a supporter of an inmate at a parole board hearing, which is different than a parole board meeting, which those follow under open meeting law. But with regard to the testimony, we always, and I'll say this, always allow at least one supporter of the inmate to speak. In fact, we have a documentation what's called the Parole Hearing Participation and Testimony for Victims and Supporters that we even revised July 31st of 2019, which talks about victim and supporter testimony. I'd be willing to share and provide that documentation to all of you at the conclusion of this meeting. But we generally limit the number of persons speaking in support of an offender to one spokesperson. And we generally ask that inmate and give them the opportunity to ask them who that individual they would like to speak on their behalf. Certainly if we have 5, 10, 15 people a hearing on an agenda, which we may have scheduled of, let's say, generally somewhere from about 12 to 15 individuals, and let's just take an afternoon session. If we had multiple supporters going, providing testimony, we would not get through our agenda. But we always do that, and in fact, to even provide verification of that, all of our parole board hearings are video recorded, and you can go through it, and anybody can ask for a copy of any of the parole board hearings and view that, and you will see supporters, if there are supporters there that want to provide testimony on their behalf, and also victims. But we never deny anybody being the opportunity to speak on support of the inmate, but what we do is we ask that to be limited to one person to speak on behalf for that inmate. And according to statute, you know, it mentions a representative, and that we include that to be supporters. Sometimes it's an attorney, sometimes it's an attorney and another family member that we allow to speak. So I think there may be some confusion here, because I can tell you wholeheartedly, we always allow at least one supporter of the inmate to speak.
Senator Ellison?
Thank you, Madam Chairman. You know, sitting through there was probably about 7 or 8 people from all around the state on this individual. When I got there, I asked who spoke or who's going to speak, and they said nobody's allowed to. And so after the thing's over, we talked to some of the staff outside. So maybe what it needs to do is the parole board needs to let these guys know that one individual could speak and in groups like that. But I didn't see that. And like I said, I was kind of disappointed when somebody travels that kind of distance. Somebody should be able to get up and speak in favor or in opposition of the hearing. But in that case, there was a lot of people there, and it was like slam dunk, get in. We already made our decisions and walk out the door without any kind of community support. And I think that kind of bothered me the most. And I think if you do this, I think that the public needs to be aware when they walk in the door that they can have a individual speak in favor or opposition, whatever it is. But I did not see that, and I apologize. But I tell you, I never seen a board. It was cut and dried before you walked in that door. So,
Madam Chair, may I also respond to that?
Yes, yes.
Okay, so when to respond through you to Mr. Ellison, so when any supporter or any victim reports to our office for a hearing, we have paperwork that they fill out at our front windows, and they indicate whether they are here to provide, they are here in, I'll say, in support of an inmate or as a victim of the inmate. And those supporters, we get large groups at many times, and we get small groups, and sometimes we have no groups. But those individuals are always asked who wants to provide that testimony. And in fact, if we go through on the record, we indicate who is generally there on support of their behalf, because sometimes if we get a large group, we might say we're not going to read off the list of every name, but there's a large, there's a number of people here for support. So they fill out the documentation, and then the board member always asks, there are, 5 people in your family here that are here for support on your behalf. And if you would so choose, would you like one of them to speak on your behalf? And so they always have that information as well. I know Mr. Ellison said he showed up late to this particular hearing, but I would ask you to reach out to me after in the coming week and give me that particular inmate case, and I will provide you with the video of that case to hopefully to show you. I don't know which case you're talking about, but I can provide that to you and see what transpired from there. So they fill out paperwork. At least one supporter is allowed to speak. They speak for the group, and then so that is I mean, it's always followed. I mean, so the one thing I would say though is this is why letters of from the families, letters, documentation, all of those things that we encourage people to submit are so valuable to have, because then we have all of that. There's more than one way to support an inmate rather than just a testimony over a couple minutes of time. And the supporter statements I've seen go anywhere from 15 seconds to several minutes, 10, 15 minutes. So it's kind of dependent upon the case, but I can tell you, if you would like to reach out to me on that particular case, Mr. Ellison, I would be more than happy to make sure that you get a copy of that hearing.
I appreciate that a lot, and then maybe we can see where the ball fell down or whatever. But I know that everybody signed in, and I thought at that point in time they told them no one was allowed to speak at that hearing. So that was walking in the door.
I'm sure
Let's check and see.
Yeah, I'm sure everybody signed in, but certainly they would not have all been able to speak in support. We allow one supporter for the inmate.
Thank you.
You're welcome.
Madam Chair, this is D. Edward Cheney. From a pastoral standpoint, how would a minister be able to do that? I know one person speaking is one thing, but how would a pastor or minister on behalf of an inmate, how does that play? And is that allowed, or how I guess I'm not framing the question correctly. I just want to know if somebody has a spiritual leader, a spiritual support, how would they be able to speak on behalf of the inmate?
Chris Tirico with the parole board. So they would be able to speak just like any other supporter. We don't define what the supporter is, whether it's a family member, a friend, or anybody else for that matter. So if this clergy were there that wanted to speak on support for that inmate, and that clergy was there solely, let's say they showed up alone, they would be that one supporter if that inmate wished for them to provide that testimony. If it was the member of the clergy along with 4 family members, they will the inmate will indicate who he would like to speak on their behalf, or the group generally comes up with it and says that who will be speaking on their behalf. But they're all there in support, and that's noted by the board, and they've all signed in, and we do know how many people were there in support of a particular inmate. So we wouldn't limit that supporter. That's considered a supporter, just like any of the family or friends.
So it's not one in additional, it's just a one. Okay, I got it. Thank you for the clarity.
You're welcome.
So then I have a follow-up. That's a good point, Pastor Cheney. So I have a follow-up because sometimes what's happening during that hearing can directly affect what happens with respect to how the newly released person re-enters into family, neighborhood, etc. Is there a problem distinguishing between a spokesperson and someone's faith leader? Can there be a distinction? Can there be, because many times when people are going through that, I know as a former pastor, I always get called. Can you come and speak, or can you write a letter, or can you do something? And so from a pastoral perspective, the pastor can offer some remarks with relation, with respect to who the person is, perhaps even some of the background and what support that person may have on the outside from their faith community.
Madam Chair, this is Chris Rico with the Parole Board. So if we look under subsection 10 of NRS 213.131, it states, during a meeting to consider a prisoner for parole, the parole board shall allow the prisoner, A, at his or her own expense, to have a representative present with whom the prisoner may confer, and B, to speak on his or her own behalf, or to have his or her representative speak on his or her behalf. And that is what we're doing here. And so if you're looking for some type of change, it would be under subsection 10 of 213.131.
Senator Ellison, that appears to be probably the best place to make the change, to offer some distinction. And if we look at this from a societal point of view, and what we already know to be true in the criminal justice system, poor and BIPOC communities are overrepresented in the prison system. Black, Indigenous, and people of color, and people who do not have financial means are overrepresented. That's not saying that everyone in is innocent, everyone out is guilty. That's not saying that. I'm saying this is what the statistics show us. It is disproportional representation. So from the standpoint, if we look at it through that lens, there may be something that the faith leader might be able to offer, and something that a community representative may be able to offer. And in your instance, Senator Ellison, perhaps it would be that lieutenant colonel, and I'm a little partial to them, lieutenant colonels. I was one at one time. But I think if there is a way to look at this without a protracted hearing, and without unlimited numbers of people speaking, it's important from the faith community's perspective, and it's important from a community perspective. And perhaps the change that we could make would be in allowing, just like we do in public comment, someone from your faith community, someone from the community, and a family member, no more than 3 minutes.
I totally agree with you 100%, Madam. And I'm looking from the outside in, and when you've got people traveling all over, and say you had his attorney there and his clergy there, and then one member of the family and limited, I don't know if that's too much, but there was 2 people on that hearing all day, and it took these people 10 hours to get there and get back, not counting fuel and eating or whatever, and not allowed to. Maybe we misunderstood, but we were told that they wouldn't be allowed to give testimony. So that could have been a misunderstanding, but under the circumstances, I think we still need to address this. And I'm somebody of faith also, and I think if I was in that position, I'd love to have my pastor up there speaking, but I'd like to have my lawyer also. So there's issues that every one of these cannot be just rubber stamped. It's got to be something that they should be able to look at individually, and what it brings to that individual that's in prison trying to get out, or that is trying to get off parole. And I think that's important, because that's going to depend on what their life's going to be going forward. So thank you very much, and allow me to speak for that.
Thank you, and thank you for bringing that up. I think this is an important part, and I won't belabor this, but I do know not so long ago I was contacted by the mother of someone who was up for parole, and I had been their pastor when the person was in their preteens, and there were some issues that were beyond the mother's control or the inmate's control that contributed to the charges that were brought against that person. Sometimes we call it adverse childhood experiences that make people act out in different ways. And at that time, I was able to provide some information about the setting in which that experience took place and how, in my professional opinion, probably led to some of the things as to why the person was incarcerated. So my proposal would be to amend your motion to say, instead of an unlimited number of people speaking, identify some categories, and there's a phrase that I always use, but not limited to. So perhaps we could say faith leader, community member, and family member, but those first two categories aren't set in stone, but it would allow people who have information on the person's background. And especially when you're talking about people who are coming from economically challenged conditions, all the time appearing before court or any type of institution can be unsettling and unnerving. So to have someone there that could basically be spiritual or moral support. So if we can look at that, and Ms. Brady, I don't know how we would phrase that, but if we can include someone from their faith community, spiritual advisor, and a community member, and then, someone that that other person might be, maybe it's a family member.
Madam Chair, it's Hannah Brown. I don't know that we need to be concerned about specifying who would be the speaker if we just give them, say, 3 speakers with with 3 minutes. I mean, you're only adding 10 minutes to whatever the presentation is, and hold them to the 3 minutes. You can say a lot in 3 minutes, and let the person, let the family person of whoever the people are, decide who they want, because I can't believe a lieutenant colonel would really jeopardize his reputation by making statements that he did not feel were accurate. He or she did not feel were accurate. So I would certainly want a lieutenant colonel speak for me. I'm not familiar with the process. Thank God I've never been in a position to have any knowledge of it. But I would certainly think to add to allow 3 people of their choosing to speak for 3 minutes. I mean, we're only talking about 10 minutes, and if someone is in a life-changing experience having at that time, I can't believe that 10 minutes would be an inconvenience for the board.
Yeah, Chair, this is Vice Chair Howdiggy. I agree with Ms. Brown. I think maybe not specifying, but allowing for 3 people, just because, for example, if it was, somebody from the faith-based community, somebody from the family, and then somebody from the community, what if there was like 2 people from the faith-based community that wanted to speak, on their behalf, or, 2 family members, and then maybe a doctor, nobody from the faith-based community? Or I think we should just leave it open and broad, then that way they can choose the best people to speak on their behalf. But I agree, I think we need to open it up to more testimony.
Because we're talking life-changing here, and these comments could make a difference on whether that person's life is going to change for the rest of their life.
Madam Chair, this is Chris Tarico of the Poll Board. May I add to what Ms. Brown said there?
Mm-hmm.
And those are all very good points that Ms. Brown brings up as well. And so just so that you know, we get and I will say this, a great deal of letters of support for an inmate. While we may, let's say at a particular hearing have, in a particular case, 1 or 2 people show up for a hearing, we may receive up to 10 different letters of support for that inmate, which we consider prior to making a decision as well. So there are other alternatives for those supporters to make their statements, to have them heard. And written testimony is actually to me, it is almost more valuable because that stays with the file and is able to be passed around to the chairman. I'm not sorry, not the chairman, but the other commissioners that will be voting on that particular case, and it's right there in the file, easy to read and have right in front of you. To follow up on what Ms. Brown said also, so if we were to have 10 more minutes of testimony with 13 cases that day, that would add over nearly 2 hours of extra time on a case, which would then likely require us to shorten our agendas with the number of people to be seen in a particular day or afternoon or morning, because we wouldn't know how many people are going to show up on support for an inmate that wants to provide verbal testimony. So I know 10 minutes, I don't disagree, it's not a long period of time for one case, but cumulatively it is, which would require us to likely minimize the number of cases we could see per day. And so I just want to throw that in as well. But certainly I am not opposed to having any others speak. In fact, you know, we can impose time limits if we need to on this. We generally we don't you know, have to. And what we've seen, you know, or what we don't want to have happen is the same supporter testimony, the same things over and over, where that's why the one representative of the group who speaks for that individual can go on verbal testimony, but all the rest of it, everybody else that wants to, 10, 20, 30, 40 people, can also submit letters of support for that particular inmate. And so I hope that is a little bit more helpful to this subcommittee.
Madam Chairman, can I answer that? It doesn't mean everybody's going to speak at every individual, but the problem is that, you know, I worked with Harvey Lunsford on some of these issues a long time ago, and to me, he was a leader when it come to trying to address some of these situations in front of the parole hearing or board. But I think even you know, if you say you cannot, nobody can repeat, just like we do any other hearing. But I tell you, you might have somebody in there that can bring something to the table that might not be heard otherwise. And I know a letter, sometimes they read them and sometimes they don't. But I'd really like to take this under advisement or consideration, because I think it's important for those individuals. That might be 10 minutes to them, but it's a livelihood to these individuals. Thank you.
Madam Chair, this is Skip Daly. I had a question real quick, just for the parole board guy. So is there on the other side for the victims, are they similarly limited to one currently, or how does the balance on the other side work? And of course, if you're expanding on one side, you got to expand on the other, and now you're 20 minutes of hearing, just a consideration. So what happens on the other side for the victims if they choose to speak?
This is Chris Dorico for the parole board. So the victims on the other side, what controls the victim testimony more than anything is the recent passage of Marcy's Law, and which is now a part of our Nevada Constitution, and it indicates that any person directly and proximately harmed by the commission of a criminal offense under any law of this state, if the victim is less than 18 years of age, well, I'm not going to go into the whole statute, but it defines who a victim is, and also through NRS 213.005 to include a governmental entity, a person who's been injured or killed as a direct result of a commission of a crime, certain relatives, spouse, natural born child, grandchild, brothers, sisters, parents of a spouse. So they are enumerated more so, and so they are allowed to provide, any victim that is defined by statute in here is allowed to provide testimony.
Thank you. So that answers the question. So this would bring even more fairness to the other side. So
I'm sorry, was that a question or just, I just heard a statement? I wasn't sure you needed me to respond there.
No. It was just a statement that allowing supporters of the victim to have similar or equal time to the supporters of the inmate have similar or more equal time to the victims, which are enumerated in various things. We can talk about Marcy's Law all day, but let's not. Anyway, that answered my question. Thank you.
You're welcome.
So what's the pleasure of the committee? Because I understand, but I think one of the things that could happen is to, before the hearing, make sure that everyone has a copy of the proceedings, make sure that you put it online, just like we do. This is the amount of time that someone has to speak, and move on from there, because I think, as I said, I think that it is important to have some other people to be able to speak. Now, you're right, Vice Chair, we don't need to specify, but it's probably important. And I think the point that Ms. Brown brought up, that we're talking about 10 minutes. What's the pleasure of the committee?
Madam Chair, this is Skip again, if I can. And now just thinking full circle on what we just said. If I heard the testimony correctly from the parole board, was that they're allowed one speaker now. And I didn't hear that they put any type of a time limit on that. Maybe they have a 10-minute or a 15-minute. He said people go 15 seconds, sometimes they go 15 minutes.
Say again?
So I didn't hear a limit on that. But I think if we allowed 2 additional speakers, and people can figure out who that is, and allow them to for 1 speaker without a time limit, or under the circumstances they have now, and limit the additional 2 speakers to 2 minutes, I think would address everybody's issue. But the main speaker would have been able to speak longer. I don't think we should try to limit him here, unless there's a limit on all of the speakers on both sides. That's just my thought. Thank you.
Madam Chair, this is Senator Brooks. So really all that they have is an exemption from the open meeting law, period. Everything else is handled in how their policies and procedures as an agency. And so I'm just curious, are we proposing to change their exemption from the open meeting law, or are we proposing to with some level of specificity put in statute how they handle a particular meeting? I'm confused because there's other issues associated with the open meeting law that are far beyond this that might have legitimate reasons. So before we move forward with any type of motion, I would want to hear from the agency on whether or not there's a change in the open meeting law and how that would affect them other than this one type of a hearing.
Senator Brooks, this is Eileen O'Grady. There is a statute, NRS 213.131, that puts forth some requirements for these meetings for parole. So that is where there is a requirement about who can be a representative.
Ms. O'Grady, what was that statute again?
It's NRS 213.131, and it was subsection 10 that the commissioner was referring to.
Thank you.
So Senator Brooks, I don't believe we're talking about altering the open meetings law. I think Assemblyman Ellison's question was more to the point of, is it possible to expand the number of people that are there to testify? So it would really just be specifically to this particular entity. So the open meetings law would stay intact, but just for this particular entity. Ms. O'Grady, do I see you shaking your head yes?
Chair, it's Vice Chair Howdigy. I wanted to add something because Assemblyman Daley brought up a good point that, by making this change, allowing for more people to come in and testify with a limited time. So we'd be allowing for 3 people at 3 minutes each. I want to make sure that if someone only has 1 person testifying on they don't have 3, that they're not limited to 3 minutes. What if, they only have a pastor, or they only have an attorney, or they only have a lieutenant colonel coming to testify on their behalf, but they're limited to 3 minutes? I don't want that to be the case. Maybe instead of allowing for the number of people, we should allow a time. I'm not sure what the correct way would be to go about this, but maybe instead of saying, 3 people at 3 minutes, we just allow for 10 minutes of testimony for each person. And that way, as many people or as few people could testify in that time frame. I don't know if that's the right way to go about it, but that's also one of the concerns, that just came up when Assemblyman Daley made his comments. Some people might not have 3 people testifying on their behalf. They might only have 1. And if we make this change, then that 1 person might be limited to 2 minutes or 3 minutes.
Madam Chair, this is Hannah Brown. I agree with the Vice Chair because I guess I'm understanding the way they have it now, the way the rule reads now, there are no time constraints. But then if they were allowing, say, 15 minutes, then I agree with her that, and it has to be fair on both sides.
Any additional comments?
Yeah, Madam Chair, I think we planted the seed. We just got to figure out where the tree is going to grow. It's important, I think, that that both sides have the right to speak, but not allowing individuals to speak that could bring something to the table, that is unjust. And I believe on both sides, not just one side, but both. And that's why I think it's so important that this discussion has been made in what we can do to try to fix it one way or another, and working with the parole board or whatever. But not allowing, I think, is more unjust. But like an attorney, they'll go on forever. So I agree that also. So whatever we can do to try to come to equal terms to where these individuals have some kind of protection. Because I tell you that some of the testimony that was in that hearing that could have been brought to the table would have changed the whole outcome on what happened, I believe. So thank you, Madam Chairman.
Thank you. So let me offer a different amendment, which would be, instead of changing it in statute, change it in regulation. So it would still be up to them. We would still be able to get a certain amount of time allotted, if it's 15 minutes total or whatever that is, but to certainly be able to include more than 1 person, but for a specified time period. If I'm hearing what Vice Chair is saying, Ms. Brown is saying, what Assemblyman Daley is saying, and you, Assemblyman Ellison, it seems that instead of changing anything in statute, let's look at an administrative code.
Madam Chairman, this is Terry Rankin. Eileen can maybe help us out with this, but I think they're exempt from regulations under Chapter 233B of NRS under the exemptions. So I think alternatively, and Mr. DeRico can probably say, they probably have practices and procedures, but I don't think they adopt regulations. I think they're exempt from that.
You're right. You're right. You're absolutely right. So that's okay. No.
Madam Chair.
I like to have really smart people around me. It keeps me from messing up. So thank you. Someone said yes.
Yes, Madam Chair, I was going to raise the same point and maybe suggest that rather than create directives that we ask the board to come back with recommendations for how to address the issue. And then we can do it at a future sunset meeting or during the next session. I think that would, because this is new, this is a work session, it might give us the opportunity instead to really put our minds together and figure out the best way to approach it.
I agree. Anyone else? Someone, Allison, this started with you. Are you okay with that?
I think that's a great idea. And what we're not trying to do is reinvent the wheels. We're trying to make sure it goes around. But I think that's perfect the way that was presented, and that's a good idea. And we might get some great answers back from the parole board. So thank you.
Thank you. Vice Chair, did I see your hand? Anyone else have comments, questions?
Madam Chair, this is Chris Rico again with the parole board. Just if I may, on that last recommendation, may I add to that as well?
Yes.
So, and I throw this out in full transparency here. On the week of September 14th through the 17th, I will be down in Las Vegas conducting parole hearings with the commissioners there. And I would welcome any members of that subcommittee who may be available to come in and sit and just to personally see for any amount of time during that week. Ideally, Monday and Wednesday would be the best days because those are the hearings that I know I have scheduled those days. And so that we can all kind of see and kind of get online together and work collectively and see so that whoever wants to can see hearings live and in person. And that way we can come to a global recommendation on this. So I wanted to offer that out to the members. And as well as any up north, our meetings are open to the public, are welcome to come up north as well. I just know that I will be down there in Las Vegas that week. So if anybody wishes to sit in with me on any of the hearings that we're on, please feel free to reach out.
Okay, that sounds like a good suggestion. Ms. Reedy, where are we? I think we were at a motion. I'm not sure whether we're in Chicago or LA. Can you please tell me our grid coordinates?
Okay, Senator Spearman, this is Jennifer Rudy again. Where we are is we have not made there has been no motion yet. There were 3 items on the work session document that had already been requested by the board, and those are on the work session document. 2 of them require a BDR for a statutory change, and then the 3rd one is the letter regarding the change to the unclassified pay bill. If this item that Assemblyman Ellison has brought up today, if that isn't acted on today and there is a BDR during session that includes these first 2 provisions, I don't know, maybe Eileen can speak to this, but there is the possibility, as you know, to amend something into a BDR in this chapter 213 potentially. I'm not sure if the committee is not taking action on that recommendation by Assemblyman Ellison today. But the only 3 items on the work session were just the ones enumerated here, the 2 statutory changes and then the letter. And most importantly, the committee needs to make a vote to terminate or continue. And then if it is to continue, the board then determine whether or not they want to go ahead and accept those 2 statutory changes and recommend those and the letter. So that would be terminate or continue. And if it is to continue, would that be with those 3 recommendations or not? Thank you.
Okay.
Madam Chairwoman, this is Terry Rankin. When you had your meeting reviewing this agency, I met privately with Mr. DeRico on the 3rd item, the letter. Since about the early 1990s, there's always been a provision in the transitory language of the unclassified pay bill saying if we forgot somebody, an agency can come to the Board of Examiners and have an allocation of money. And I forget, Ms. O'Grady can look it up, but I can't remember if it also went to interim finance and then the Board of Examiners. And that was because during the chaos of a session, sometimes a bill adding a position wouldn't show up. And the only way to pay the person to do the new job was to somehow get money appropriated. So in the interim, before the session, I think the letter is appropriate on the money, but there may be a way to increase the pay until the next session when there's an unclassified pay bill. So I just wanted to let you know that.
This is Eileen O'Grady. I think the issue is there is a salary in the unclassified pay bill for this position. It just isn't the right one. And that transitory section in the unclassified pay bill is just to have, add a position that was forgotten, not to change an existing salary. But I can take a look at that.
Additional comments? Why don't we do this so that we can move on? Let's, can we push the pause button on this? And Ms. O'Grady, you come back and let us know what the statutes say or don't say. And we'll move on to, I know that Senator Pickett has a court hearing that he's got to get to. So let's put a pause right here and we'll pick it up after we have all of the information. And if we have to do a BDR after it's been studied and make sure that it's fleshed out with all of the stakeholders, then I'm amenable to that as well. We'll do the best thing for all parties concerned. That's what I want to get to. Okay.
And Madam Chair, I think Assemblyman Ellison did make a motion.
Yes.
That's my recollection. So we probably ought to either have that withdrawn, amended, or dealt with in addition to these three.
Yeah. Well, let's do this. Assemblyman Ellison, are you okay with withdrawing the motion for now? And let's come back to it once we have a little bit more information from our legal team.
I totally agree.
Okay, all right, so you have to make that motion.
I moved that we withdraw the motion and that we'll wait for staff to come back with recommendations.
Okay, all right, thank you. So we're in LA now, or Chicago, we're someplace. Let's move to item number 7. That's the Real Estate Commission. Correct?
Madam Chair, if I may, I was just alerted that we're next in line in a stacked calendar, so I've got to drop off pretty soon here. If we could hold off on 7 until after I return, if the chair we had talked about.
We can do that. We can do that.
My comments. Thank you.
Yeah, we'll do that. We'll go back in order. This is just like being in session when everything changes all the time.
Thank you, Madam Chair.
Let's go now to the Nevada State Board of Veterinary Medical Examiners.
Okay, Chair Spearman, this is Jennifer Rudy, Committee Policy Analyst. The 1919 legislature created the State Board of Veterinary Medical Examiners, later renamed by the 1960 legislature to add Nevada to the name of the board. Since 2013, the board has consisted of 8 members, including 6 licensed veterinarians, 1 veterinary technician, and 1 member representing the general public. Specific eligibility criteria set forth in statute. The board reported no vacancies at the time of its review by the Sunset Subcommittee. The board enforces Chapter 638 of NRS to ensure practitioners of veterinary medicine in the state are educated, licensed, and practicing within certain standards. The board oversees the issuance of 8 types of licenses: veterinarians and diplomats, licensed veterinarian technicians, veterinary technicians in training, euthanasia technicians, animal chiropractors, animal physical therapists, facilities, and equine dental practitioners. The board issued 2,643 licenses in 2019. The Sunset Subcommittee reviewed the board on June 30th, 2020, and the board did not request any statutory changes from the subcommittee. Previously, the subcommittee had reviewed the board on March 27th, 2012, and on April 27th, 2012, had voted to recommend the board's continuation without any suggested changes. Jennifer Pedigo, the executive director of the board, is available by Zoom if the subcommittee should have any questions for the board. But the questions before the Sunset Subcommittee right now are, should the board be terminated or continued? And then if they choose to terminate the board, should it be consolidated with another entity or have its duties transferred to another entity? And if the subcommittee recommends continuing the board, does the subcommittee recommend any changes concerning the board? Thank you.
Committee members, any discussion? Can't see everyone, so I guess no discussion? Right, Wes?
I can make the motion, Chair, if you'd like.
Mhm,
Okay.
please.
I move that the subcommittee recommends continuation of the board with no further recommendations.
I'll second that.
Okay, so we have a motion by Vice Chair Howdy and a second by Senator Pickard. All in favor?
Aye.
Aye.
Opposed? So the motion carries unanimously. And to be clear, that motion was to incorporate all of those recommendations into one, for those of you who may be listening by phone. Thank you. Thank you. So we'll go now to the Board of Athletic Trainers. And if there's anyone that's holding on and wants to know what the agenda might look like, we're going to try to plow through until about 11:55 and then break for lunch. For about a 20-minute lunch and then come back, okay? So we'll plow through until about 11:55. Board of Athletic Trainers.
Thank you, Madam Chair. This is Jennifer Rudy, Committee Policy Analyst. The 2003 Legislature created the Board of Athletic Trainers, which consists of 5 members, including 3 licensed athletic trainers, 1 person duly licensed as a physical therapist and an athletic trainer, and 1 member representing the general public. Specific eligibility criteria set forth in statute. The board reported no vacancies at the time of its review by the Sunset Subcommittee. The board enforces Chapter 640B of NRS to ensure practitioners of athletic training in the state are educated, licensed, and practicing within certain standards. Section 10 of SB 186 of the 2019 session authorized an athletic trainer who is qualified to perform dry needling pursuant to regulation to do so under the direction of a physician. The Sunset Subcommittee reviewed the board on June 30th, 2020, and the board did not request any statutory changes from the subcommittee. The Sunset Subcommittee had previously reviewed the board in March of 2012 and on April 27th, 2012, voted to recommend the board's continuation without any suggested changes. Again, Michelle Cothran, the executive secretary of the board, is available by Zoom if the subcommittee should have any questions for the board. And the same questions for the board are, should the board be terminated or continued? And if it is to choose to terminate the board, should it be consolidated with another entity or have its duties transferred to another entity? And if it is to continue the board, are there any recommended changes concerning the board? Thank you.
Committee, what's your pleasure? I'll entertain a motion.
I'll make the motion, Madam Chair. I motion that the subcommittee recommend continuation of the board with no further recommendations.
Thank you. I have a motion. Do I have a second? Second by Daly. Was that a second, Assemblyman? Okay, second by Assemblyman Daly. Any questions? All those in favor? Aye.
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 Opposed? And the motion carries unanimously. Thank you. We'll move now to item number 4.
Okay, thank you, Madam Chair. This is Jennifer Rudy again, Committee Policy Analyst. The 1909 Legislature created the State Board of Embalmers, which was ultimately renamed the Nevada Funeral and Cemetery Services Board by the 2013 Legislature. The The board is comprised of 7 members, including 2 funeral directors or embalmers, 1 operator of a cemetery, 1 operator of a crematory or direct cremation facility, and 3 members representing the general public. Specific eligibility criteria set forth in statute. The board reported no vacancies at the time of its review by the Sunset Subcommittee on June 30th. During the Sunset Subcommittee's review of the board, some of the issues discussed were a need to clarify legislation passed in 2015, that was SB 286, to authorize fingerprint-based background checks. The board reported that Nevada's Department of Public Safety and the Federal Bureau of Investigation have not allowed for the checks because the language within the legislation does not comply with the FBI's requirements. However, we've been advised that Bill Draft Request number 18 submitted for the 2021 session has been requested by the Legislative Council to address statutes related to background checks. A need to eliminate, the second item was a need to eliminate the requirement in subsection 3 of NRS 642.080. So this would be a statutory change for 60 semester hours or 90 quarter hours of non-mortuary science coursework from the requirement for licensure as an embalmer. According to the testimony from Jennifer Camp, most states simply require graduation from a mortuary science program. And the third item on here is a need to reduce the delays in death reporting, which was discussed in the previous agenda item. And my apologies, but I also noticed when I was reviewing my notes last night that I omitted another concern raised by Ms. Cant during the subcommittee's review of the board. And it is one specific to communities near state borders. She had explained during her testimony, for example, that the closest funeral home to Laughlin, Nevada is located in Bullhead City, Arizona, another state. So a decedent may not leave the state without a permit. And Ms. Cant had noted that a legislative change to facilitate the use of the closest funeral home, even if it is across the state border, would be appreciated by residents of Laughlin and other communities along the state border. So I apologize, that was not in the work session document. I just noticed it when I was going through my notes again last night. The Sunset Subcommittee reviewed the board in a prior interim on June 5th, 2012. The subcommittee recommended that interim to transform the board into an advisory board and transfer its duties to the Department of Health and Human Services. However, the recommendation resulted in AB 494 of the 2013 session, and the bill was amended prior to final passage to change the name of the board, terminate the service of existing board members and staff, require the appointment of new board members and staff, and require quarterly board meetings, and require the board to provide regular reports to the Sunset Subcommittee just until the 2015 legislative session convened. So there are the same questions for this board. Should the board be terminated or continued? And if it's terminated, should it be consolidated with another entity or have its duties transferred to another entity? And if it should be continued, does the subcommittee want to recommend any changes concerning the board? And again, Jennifer Cant is available via Zoom should the board have questions or should the subcommittee have questions for the board. Thank you.
Thank you. Any questions or comments? Committee members? We'll entertain a motion.
I can make the motion, Madam Chair. I move that the subcommittee recommends continuation with the board with no further recommendations.
So, and to clarify, we're going to include the one that's not written, but we know that that was a recommendation in terms of being able to transfer a body across state lines if that's closer.
Yes, correct. So just the recommendation and no other recommendations.
Okay. Right. So do I have a second? Second from Assemblyman Daley. Any questions? All those in favor? Aye.
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 All opposed? And the motion carries unanimously. Thank you. Moving now to item 5, Board of Medical Examiners.
This is Jennifer Rudy, Committee Policy Analyst. I just want to make sure for Eileen's sake and mine that the last motion on the funeral board did include the change. So it was to continue the board and to accommodate the request for the change that I mentioned, that if the decedent dies in one state and they use the closest funeral home, sorry, and then also the non-mortuary science coursework. So those two recommendations.
Yeah, yes, ma'am. And to state the motion was basically to include that, to do the ones that are written and to include the one about crossing state lines.
Okay, perfect.
Is that correct, Vice Chair?
Correct, Madam Chair.
Okay.
In clarification, we also discussed bringing back some recommendations that we presented earlier, that might come back as a BDR or maybe subsequent changes at the legislature. Is that correct?
We did not include that specifically, but I believe we probably can. You're talking about in our earlier discussion, what we discussed 2 hours ago. All right, is that correct, Zimmerman?
Yes, ma'am. I think it's important because if we can't get to some kind of consensus, then we're still going to have to address the issue of getting these things faster and either by remote or whatever we're going to do. But I just don't want to close it and then thinking that we're done. And I think that's important if we have to bring that back.
Okay. So we're not done with number 4 yet. So Assemblyman Ellison, you want to make that motion?
How do you want to address that? That is open-ended and make a motion that with the clarification back from the Funeral and Cemetery Service Board on issues that was brought up, that we can address this either at a later date or see what the board brings back to us. How's that?
That sounds good. And I have it written on my paper, but I just wasn't looking at it. I've got two computers going. So that sounds good. Are there any questions on the motion that's currently before us? Okay.
Madam Chair.
I'm sorry?
Oh, Madam Chair, could I just ask for clarification on what Assemblyman Ellison is asking for? Because during the last discussion, I know he brought up something about quorum and the board not being able to hold meetings due to quorum. I wasn't sure if he was talking about us or the Veterans Cemetery Commission. We haven't had any quorum issues with our board. We've had 2 meetings that were rescheduled. The first one due to COVID and trying to settle out 3 different cases. We pushed the meeting out so that those cases could get settled prior to having the board get together. And then our August meeting is getting pushed out because we have some new facilities opening in Las Vegas, and we never want to hold up the businesses opening. So we just try to hold those meetings to coordinate, how we can best serve getting things approved in a timely manner. It's not because of having any quorum issues. So I just wanted to make that clear because I wasn't sure. And I know Assemblyman Ellison, you were wanting me to get more information from Vital Records, I think, on the EDRS system and whether where they are in trying to get those to mobile phone apps or on Mac computers. Was there something else you were wanting from my board?
Madam Chairman, may I answer that?
Yes, please.
Yeah, you're totally correct. There are 2 issues here. One was the Veteran Cemetery and not following up, having problems with their the quorums and trying to get full meetings going. That's one issue. The other thing is we got to try to fast track some of these individuals by either getting an app on a phone that they can sign or something. But we're having issues back in the rural areas with doctors that are coming in visiting and not getting these things done, and that's creating a problem. So One is the app to see if we can fast track these, mostly for visiting doctors for our veterans. And the other one was the veterans cemetery not maintaining a quorum and then not following up. Two different issues, thank you. But it still pertains to the same thing on item 4.
All of that is encapsulated in the motion, correct?
Correct.
Madam Chair, could I just also comment, the Veterans Cemetery Committee is not part of the funeral board. There's the Northern Nevada Veterans Memorial Cemetery Committee, and then there's also one in Southern Nevada. And I think that's what the senator is referring to, but they have nothing to do with my board. I try to attend those as often as I can just to kind of keep up to date on what their issues are, but they're not part of the funeral board. So I just want to make that clear.
Okay, well, I was not aware of that. I thought that they both combined together. So we need to maybe address the Veterans Funeral Cemetery Board, and mostly the one that, it creates a whole state, but they've got some issues. And I think we need to address them one way or another. If I got to do it by a bill, but and that's what we were talking about when we kept saying the Veterans Cemetery services. The other thing is the ones that I'm having problems with is the complaints we're hearing from is the coroners and stuff, trying to get some of this stuff through and the loopholes that we're falling through. So that's why I thought we can get the app implemented to where the doctors that are visiting doctors or doctors can sign that, then we can get through this a lot faster. So they're two different issues, and I'm glad you brought that up. So staff, I guess maybe what we need to know is, because I thought the two combined together, so we need to either contact the Veterans Funeral Cemetery or their Veterans Cemetery Board and see how we can address the issues there. If not, letter.
Yeah, Assemblyman Ellison, I was going to say that, yeah, and when you made the motion, I was not conflating the veterans with the regular funeral service board because that's separate entity. So why don't we do this? Let's handle that piece offline and let's move forward with the motion.
I totally agree.
Okay. All right. So you want to restate your motion?
Motion is to work with the state and the funeral services to create some kind of app to fast track getting these certificates done to where we can get the insurance back to the families. Does that help?
Okay, can I offer one modification?
Yes, ma'am.
Because I don't know if we put app in there in the motion itself, if that precludes anything else. So can you modify it to say that to put in place procedures to include, not limited to, technical communications or whatever that looks like, so that we can get the information back quickly. Because I don't know if putting in app specifically will limit it.
I totally agree, and I'm in my motion to do just exactly what you said. But here's the thing: is I don't know if they brought up app to try to fast track that. That's why I went by app. But anything possible to help fast track these and getting these certificates out. And the problem we're running into is the coroners are saying now that the problems we're having is with the hospitals, and the hospitals saying it's with the cemetery, and that's the problem we're having when you got 30 days for people on ice before we can get that certificate. That's a problem.
Okay. So
I think that's an issue that we have to address, and I think you just addressed that with your comment.
Okay, so that is the motion that they put in place policies and procedures that will help to minimize the amount of time that the death certificate gets to the people that it needs to go to. Is that it? Okay. All right. Any questions on that?
I'll make a second.
So first by Assemblyman Ellison and a second by Vice Chair Hadagi. Any questions, concerns? So let me do this one since we've talked about it and it's changed a couple of times. Mr. Malgarejo, are you with us? Can you do a roll call vote, please?
Yes. Senator Brooks,
Yes.
Senator Pickard, Senator Spearman,
Yes?
Assemblyman Daly,
Yes.
Assemblyman Ellison,
Yes.
and Assemblywoman Howdy.
Yes.
And I know Assemblyman Pickard had to leave for the court case. And we usually hold that open until they get back. Is that correct, legal? To take the vote, or we can go on and close out the vote and they can add it when they get back? Procedural question.
Yes.
Yes, they can, we can add it? Wait a minute, I think you're muted.
You can leave it open.
Okay,
You can add it until the end of the meeting.
okay. We'll leave it open and let's come back to it to make sure, I'm pretty sure what his answer will be, but would like for him to say that into the record himself. So we'll leave it open and make another note to myself. And then we'll move on to number 5, Board of Medical Examiners.
Okay, thank you, Madam Chair. This is Jennifer Rudy, Committee Policy Analyst. So the Board of Medical Examiners was created by the 1899 legislature. It has 9 members, 6 persons licensed and actively practicing medicine in the state, 1 member who represents the interests of persons or agencies that regularly provide healthcare to patients who are indigent, uninsured, or unable to afford healthcare, and 2 members of the general public. Specific eligibility criteria is set forth in statute. The board reported no vacancies at the time of its review by the Sunset Subcommittee on June 30th. This is the 2nd consecutive interim that the Sunset Subcommittee has reviewed the board. On March 21st, 2018, the Sunset Subcommittee reviewed the Board of Medical Examiners, and on June 13th, 2018, the subcommittee recommended the board be continued and that it review its fees schedule, including aligning fees for background checks with the actual cost, and report its findings to the subcommittee during the 2019 to 2020 interim, which it did. During the Sunset Subcommittee's current review of the board, some of the issues discussed were review of fees. The board is scheduled to review its fees charged at its meeting scheduled for September 11th, 2020, according to the testimony provided on June 30th. And the Declaration of Emergency Directive 011 allows licensed physicians from other states to practice in Nevada during the coronavirus disease of 2019 pandemic by submitting a completed waiver form. These physicians are not licensed in Nevada, nor have they been vetted by the board per the provisions of the directive. Once the waiver is no longer in effect, any physician wishing to continue practicing in the state must apply for licensure. And finally, this is the same item that was on the board of the funeral board, was the need to reduce the delays in death reporting and use whatever enforcement tools are available to ensure timely reporting. And Sarah Bradley, the Deputy Executive Director, did provide the response dated August 21st, 2020, which was discussed in an earlier agenda item with suggestions to address the delays in death reporting. And the Sunset Subcommittee did take action on those recommendations earlier in the meeting. The board did not request any statutory changes at this time. Again, Sarah Bradley is available via Zoom if there are questions from the subcommittee for the board. But the questions before the subcommittee right now are, should the board be terminated or continued? And if terminated, should it be consolidated with another entity or have its duties transferred to another entity? And if continued, does the subcommittee want to recommend any changes concerning the board? And again, they did not request any statutory changes. Thank you.
Thank you. Any questions from committee members? So I have one thing that I'd like to add, and that would be, if the process has been abbreviated under the emergency declaration, we need to put something in place that assures the public that there's the same safety and precautions being taken during an emergency declaration as there is during, and when there is not. And I guess what I'm looking at here is I'm trying to figure out if there is a way to make sure when application is made to the Medical Examiners Board for someone who's trying to come in and practice, be licensed in Nevada, want to make sure that that process is not unduly or inappropriately prolonged. And I've heard from people different things. Maybe it's a month, maybe it's 2 months, maybe it's 3 months. So I want to make sure that there are procedures in place, and maybe we have to handle that with the BDR, so that whatever happens under an emergency declaration mirrors what happens when we're not. And that is not to say that we don't work with all deliberate speed. Whatever we're doing now to ensure the safety, can we do that when the declaration is over? I want to make sure that there's parity. That's what I'm looking at. Does that make sense? Committee? Anyone?
Yes, Chair, I think that makes sense. I think you and Senator Brooks also shared the same concerns, making sure that there is public safety throughout this process.
Yes.
Yeah, Madam Chair, Skip Daly again. So when I think back on some of this stuff, I know when we passed some of the legislation that allowed some of these emergencies to go through for a variety of different things, we actually did it before the October 1 incident down in Clark County in Las Vegas down there. And at that time, we looked smart because we were able to bring doctors in for an incident that was relatively short-lived, so people could come in. Under the COVID situation we have, where we have this emergency lasting several months, I don't think that was really anticipated in the original deal. So the October 1 incident, I mean, you had doctors come in, it was emergency, it was over in 2 weeks, getting people treated, doctors were going back. One that lasts longer, I think you could say, hey, we need to be able to respond quickly. Like we had in the incident, people need to come in, we need to be able to say, hey, look, we're not requiring the license, we want you to start working. But if it's gonna last longer than like 30 days, then there needs to be a review or something. So we have that initial flexibility to meet a demand in emergency in a normal situation that's gonna last the short term. But if it's going on like this COVID thing, I think you're right, we gotta put some parameter there that there needs to be some follow-up and vetting, if you will, at least make sure they're licensed in the state they said they were as a minimum. If that makes sense, we have to have that flexibility at the beginning though. When you need somebody who's coming in, we don't want to even have a week-long wait, because the thing that happened in Las Vegas on October 1st would have been over by the time you got people through this process, even if it was a week. I hope that makes sense.
Madam Chair, Hannah Brown,
Yes,
I
ma'am.
do agree with Assemblyman Daly, because when you're looking at an emergency situation, you're looking at temporary. But if you're looking at long-term, obviously that's permanent. A hiring would be permanent. And I think if we try to marry the two and make them match, then we're going to lock us outside the door of reacting to an emergency situation, which we hope we don't ever have to have again. But we can't close that door and make that equal to a permanent situation. I hope that's making sense.
It does, and to be clear, I'm not saying that we close the door on an emergency situation. Where we are right now, and I don't know that we're going to be through this emergency declaration for the next month or so. So we're probably looking at like 6 months. what I'm suggesting is something that says, once they're in, if it lasts longer than 30 days or whatever, then there would be some type of due process in place to vet the people who are here, and make sure that who they say they are, and they have what they say they have. And I'm thinking really specifically about making sure that on the other side of this, we're not back at, it may take 3 to 4 months for some people to be licensed. And I mention that because I've had people to say that to me in terms of trying to get licensed here in the state. A pediatrician told me last September they were licensed in New York and in California, and they were trying to get licensed here, and it just took too long, and they said, forget it. So I want to make sure that whatever's happening on the other side of the emergency declaration is happening safely and expeditiously. And also during the emergency declaration, if they're not vetted when they come in, when we see that it's going to be a very protracted process like we are here, I don't know that we'll be through with this in December. I don't know. I don't think anybody knows. And so if we go all the way until next March, that means that we've had people here for a year and they've not been vetted. So I'm looking at some way to make sure that, number one, on the other side of the emergency declaration, the process is not unduly protracted. And then during a emergency declaration, if it is for more than a specified period of time, that the vetting process takes place.
Madam Chair, Hannah Brown, and I agree with the clarification.
Sometimes I'm not as eloquent, Ms. Brown, in my speech as you are.
But stop. Okay, no. Yeah.
Okay. Does that make sense in terms of a motion? To add it to what we have already that we're getting ready to vote on.
Senator Spearman, this is Jennifer Reedy, Committee Policy Analyst. I'm just not clear. So does the subcommittee, it sounds like you would like to require some sort of vetting process if those individuals who are allowed to practice in the state via the waiver process per the emergency directive are here past a certain amount of time. And I'm wondering if that is allowable under the emergency directive.
I don't know. So perhaps it's not in the emergency directive. And Ms. O'Grady, can you clarify this for me? If there is something in statute that incorporates the issuance of an emergency declaration, that there is some type of a caveat that says, if that is invoked, then some type of vetting process would take place after a specified time. Is that allowable?
I think so. I don't think there's anything like that in statute right now because this pandemic is kind of unique. So it could be added, but it has to be in statute.
Yeah. Okay. So that's what I'm saying. That's what I'm saying. After a certain amount of time, and I don't know that I would say that we should decide what that time is. I think we should be in conversation with the medical board, but I think we should at least put that out there so that it becomes a BDR of some sort. Does that make sense, committee?
Madam Chair, this is Senator Brooks.
Yes, sir.
It does not make sense to me anyway. So are we proposing that we amend the governor's emergency powers? Or are we proposing that we put in statute that in the event emergency powers are used and we waive, and there's a directive from the governor under the governor's emergency powers that that executive order changes anything about licensure, that then we have to do something if that takes place? Is that what we're proposing in this motion?
Yeah. So this is what I'm proposing. What at least what I heard was that there, under the emergency declaration, there's not been a vetting process. I think Ms. Brown mentioned that as part of the Valley Health System Board of Directors. So there's not a vetting process in place right now. The emergency declaration happened in March, and we are now in September. I don't know that we'll be done by December. And what we heard from Ms. Brady, the medical examiner, is that they come in and whatever they say they are and wherever they say they train, that's accepted. What I'm suggesting is that the governor has the right to issue an emergency declaration. But should that declaration go on, if we're in this March, that means we've had people in here practicing medicine that have not been vetted. And that is not to impugn their integrity or to question the veracity of their statements. That's to say, if we were not in a emergency declaration, there would be some vetting process. So I'm trying to see how we might make sure that in the event it goes longer, that there is something in place that the Medical Examiners Board can begin to do to make sure that the people who are here are who they say they are, and they have been trained where they say they've been trained. So it's not amending his authority, I don't think. I'm just trying to think how we, as the legislative branch, might make sure that everything is above board and that people are properly vetted so that the same things that happen outside of an emergency declaration to protect patients is happening in a similar fashion during the emergency declaration.
Madam Chairman, this is Terry Rankin. I believe my memory is that there's a chapter about the governor issuing emergency declarations, and it may go back to like World War II or something. So what you're asking for is either the governor to periodically amend his directive, or perhaps to put something in that chapter. And I'm sorry, I don't have my statutes available, so I'd have to go fish online. But I think what happened in New York City, if I'm remembering right, is that the governor there allowed the volunteers in, and his order directed that there be 3-month sequences so that people coming from outer state would be, they wouldn't be vetted. They applied to do this work, but that would allow them to be looked at or to reapply. The things that I've seen about COVID is we could be in this until the year 2024. And I've seen that in more than one report, especially from the epidemiologists. So I understand your concerns, and to just allow the directive to go that way for 4 years is probably not suitable. But there may be a combination of things that you could do to either encourage the governor to reinstate this licensure waiver, or to go into whatever that emergency act is and put some time limits where it has to be renewed. So I'll just throw that out there.
Madam Chair, this is Senator Brooks again. Just building upon Ms. Rankin's comment, it's NRS 414, and it does delineate the governor's emergency powers. I don't see how we can try to, without changing 414 in the middle of a pandemic, I don't see how we can actually address the issue that you're trying to address. If we want to have, they're two separate issues. If we want to talk about the licensure process and streamlining of it, I'd love to have that conversation, even in a motion. I am not comfortable proposing to make a motion that tries to somehow circumvent an executive order that was ordered in March through some sort of statute that says in the event we get an executive order, we'll do X, Y, and Z. So to Ms. Rankin's point, if, you know, this goes on forever, we most certainly probably should address 414 and emergency powers and what that means, not in a work session document.
So if we're in this until 21, 24, then we stay the way we are.
I mean, an emergency declaration is just that. It's not something that can be undone in a sunset committee. So
Yeah, I got that. And I'm, to be clear, I'm not suggesting that we quote amend his powers now and go back and try to retroactively put this in. We could probably look at some date beyond this that would allow the next time it is issued to happen.
So are you proposing that we change 414 in the 21 legislative session to address this very specific issue?
But it wouldn't happen during the pandemic. Let's do this. I'll withdraw that question and we'll just act upon what we have here. As I said before, my concern is, and here's an outside possibility, that someone is here and they have not been vetted and it's under the governor's emergency declaration. And maybe those of you who are attorneys, and maybe our legal can help me with this, if something were to happen to a patient who has been treated by that person, and it were found out later that they said they graduated from Yale and they didn't graduate from Yale, Y-A-L-E, they graduated from Yale, Y-E-L-L, and it's not a reputable school. If something happens to the patient, what then is the state's responsibility should there be any type of lawsuit? And what is the hospital who has hired the doctor or the medical professional, what is their responsibility should there be a lawsuit? Now, if that is not something that would happen, then I'm cool with leaving it as it is. I'm trying to look at this from the standpoint of this is happening during an emergency declaration, but I don't know that I don't know that there is any type of protection for the state or for the hospitals for that matter, and maybe SB 4 doesn't come into play here, but the hospitals were excluded from that. So what is the what is the culpability if something were to happen? That's my question.
Well, Madam Chair, it's Hannah Brown again. I think what your concern is obviously a primary concern for the medical facilities because they go through great lengths to ensure that they have the right people on staff and that they're hiring the right people. I think what I'm looking at is this is not a hire. They're here to assist us supposedly on a temporary basis. But since we haven't gotten our arms around this, it's extended into what appears to be a job, but it's not a hire, in my opinion, for the medical facilities. And it's kind of, I think we're going to have a difficult time outthinking those medical facilities because the last thing they want to do is get someone on staff that is not a that cannot prove their paperwork, whatever paperwork they're presenting. And, because they go through great lengths to ensure that people are submitting the correct paperwork and that they can be verified. So I don't know if this is just a situation that we kind of got dumped. I mean, that we're having to live with that we don't have answers to right now.
Okay, so I'll withdraw that and we'll move forward. But I still wanted to be on the record that there is a concern that if there is some type of litigious situation, the state and everyone else is covered. So, so we'll leave it as it is, and the motion before us, or the questions before us are termination of the board, consolidation, transferred to another entity. Are we going to accept their recommendations? No statutory changes at the time. So those are the questions for us. Do I hear a motion?
I can make a motion, Chair. This is Vice Chair Howdy. I move that the subcommittee recommend continuing the board and that be the only recommendation.
Okay.
Second.
Second, I have a motion by Vice Chair Howdy and a second by Senator Brooks. Any further discussion? All those in favor? Aye. Hold on.
Aye.
Mr. Magalejo, roll call, please.
Yes, Madam Chair. Senator Brooks,
Aye.
Senator Pickard, Senator Spearman,
Aye.
Assemblyman Daly,
Yes.
Assemblyman Ellison,
Yes.
and Assemblywoman Howdy.
Yes.
And we will hold it open for Senator Pickard's return. Okay. It is now 11:52. Why don't we take a break and we'll come back at 20 minutes past noon. Okay? So we'll be in recess until 20 minutes past noon. Not legislative time noon, 20 minutes past noon.
Okay, Swiss time.
All right, we're in recess.
Hello, Ms. Rudy. I'm going to be leading the committee until Chair Spearman joins us. I think she's having some computer issues and has taken her computer to get fixed.
Okay, and the computer won.
Yes. I think we're missing Mr. Daly and he's logging on. I think just Assemblyman Ellison.
You can tell out of the 52 years I worked, I never missed a deadline.
Yeah, I know, let's see. Assemblyman Ellison, so I know we don't have Senator Pickard and we don't have Chair Spearman. So as soon as Assemblyman Ellison joins us, then I think we can get started.
Assemblywoman Howdy, I'm not sure. Do we have Senator Pickard back on the line? Because
No, not yet. I was just messaging with him. He's wrapping up court right now, and I just asked him how soon he could jump on because we don't have. There's chairs. There's chair. So we have a quorum now.
Yep. Thank you.
Okay, I'm just going to fill her in. Chair, can you hear? Chair? Chair Spearman? Chair Spearman, can you hear me? Oh, I think we might have. Oh. Now that we have a quorum, I'd like to go ahead and get started. And before we lose the Board of Paroles, I'd like to go back to item number 1. Ms. O'Grady, I believe you have an answer for us now regarding the pay.
Yes, I do. And Ms. Rankin was correct. In addition to omitted positions, the unclassified pay bill allows the Fiscal Analysis Division of LCB to take a look at whether the title or maximum salary for a position, whether there's a typographical or other error that somehow affects the maximum salary there. So the committee, the subcommittee could direct fiscal to take a look at this position, and then if there was an error, then IFC, this provision allows IFC to take a look at it and fix it.
Okay, so then we can make a motion to pass the 3 recommendations, the 2 letters, and then the letter, the request for the letter to take a look at this position, but then in addition, add in a request to have our fiscal staff take a look at the position and any errors, and if there are any errors, then bring up the item to the IFC.
Yes, because I mean, even if there wasn't an error this time, maybe they would still want the money committees to separately consider it next session. So I think it's appropriate to do both.
Do both. Okay. So committee, I just want to make sure, since we are taking a few steps back, we're going again back to the very first item on our work session, which was the recommendations regarding the State Board of Parole Commissioners. We had heard Ms. O'Grady give us, again, the recommendations that the board was requesting. The first 2 bullet points, which were the letters, and then the first 2 bullet points, which were statutory changes, and the 3rd bullet point being the letter taking a look at the unclassified pay of their executive assistant, which is supposed to be an executive secretary position. So those were the 3 requested recommendations by the board. In addition to those 3, we would like to add in a 4th recommendation requesting that our fiscal department take a look at this item as well, and then make any appropriate recommendations to IFC. So we would be looking for a motion to either 1, terminate the board, or a motion to for the subcommittee to recommend continuation of the board with the approved recommendations.
I'd like to make a motion.
I'll make that motion to continue and to include the 3 enumerated recommendations plus the 4th.
Second.
Thank you so much. So I have a first by Senator Pickard and a second by Senator Brooks. Any discussion on the motion?
Madam Chair, this is Terry Rankin. See, it really helps to write the law to begin with, so you remember it. So I just plug that in there.
Well, thank you, Ms. Rankin. We appreciate you catching that for us. So thank you. Okay, seeing no further discussion, all those in favor, please signify by saying aye.
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 Those opposed? Motion carries. Okay, thank you. Now, Ms. Rudy, it looks like we can move on to our next item on our work session, which I believe is the Colorado River, Nevada.
Okay, thank you, Vice Chair Howdigi. This is Jennifer Rudy, Committee Policy Analyst. The 1935 legislature created the Colorado River Commission of Nevada to collect and arrange all data and information connected with the Colorado River and represent the state of Nevada in matters related to power generation and distribution, conservation, and interstate agreements regarding the Colorado River. However, the early beginnings of the commission could be traced back to 1920 when Governor Emmett D. Boyle appointed an informal commission on Colorado River development to safeguard Nevada's interest in ongoing negotiations regarding the uses of the Colorado River. Later in 1922, Nevada signed the Colorado River Compact along with 5 other basin states, allocating the Colorado River between the upper and lower basin states. The commission is comprised of 7 members, 4 are appointed by the governor and 3 are appointed by the Southern Nevada Water Authority. The commission reported no vacancies during the Sunset Subcommittee's review on June 23rd, 2020. This was the first time the Sunset Subcommittee had reviewed the commission. The commission is not seeking any statutory changes, and it noted that unlike many state agencies that deal with issues inside Nevada state borders, it works with 6 other basin states, tribes, stakeholders, and the federal government. The activities of the operation of the Colorado River and associated dams are unique and built upon the foundations of the law of the river that stems from court cases, legislation, regulations, and negotiated agreements that extend over the past 100 years. Amongst its duties and responsibilities, the commission manages Hoover Power hydropower contracts that do not expire until September 30th, 2067, hydropower contracts from the Parker and Davis dams that are expected to be renewed in the next few years, and the Salt Lake City Area Integrated Project that does not expire until September 30th, 2057. So the question before the subcommittee now is, should the commission be terminated or continued? And if it is terminated, should the commission be consolidated with another entity or have its duties transferred to another entity? And if it should be continued, does the subcommittee want to recommend any changes concerning the commission? Again, no changes were requested by the commission. Eric Witkowski and Gail Bates of the Colorado River Commission were both available via Zoom if the subcommittee had any questions. I'm not sure if they still are on, but those are the questions before the subcommittee. Thank you.
Committee, any questions? Okay, seeing none, then we'd be looking for a motion to terminate or to continue the Colorado River Commission. And if we choose to continue the Colorado River Commission, if there are any other recommendations that the committee would like.
Madam Chair, I move that we continue the commission with no recommendations.
Thank you. We have a first by Senator Brooks and a second by Assemblyman Allison. Any discussion on the motion? Okay, seeing none, all those in favor signify by saying
Aye.
Aye.
Opposed? Okay, motion carries. Thank you so much. It looks like we have been joined by our chair, Chair Spearman. Can you hear me? Okay, yes. Perfect. Oh, it looks like Chair Spearman. Doesn't look like we can hear you yet. Okay, okay, perfect. Looks like she might still be having some computer issues. So Ms. Rudy, if we can move to item number 7 on the work session, dealing with the Real Estate Commission.
Thank you, Vice Chair Howdigi. This is Jennifer Rudy, Committee Policy Analyst. The 1947 legislature created the Nevada State Real Estate Board, which was later renamed the Real Estate Commission. The commission is comprised of 5 members appointed by the governor, specific eligibility criteria set forth in statute. The 2015 legislature revised the requisite eligibility criteria for members to include proportional representation that is to be revisited at every legislative session following the decennial census and adjusted based on new population data. The commission reported no vacancies during the Sunset Subcommittee's review on June 23rd, 2020. This was the first time the subcommittee had reviewed the commission. During the Sunset Subcommittee's review of the commission, some of the issues discussed were licensure, reciprocity, an interstate license compact has been discussed but not pursued, and military spouse licensure rates. The commission will work with the third-party test vendor to obtain this data. The commission is not seeking any statutory changes at this time. So the questions before the committee at this time or before the subcommittee are, should the commission be terminated or continued? And if the subcommittee recommends terminating the commission, should it be consolidated with another entity or transferred to another entity? The duties transferred to another entity. And if the subcommittee recommends continuing the commission, does the subcommittee want to recommend any changes concerning the commission? And Mr. Chandra, the administrator of real estate division in the Department of Business and Industry, was available via Zoom if the subcommittee had any questions for the commission.
Thank you, Ms. Rudy. Committee, does anyone have any questions regarding the Real Estate Commission?
Madam Vice Chair, since I'm the one who kind of spurred the conversation about the licensure reciprocity, I just want to inform the committee that I did have additional conversations with the director, and he clarified some of the issues. They do allow for a certificate of cooperative broker certificate that allows brokers from out of state to work with the local brokers. Unfortunately, it's limited to only those that only buyers that are out of state. It does not allow for those buyers that are in state to work with those outside. As I expressed at the time and then during the conversation with them, the concern is that the large, sophisticated commercial developers are accustomed, if they're regional or national in scope, they typically work with a set of brokers and agents and support staff in one office to do all of their work across their region or across the country. And what I intended to bring up was in 2019, I think it was either 17 or 19, I think it was 2019, we passed SB 69, which was the mandate that all licensing or regulatory boards develop licensure by endorsement to expand the ability of people to do work in Nevada, thus generating income for the state. And in doing so, it appeared that the Real Estate Commission, as great as they are, and I do not want to suggest they've done anything other than a fantastic job with what they do, because they do great work. But as the structure came forward, they didn't quite go as far as I think at least I had in mind, and I know others as they addressed that. So in the discussions, I think where we ended up, there was some discussion about whether or not they should extend the ability of cooperating brokers to work with local developers when they've developed a relationship with that organization. If we do we want to limit that to a transactional basis, unlike a reciprocity type of arrangement where they could operate in the state? Or do we want to require full reciprocity as was required under SB 69? We never reached any conclusions, so I'm not suggesting that we make those strong recommendations. But what I would like to suggest and invite the commission to look at is should we require the same kind of report that we did just a moment ago, where we ask the department to make recommendations to the committee, the Sunset Subcommittee, in furthering the legislative intent of SB 69. I think that would probably be appropriate. Clearly, we haven't pinned down all the loose ends, but I think that we really should be driving everyone in the same direction when it comes to licensure by endorsement. And I would invite the department or the division to comment on that. But that's all I intended to say.
Committee, do you have any questions for, I believe we have Mr. Chandra from the division on, or Mr. Chandra, would you like to say a few words or address anything Senator Pickard brought up?
Madam Chair, Vice Chair, thank you. Sharat Chandra, Administrator for the Real Estate Division. I think Senator Pickard made some good points. We're happy to discuss and talk about these things, but I think I don't have any further comment. Thank you.
Senator Pickard, would you like to make a motion then with your recommendation?
Certainly, I'll move to first continue the existence of the commission with the recommendation that we ask the commission to make recommendations as to how we can more fully implement SB 69 with respect to licensure, whether that be, and I probably should have commented, we should look at the regulations specifically regarding 625-185, I believe it is. I know it's subsection 185, but also with respect to licensure and the certificate of, or the cooperative broker certificate.
Do I have a second?
Second.
I believe that was Mr. Ellison. So we have a motion by Senator Pickard and a second by Assemblyman Ellison. All those in favor, please signify by saying aye.
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 Opposed? Motion carries. Okay. Thank you. And I believe that we have Chair Spearman on. Chair, can you test your microphone? Okay, it doesn't look like we have you yet. Okay, so we can go ahead and move forward with our work session document, but let's move to item number 8, Commission of Appraisers of Real Estate. Ms. Rudy? Oh, Ms. Rudy, I believe you are on mute still.
Okay, thank you, Vice Chair Howdigy. This is Jennifer Rudy, Committee Policy Analyst. So item number 8 on the work session document was the Commission of Appraisers of Real Estate. The 1989 legislature created the Commission of Appraisers of Real Estate. The commission is comprised of 5 members appointed by the governor. Specific eligibility criteria is set forth in statute. The commission reported 2 vacancies during the Sunset Subcommittee's review on June 23rd, 2020. However, the commission reported a 3rd member's term expired on June 30th. The Sunset Subcommittee had never reviewed the commission prior to June 23rd. The primary objective of the commission is to protect the public from unsafe practices of real estate appraisers and to regulate real estate appraisers and appraisal management companies in accordance with federal and state laws, rules, and policies. The commission did not request any statutory changes. And again, the same individual, Mr. Chandra, is available via Zoom should the subcommittee have any questions for the commission. But the same questions are before the subcommittee. Now, should the commission be terminated or continued? And if the subcommittee recommends terminating the commission, should it be consolidated with another entity or have its duties transferred to another entity? And if it recommends continuing the commission, does the subcommittee want to recommend any changes concerning the commission?
Thank you so much, Ms. Rudy. Committee, do you have any questions or discussion? Before we
Vice
call.
Chair, I'll go ahead and make the motion to continue the Commission of Appraisers of Real Estate without further recommendation. I think they do a great job.
Second.
Perfect. We have a first from Senator Pickard, a second from Senator Brooks. Any discussion on the motion? Okay, seeing none. Committee, all those in favor signify by saying aye.
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 Opposed? Okay, motion carries. Perfect. So we are done with item number 8 on our work session, and it looks like we have our chair back on with us and fully running. So I will hand the gavel back over to Chair Spearman.
Thank you. And for the record, you couldn't hear me, but I voted yes on 6 and 7. Can you hear me?
Yes.
Hello?
Yes, we can, Chair Spearman.
Okay, okay. All right. So we are now at item number 8, Commission of Appraisers of Real Estate. Ms. Rudy?
Chair Spearman, this is Vice Chair Howdigy. We just finished item number 8. We are now
I'm
on work
sorry.
session item number 9.
You're right. And I voted yes on that because you could hear me. My bad. Appraisal Advisory Review Committee and Nevada Administrative Codes. So for the record, I did vote yes on 6 and 7. I thought you could hear me on 8, but you couldn't until I did something in the computer. So I'm yes on 6, 7, and 8. Okay.
Thank
So
you.
on to 9.
Chairman, this is Jennifer Rudy, Committee Policy Analyst. So we are at number 9, the Appraisal Advisory Review Committee. The Commission of Appraisers of Real Estate established the Appraisal Advisory Review Committee following the adoption of authorizing regulations in 2000. The Commission has approved over 40 licensees to sit on this committee, and the committee members do not have terms. When a case is assigned to the committee, a request is sent to approved committee members asking whether they are available to sit on the committee. Eligibility criteria for the members of the committee are set forth in NAC 645C.600. The Sunset Subcommittee reviewed the committee for the first time ever on June 23rd, 2020. In 2019, the committee heard 5 cases with a total of 59 hours of continuing education recommended and approved by the Commission of Appraisers of Real Estate. So far in 2020, the committee has heard 5 cases with a total of 141 hours of continuing education recommended and approved by the commission. At the time of the review by the Sunset Subcommittee, approximately 16 open cases were ready to be presented to the committee, and the committee did not request any statutory changes. The same questions are before the subcommittee regarding this committee. Should it be terminated or continued? And if terminated, should the committee be consolidated with another entity or have its duties transferred to another entity? And if the subcommittee recommends continuing the committee, does the subcommittee want to recommend any changes concerning the committee? Again, Mr. Chandra, the administrator of the real estate division, is available via Zoom should the subcommittee have any questions about the committee. Thank you.
Thank you. Committee, any questions? Concerns?
Just one, Madam Chair. I'm just, if I may, just curious, do I understand this correctly that we're not talking about increasing the total to 141 hours of continuing education? Do I understand that correctly, or are we going from 59 to 141?
Senator Pickett, this is Sharath Chandra, Administrator for the Real Estate Division. Senator Pickett, this is really an advisory review committee for the appraisal subcommittee. So essentially, if there are any disciplinary cases, before they go before the appraisal commission, they go before this appraisal review committee. Because it is such a technical area, sometimes a committee is better equipped to kind of talk through the cases and kind of advise. And most of the time, the recommendation is additional education for the appraiser, which they would do outside of their required education. And then if it's egregious enough, then it gets bumped up to the actual commission. Thank you, sir.
All right. So what I understand is that these were additional hours subject to a disciplinary review. Is that correct?
That is correct.
Thank you, Madam Chair. That was all I had.
Thank you. Additional questions? I'll entertain a motion.
Madam Chair, I'll move to continue the committee without further recommendation.
Have a second.
I'll second, Madam Chair. This is Vice Chair Howdigy.
So I have a motion by Senator Pickard, second by Vice Chair Hauge. Any questions? All those in favor? Aye.
Aye.
Opposed? And the motion carries unanimously. Did we, before I was able to get back in, did we go back and look at the vote for Senator Pickard on the funeral board and the medical examining board?
We did not, Madam Chair, we did not go back, but Senator Pickard, we left the votes open so that you would be allowed to cast your votes on those work session items. And Madam Chair, we did revisit item number 1 on the work session document dealing with the parole board. So that was already taken care of as well. Ms. O'Grady had an answer for us when we returned from lunch.
Okay. All right, so we're through with 1.
And Madam Chair, I'm voting in the affirmative with the committee.
Okay. All right. So there were 2 votes. So you voted in the affirmative for both?
For both, Madam Chair, thank you.
All right. Thank you. Just want to make sure we got that on record.
And Madam Chair, since we did cast our vote on work session item number 1, I'm not sure if you'd like to cast your vote on that as well.
Yes. Yes. Yeah, so I voted in the affirmative, number 1. Okay, is that it?
Yes, I believe so, Madam Chair.
Okay, all right. Thank you, Madam Vice Chair. You wonderful job. Thank you. This computer is on my last nerve. Anyway, let's go to item number 10, Advisory Council on Mortgage Investments and Mortgage Lending.
Okay, thank you, Chair Spearman. This is Jennifer Rudy, Committee Policy Analyst. Number 10 on the work session document is the Advisory Council on Mortgage Investments and Mortgage Lending. The 1999 legislature created the Advisory Council on Mortgage Investments and Mortgage Lending to consist of 5 members appointed by the Legislative Commission who serve without compensation for a term of 2 years. The council serves in an advisory capacity to the Commissioner of Financial Institutions and the legislature, and as a forum for special studies, discussion, and information dissemination on all matters relating to mortgage investments and mortgage lending. The Sunset Subcommittee reviewed the council for the second time on June 23rd, 2020. The subcommittee had previously reviewed the council on March 27th, 2012, and recommended at that time to continue the council without changes. The council did not request any statutory changes at the time of its June review. And I would like to point out last week on August 25th, 2020, the Legislative Commission reappointed Adam Horowitz and Alicia Taylor, whose terms had expired on May 16th, 2020. So the council is fully appointed at this time. We did have John Getty, the vice chair of the council, available via Zoom. I'm not sure if he still is there because he may have had to be substituted if there are questions for the council. I'm not quite sure if we do still have somebody from the council on or not. I'm sorry, and then questions before the subcommittee are whether the council should be terminated or continued. If they are terminated, should it be consolidated with another entity or have its duties transferred to another entity? And if the subcommittee recommends continuing the council, does the subcommittee want to recommend any changes concerning the council? Again, there were no requested changes by the council. Thank you.
Thank you. Any questions, committee members?
Chair, this is Vice Chair Howdy. Seeing no recommendations from the council, I would move that the subcommittee recommend continuing the council with no further recommendations.
Okay.
I'll second that.
Second. Motion made by Vice Chair Howdy and second by, was that Senator Pickard?
Senator Pickard, yes, thank you.
Okay. All right, I see you. Any questions? No. And I just had one, and it really is for my knowledge. During this time, I know that there have been a lot of people who have either been furloughed, hours reduced, or lost their jobs completely, and just wanted to know how is that, if it's impacting what you do with mortgage lending?
Hi, I'm not sure if the committee can hear me. Chair Spearman, can you hear me?
Can hear
Okay.
you, uh-huh.
Yeah, so the obviously the epidemic pandemic has caused a lot of changes in a lot of things. One of the best responses, I think, has been the federal response from FHFA, which is Fannie Mae and Freddie Mac, as well as VA and FHA, to allow for automatic, if requested, forbearance of mortgage payments for 6 months. And if at the end of that 6-month term, you need additional time, will be automatically approved for an additional 6 months. So folks that have been hit the hardest and are financially struggling, unable to make their mortgage payments now, they have up to a year before they have any serious repercussions, provided that it's a federally backed or insured mortgage. So that's the best response that we've seen in that area. The vast majority of mortgage loans are federally backed or insured, so it does cover the vast majority of Nevadans.
So at the end of the year, are they able to request a certain modified payment?
At the end of whatever their forbearance period is, whether they stay in through 6 months or stop earlier than that or request through the entire year, there are several options given to those individuals at that time. One is to come current with all payments. I don't know of anybody that is taking that option. The other is to make up the missed payments over a certain period of time, negotiated with the mortgage servicer. And finally, the other option is to simply throw that amount on the back of the loan so that it will be paid off at the end of the original loan term. Those standard monthly payments would continue until those arrearages were paid current.
Thank you. Thank you. Any additional questions, committee members?
Madam Chair?
Yes. Who's that?
This is Simon Ellison.
Okay.
I just got one question. Is that conclude residential and commercial or just residential?
My particular expertise is only in residential. There's a very small percentage of commercial loans that are actually federally backed or insured. So it's a much smaller portion of those loans that have any federal influence, so to speak. Most of the commercial properties are going to be under private jurisdiction. So it's going to be up to the individual lenders how to work with the mortgage holder and modify or grant any easing of the original note terms or not.
Follow up, Madam Chair.
Okay, yes.
Yeah, there is several of the smaller individuals that does have state and federal loans that go through the banking system, but they're still they still got to qualify under the federal guidelines because they're matching funding somehow. But I got several calls on that, and I says I don't know. We'll find out. So I'll call the state and ask them which banks that is. I know the one in Ely is one, Nevada Bank and Trust, and there's some in Vegas. So I will check on that. Thank you.
Okay. Yeah, if you have any specific questions on that, I'd be happy to reach out to my contacts at the Mortgage Bankers Association or other places as well. I don't have any information specifically on general terms about commercial impacts. But if you have, if there's a question about specifically FHA mortgages on multifamily properties, for example, I can get you an answer on that. But commercial in general is a little bit too broad, so there's a whole bunch of different categories. So we'd have to drill down a little deeper. But I'm happy to help if you have any specific questions. Just reach out.
Thank you.
Additional questions? Yeah, and my concern was, I know it will affect, people can't pay their mortgage, and then there are some portfolios that have a certain percentage of investment, commercial investment, and sometimes even residential investment. And so just trying to figure out how that's playing out in the whole rebound arena. So thank you, I appreciate it.
Absolutely.
Additional committee members. Okay, and with that, it's been moved by Assemblyman Ellison. Oh, wait.
Chair Howdy and a second from Senator Pickard.
Thank you, thank you. What she said. Those in favor? Aye.
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 All opposed? And the motion carries unanimously. Thank you. Okay, number 11, the Commission to Study Governmental Purchasing. I have a lot of questions about this one.
Thank you, Chair Spearman. This is Jennifer Rudy, Committee Policy Analyst. The 1975 legislature created a government purchasing study commission in each county of the state with a population of 100,000 or more as determined by the last preceding national census, composed of all purchasing agents of the local governments within those counties. The legislation provided that the commission study government purchasing practices and laws and make recommendations to the legislature. The clause requiring population to be determined by the last preceding national census was removed in 1979. Finally, the 1985 legislature modified the membership of the commission by requiring each county with a population of 100,000 or more to be a member of the commission, replacing the previous commissions in individual counties and providing that counties with populations less than 100,000 may participate as voting members of the commission. The objective of the commission is to review the laws that relate to and impact local government purchasing in the state, including chapters 332 and 338 of the NRS, propose changes, review proposed changes during each legislative session, and work with each respective entity's representative during legislative sessions. The Sunset Subcommittee reviewed the commission for the first time on May 4th, 2020. During that review, the commission noted that AB 86 from the 2019 session, which the Purchasing Division Department of Administration requested, included many of the statutory changes that the commission had been seeking for some time, with the exception of the authority for the commission to request up to 2 bill drafts. The sole statutory change requested by the commission from the Sunset Subcommittee is the authority to request up to 2 bill drafts. The Sunset Subcommittee suggested the commission consider posting its agendas and meeting minutes to a website, possibly that of the Purchasing Division, to increase transparency. I believe Jim Haining and Laura Rader, the co-chairs of the commission, are available via Zoom if the subcommittee should have any questions for the commission. Thank you.
Thank you. Any questions, committee members? So I have just a couple. When we look at governmental purchasing, especially in the pandemic, and I realize that this is different from a lot of other times, my question would be, are there any pieces of a particular protocol that are used to make sure that small businesses, disadvantaged businesses, minority businesses, et cetera, are included in that process, so that those who can provide the same service are getting the same amount of recognition in terms of their ability to be a part of the supply chain?
Madam Chairman, this is Jim Haining. I am the co-chair from Southern Nevada for the Nevada Public Purchasing Study Commission. When we do purchasing, each group entity has their own policies in the way they do things. However, the way the statute was changed, we are able to award anything up to $50,000 with one quote. So it gives agencies a greater opportunity to source to small diverse, minority, women-owned companies than we have had in the past. During the pandemic, I know many of us have put our opportunities out on the Nevada government e-marketplace website so that it's open to all businesses to be able to quote. And personally, from the entity that I work for, we've had more small and woman and minority-owned businesses participate in our quotes than we have in the past.
Madam Chair,
Yes.
this is Assemblyman Daly. I just wanted to make a clarifying point if it wasn't clear, that the group to study government purchasing, whatever, that commission that we're currently reviewing doesn't award or purchase anything as that entity. Each one of the members of the group, they are the ones that do the advertising and do the outreach to minority and award contracts separate from this commission, just as a matter of clarification. So we shouldn't have the two things confused. When the gentleman was just speaking, he said, we and this and that, but he's not speaking as the purchasing commission to review government purchasing. So it's a group of purchasing agents that get together to review the laws on how we're going to purchase. And as I said before, when we reviewed them, all of the requirements for minority outreach and various things is all in statute, and each purchasing group does that. So the people that are under review right now don't actually purchase anything. They don't advertise for anything. They don't do any of that.
And I understand that. Yeah, I'm looking specifically at, have they noticed anything that means that we need to include something in legislation that ensures that minority-owned businesses are a part of the process?
Currently, there is nothing in statute that directs us to buy specifically from small minority women-owned businesses. We give them opportunities.
Okay, that was my question.
There's no set-asides. There's no specific direction.
Okay. And you said you post on the website?
Most of us post on website. We also, by law, are required to advertise it in newspapers.
Okay. Okay, that's it. Thank you.
Madam Chair, if I can just toss something in. I know that when this comes up and different agencies or commissions are asking for bill draft requests, we often send them back to their sponsoring entity under either the Department of Administration or what have you. This is a body that doesn't have that kind of sponsorship. And this is one exception I think we should make. I think we should give them one or two bill draft requests because we've asked them to tell us what legislation is necessary, and then they don't have a supervising entity that can help shepherd that into a bill draft request. So I just wanted to toss that out there. I'm normally the person saying we don't want to give people access to bill draft requests, but I think it's appropriate in this instance.
Madam Chair, if I can, Assemblyman Daly again, I'll be the one that says, no, we shouldn't give them bill draft requests. I think I mentioned that when we brought them in for review and various things. And I helped, I wasn't on the Government Affairs Committee, but I did help with that. I think it was SB 86 that came through where they requested for the two bill drafts. And we didn't grant that to them for a variety of reasons, but I think they can go back to lots of purchasing agencies, entities, the governor, et cetera, different things, a lot of avenues to have bill drafts. So I don't support giving them the bill draft requests. Didn't back in the legislative session, and I don't now.
Madam Chairman, this is Terry Rankin. The purchasing division itself, not this commission, but the division is under the Department of Administration. And if they have bill draft requests, it would go through the process the governor uses through the Department of Administration and then the governor. So if you want an amendment, you could go into NRS 332.215 and do what mechanically they're doing anyway and authorize them to submit any BDR, any bill draft requests to the purchasing division for processing through the system. So that would be another way to at least kind of coordinate what they're asking for.
Madam Chairman, I have a clarification. So
Yes, can you speak up just a little bit?
yeah, this is Jim Haining, Madam Chairman. The purchasing division at the state is not part of the Nevada Public Purchasing Study Commission, and they are not part of NRS 332. They are governed by NRS 338. So unless we're able to have some kind of really close coordination with them, which sometimes we have and sometimes we haven't, as the NPPSC, we've not been able to get our bill draft requests in. We went over 8 years without it. So if we are unable to have one, we've talked as a commission, it would be fine to dissolve us. We'll be able to do what we would do through our normal lobbyist avenues, and we would still be able to meet. We just wouldn't be a formal commission that had to meet quarterly.
And Madam Chair, if I can just interject briefly, this is kind of at the core, I think, of the distinction, because we're talking about an advisory committee that sometimes is going to be making recommendations that the purchasing division doesn't particularly want to implement, but it might improve things. And so we end up with those that are being reviewed controlling the reviewers' ability to make recommended improvements, and thus the impetus for allowing them the access. I understand all of the counter arguments. I just think that under the circumstances, in this one instance, it would be appropriate.
Additional comments, questions? So for me, being totally transparent, I'm inclined to agree with Senator Pickard because absent something in legislation that requires contracts to go out and the bids to be let, purchasing or whatever you want to call it, include Black, minority, women, veterans. When I asked that question of several different people who were a part of purchasing, was that happening? The response was, well, we don't know that many, and so we had to go with who we know. And what I'm saying as a part of SCR 1, declaring racism as a public health crisis, and certainly we know that economics plays into that probably more than any other thing, with the exception maybe healthcare. I want to know what we can do to make sure that even in an emergency, there are provisions for small minority DBAs to be considered, and to make sure that there is outreach when there's not an emergency, to develop those relationships so that in an emergency, even though you don't play golf with them, even though they don't go to the same church, they don't live in the same neighborhood, don't belong to the same sorority, fraternity, or whatever, that consideration is given. Because I don't think that if it's not in statute, it won't happen. It won't happen. And consequently, and I understand you all aren't the ones that do the purchasing, but I'm elaborating on what I believe I heard Senator Pickard say. If it is not mandated, it's very easy to slip through the cracks and say, well, we didn't know. And so you have members of the urban chamber who are filling out loan requests, while others who have connections are filling out paperwork to get a particular contract or bid or whatever. And so I just want to make sure that we are being as inclusive as we possibly can at all times, in or out of an emergency. So that's my concern.
Madam Chair, it's Hannah Brown. Do we have any idea how we stack up against other states?
That's a good question. Very good question.
I think it would certainly be a yardstick that we could measure by.
So let me go back to, I'll go back to what Senator Pickard said with respect to giving them at least one BDR. And if there's anything else that needs to happen, then perhaps one of us, a legislator, can carry that. Let me get the temperature on that. And Assemblyman Daly, I understand your resistance to adding. But I think in this case, and to Ms. Brown's point, if we don't know where we are, then we don't know how we stack up, and we can't make the changes necessary so that the purchasing process is equitable to all businesses. So I'll break it down. Number one, let's go back to Senator Pickard. You suggested that there be at least one BDR given to Government Purchasing Commission.
Yes, Madam Chair. My thought was, and I wasn't trying to limit it to one or give them two or more or less. I was just saying that under the circumstances, particularly since their job is to study purchasing across the state and to make recommendations on how to make it better, which would include your point of making sure that those with an interest in bidding have the opportunity. I do think that rather than running them through or requiring them to run through the purchasing division, which may actually resist some of the improvements they're looking to implement or recommending that we implement, to give them the ability to propose some bill draft requests. If it's the pleasure of the committee to give them one or two, I think one certainly would be appropriate. I don't have a problem with two, but as you said, Madam Chair, they can always seek out legislators who could carry a second. So I don't want to imply that one is better than two or vice versa, but I do think it's appropriate that they possess the ability to make some recommendations to the legislature.
And this was a part of their recommendation to us to get at least two bill drafts.
That's correct.
I'm understanding correctly on page 9. Any other discussion? Okay, I will entertain a motion on their request to get two bill drafts.
Madam Chair, I'll go ahead and make that motion. Did you also want to include a request that they provide us information as to the other states' implementation of minority bidding and that sort of thing?
Yeah, and okay, so let me back up. So the motion that I would like to hear would be number one for the bill drafts, but I think that what the question raised by Ms. Hannah, I think that is valid and we should know. So what is happening with other states? How are they ensuring that it's equitable across all communities and making sure that, excuse me, small minority businesses are included at every level. So the recommendation would be those two bill drafts, but it would also mean that those bill drafts would cover whatever information we need so that we make sure that statutorily, whenever purchases are made, people are looking at certain criteria to ensure that it's not all one community and it excludes everybody else.
Certainly, that makes sense. I
I
think,
don't know if I've been as articulate as you, but that's kind of where I'm leaning.
no, I understand. I think that it's important that we get that information. I don't know that we want to tie the two directly. I think if we're going to give them bill draft requests, we do that. And then we also request, since they are a commission to study government purchasing, that part of that, part of their next report would be to report on how Nevada stacks up when it comes to minority business participation in those bids.
Okay.
And I think we have a comment that
Discussion,
Mr. Rankin wants
discussion
to
before we
make.
go. I'm sorry, say again? Oh, yes, sir. Had a question?
Madam Chairman, I just want to make one other comment. There is another group out there that most of us are members of. It is the Regional Business Development Advisory Council. And once every 2 years, and I chair that one too, once every 2 years, we put together a report for all of the entities, the government entities in Southern Nevada, on our HR statistics, to include, minority, women, as well as all of our purchasing statistics. So we are putting our report together that is due to the legislature in January for the last 2 fiscal years. So we will be able to, soon we'll have our minority statistics on purchasing by agency together for Southern Nevada in the next 3 months. It is separate from this commission, though.
Well, Madam Chair, maybe I'll amend my motion to remove that additional requirement, since it would be duplicative of the other commission.
Any other discussion? So Senator Pickard, can you restate your motion, please?
Certainly, it will just be to, well, I'll move to continue the commission with the recommendation that they be provided 2 bill draft requests as requested.
Is there a second?
Second, Madam Chair.
Been moved by Senator Pickard, second by Vice Chair Howdy. Any further discussion?
Yes, Madam Chair, Councilman Daly again. As you know, I'll be voting no on this. And I think if you on your other issue, and I think we got that addressed, I think if you went back and you checked NRS 332 and 333, which is state purchasing, and 338, and several others, you'll find that there's already significant number of statutes out there designed and also requires local government purchasing to do outreach to all of the minority groups that you're talking about, veterans groups, on down the line. If you go back and read it, you'll do that. Maybe I'll go and read it and email it all to you. You'll find that there is no barriers out there that I'm aware of. So I'm just opposed to the bill drafts and all the requirements are already there. And I understand why the gentleman wouldn't say that. He wants to get his bill drafts. But all of those provisions are already in there for local government purchasing to do that. And what I've seen, and I'm fine with all the stuff that's there, but when we get these reports, you do this and that and the other thing, opportunity is all that's being required. If people aren't competitive, various things, all these things, what I see quickly, I say quickly, and there's evidence of it too, boil down to then it becomes a quota. Well, you didn't have these people, they had the opportunity, but you didn't pick them. Why not? There's a variety of reasons, either they weren't the low bid or the et cetera. So I see the quotas come up, and that I don't think is tolerable either. And I can give you examples in the DBE program under NDOT. It's digressed to be a quota.
Thank you, Assemblyman. Any additional discussion? Motion that is before us is made by Senator Pickard and has been seconded by Vice Chair Hardigy. And I'm going to ask Mr. Margarejo, will you please do a roll call?
Yes, Madam Chair. Senator Brooks,
Yes.
Senator Pickard,
Yes.
Senator Spearman,
Yes?
Assemblyman Daly,
No.
Assemblyman Ellison,
Yes.
Assemblywoman Howdigy.
Yes.
So we have all those in affirmative and one no. And I want to make sure that the motion that we had on the table from Senator Pickard includes continuation and adding those 2 BDRs. Just to be clear.
That was, I thought that's what I stated, but
Yeah.
Yes, in
Yeah,
case.
I just want to make
Yeah.
sure that everyone listening understands. Okay? Okay. So the motion passes. Now we are at item 12, State Apprenticeship Council.
Thank you, Chair Spearman. This is Jennifer Rudy, Committee Policy Analyst. Number 12 on the work session document is the State Apprenticeship Council. As you stated, the 1939 legislature created an apprenticeship council to, among other responsibilities, work with local or state joint apprenticeship committees to set up conditions and training standards for apprentice agreements. There have been various legislative changes to the council since 1939. It is currently comprised of 11 members, 7 voting and 4 non-voting. The 2017 legislature created the Office of Workforce Innovation, better known as OWIN, within the Office of the Governor, and OWIN assumed responsibility as the registration agency for apprenticeships in the state, with the State Apprenticeship Council retaining regulatory oversight. The Sunset Subcommittee reviewed the council on May 4th, 2020. The subcommittee reviewed the council once before on May 6, 2014, and voted on June 4th, 2014 to recommend continuation of the council without any revisions. However, the subcommittee had requested that the council work with the Labor Commissioner to pursue federal recognition for Nevada's apprenticeship program with the United States Secretary of Labor and report to the subcommittee on these efforts prior to the 2015 legislative session. So during the Sunset Subcommittee's review of the council this interim, some of the issues discussed were confusion between NAC 610.240 and 610.314 regarding whether a program of apprenticeship registered with the council that submits standards to the council for its review or revision must submit the standards in their entirety. The council stated that in the future, it would review the full standards, not just the occupations, when it brings a standard forward for review. So they stated that at the review on May 4th. And the second item was whether certain apprenticeship programs through a community college meet the standards to be actual apprenticeship programs, specifically if the programs have an employer partner. Mr. Williams has since confirmed that the apprenticeship programs do meet the standards to be actual apprenticeship programs. And the third item was an employer representative position in Northern Nevada has been vacant since December 2019 and has been awaiting appointment by the governor. My understanding per Mr. Williams, as of last week, that position remained vacant. The council's intent to post all forms, including forms to start an apprenticeship program, to its website and clean up its regulations. My understanding per Mr. Williams is that that is still a work in progress. Richard Williams, the state apprenticeship director, and Archie Walden, the chair of the council, are both available via teleconference if the subcommittee should have any questions for them. I hope they still are. The questions before the subcommittee are, again, should the council be terminated or continued? And if the subcommittee recommends terminating the council, should it be consolidated with another entity or have its duties transferred to another entity? And if the subcommittee recommends continuing the council, does the subcommittee want to recommend any changes concerning the council? There were no statutory changes requested by the council. Thank you.
Committee members, any discussion? Any questions?
Madam Chair?
Yes.
We had a large couple meetings with the state and we did this at the college and the college was packed solid. Some of the issues out here in rural Nevada will not work. I'll give an example for a little bitty school project that was happening in Eureka, of all places. They had to call and get permission, and Skip can probably give you more information on this, and which he's a expert. But in rural Nevada, this creates a problem with the counties and the school districts and everybody else. If they can't get people down here, they got to call and get authorization not to do it. But that shouldn't be the way to do it. It's a right to work state that they should be able to say, okay, we can't get the apprentice down here. This is a small project. Therefore, we shouldn't have to go and ask somebody for permission. So the problem we're running into is the college has an apprenticeship program, but these guys are in school. So, and in the summertime, it wouldn't be so bad, but the mines pick them up. So we're having a hard time meeting the requirements of this in rural Nevada. And what they need to do is raise that cap up to a higher base or put something in place. Because right now it's very hard for Eureka, Tonopah, Hawthorne, Elko, Wells, Wendover, all these places out here in rural Nevada comply to this law. Reno and Vegas is where this should be. The people that bid on the jobs bring, the union people, they bring their own people anyway with their own apprentice. So that's not the issue. The issue is the smaller projects like Cap Mechanical and some of these other ones. It's almost impossible. And to give you one other idea, if you have a trucker out there and he's got two people driving trucks handling the gravel, then they've got to have an apprentice on the project when they don't even need one. So I know that there's going to be disagreements on this, but the problem is this is not working for everybody. And I don't know if I got to put it on a personal bill or whatever, but you should see the amount of people that showed up in opposition to this at the college with the Labor Commission and with LCB. So anyway, you can hear our concerns out here in rural Nevada that this does not work. Thank you.
Madam Chair?
Yes.
Oh, Senator Brooks, you're on mute.
There we go. Thank you. I believe Assemblyman Ellison might be referring to the recently enacted apprenticeship requirements for public works projects. This, however, has nothing to do with that. This is just the Apprenticeship Council as a body and whether or not it should exist. And so I believe that Senator, or excuse me, Assemblyman Ellison is referring to a different subject and that we maybe should address next session, but this is something separate from that. And so whenever you're ready for a motion, I would love to make one.
I agree with you. My problem is I think that this bill that created this come from this council, and I might be wrong, but I thought that this would actually come from this council, which actually introduced the bill, which got it passed to the last session.
Madam Chair? That was
Yes.
Senate 207, and I introduced that bill. And so it had nothing to do with the Apprenticeship Council. The Apprenticeship Council is just a body created almost 100 years ago to look over apprenticeships, statewide, union and non-union, and public work and private work. And so, I believe I know which bill you're talking about and what law you're talking about. And so, but it has nothing to do with this.
Madam Chair, Assemblyman Daly again, and Senator Brooks is correct. SB 207 is not on the agenda. In fact, it's not even administered by the State Apprenticeship Council. They oversee and regulate and approve apprenticeship when a person has to do the SB 207 requirement. That's administered by the Labor Commissioner, and it's under a fully different statutes. Got nothing to do with the State Apprenticeship Council, and they didn't implement it and had nothing to do with it. Senator Brooks is absolutely correct on that.
Okay, thank you very
I
much.
think-
Thank you for that.
Yeah, and I was going to say, I believe Senator Brooks, I believe you're right, because it came through Commerce, if I'm not mistaken. So we're talking two different subjects here. Assemblyman Ellison, I do understand your passion for the points that you've made, but I think that the argument would probably be better suited for a different question.
And I thank you. And I should have got that a little closer, but I didn't know they were connected. So thank you very much. And I appreciate that. And I appreciate the statements from all. Thank you.
Thank you. Thank you. And so I'll entertain a motion.
I'd like to make a motion to continue the council and with the suggestions that were made and requests that were made in their original hearing and that are contained in this work session document.
Thank you. I have a motion by Senator Brooks. Do I hear a second?
Second.
Second from Vice Chair Howdiggy. Any further discussion, questions?
Yes, Madam Chair, just quickly, the first bullet point, the confusion between NAC 610-240 and 314. It is the motion including reconciliation or fixing that confusion?
Madam Chair, if
Yeah, I think is your Senator Pickard, is your question directed to the motion made by Senator Brooks?
Yes, I just although if the conflict or the disconnect has been resolved, maybe we need to know that.
Senator Brooks, you care to respond?
Yeah, according to the hearing we had, and then the work session document here, the conflict seems to be resolved by the council stating that in the future it would review the full standards, not just the occupations, when it brings a standard forward for review. So I took that to be resolved, and this document would make a history of that or a record of that.
Right, and maybe I just misunderstood it because I thought it just stated that they would resolve it in the future, and I want to make sure that we don't lose track of that.
And I don't think we'll lose track of it. I think it's been established that Assemblyman Ellison's questions or query, although important, were not relevant to the question at hand, and so it would be taken up under in different circumstances at another time. So Senator Brooks, did I categorize your response correctly?
Well, Madam Chair, this particular issue is different from that issue as well, and I in this particular issue, and when we met with them, and in subsequent conversations, and if Mr. Williams could chime in if it makes any sense, they said that they would operate that way in the future, and this just kind of memorializes that statement. And when in the motion that I made to continue the council, and with the suggestions, and that being one of them, included in that motion, this is one of the suggestions that I'm referring to.
Very good. And that was my question, Madam Chair. Thank you.
Okay, thank you. We've had the motion made by Senator Brooks.
Madam Chair, Richard Williams.
Yes?
Yes, Madam Chair, this is Richard Williams, the State Apprenticeship Director. I could clarify that
Okay,
further.
can you speak a little louder, please?
Yes, this is Richard Williams, State Apprenticeship Director. I could clarify that further, Madam Chair, if you'd like.
Okay.
Yeah, just to end any confusion, the State Apprenticeship Council has reviewed that, and going forward, we have been implementing the standards with the occupations. So that confusion is no longer.
Thank you. Thank you.
Madam Chair?
Yes?
Yeah, it's Assemblyman Daly. And I'm just make sure, so their answers to the questions that we talked on the deal that are bullet points in the document are not requesting any changes to their statute or regulation or anything else. I think the statutes speak for themselves. There was some confusion. The statutes did require the full standards to be looked at. There was, as I recall, a bit of an interpretation issue with their Deputy Attorney General, but the board has taken the action. So the motion needs to just be to continue the board with no changes. We understand that they've answered several questions, but we're not making any recommendation to change anything in their statutes. So that's why I was going to ask the same questions about the senator's motion. To be clear, there's no recommendations from the board for any change or from the State Apprenticeship Council for any changes. So I'm not sure exactly what's included in the motion other than to accept that they gave us answers or something. I'm not following. So I guess there needs to be some clarification. I do support continuing the State Apprenticeship Council, but they didn't ask for any changes.
No, well, and I believe it says the council didn't seek any statutory changes. So Senator Brooks, can you repeat please your motion?
My motion is to continue the council. And if you read the work session document, there are 4 bullet points. At least 2 of them are suggestions that they continue with a certain type of behavior that doesn't require statutory change. My motion would be that they continue as a council and take those suggestions.
Thank you. And it was seconded by Vice Chair Hadagi.
Yes, Madam Chair.
Okay. Mr. Margarejo, will you do a roll call, please?
Madam Chair. Senator Brooks?
Yes.
Senator Pickard?
Yes.
Senator Spearman?
Yes.
Assemblyman Daly?
Yes.
Assemblyman Ellison?
Yes.
And Assemblywoman Howdy.
Yes.
Okay, thank you.
Madam
So,
Chair, the motion passes unanimously.
okay. Passes unanimously. Thank you all. Thank you for the vigorous discussion. We will have fun in the 2021 session. I am sure of it. So we are on to Advisory Committee to Study Laws Concerning Sex Offender Registration, number 13.
Okay, thank you, Chair Spearman. This is Jennifer Rudy, Committee Policy Analyst. So the 13th Board Commissioner Council on the work session document is the Advisory Committee to Study Laws Concerning Sex Offender Registration. The 2009 legislature created the Advisory Committee to study laws concerning sex offender registration to identify and study issues relating to state and federal laws concerning the registration of sex offenders and any litigation concerning those laws in response to the Adam Walsh Child Protection and Safety Act. The Attorney General or his designee serves as the chair of the committee. The Sunset Subcommittee had not reviewed the committee prior to its review on February 21st, 2020. At the time of its review, the committee had not met since October 2nd, 2018. However, since that review, it met on July 29th, 2020. According to the agenda, it was via a life-size video conference call. 2 representatives from the Office of the Attorney General appeared before the Sunset Subcommittee during the review in February and recommended that the study of sex offender registration laws should take place within the Advisory Commission on the Administration of Justice, ACAJ, the Nevada Sentencing Commission of the Department of Sentencing Policy, or perhaps both entities for the following reasons. The Advisory Committee's narrow scope leaves out many critical issues, and the membership of the Advisory Committee lacks certain stakeholders. The AG is a member of both the ACAJ and the Nevada Sentencing Commission. My understanding was that the recommendation was to create a subcommittee relating to juvenile justice if it is consolidated with one of those two commissions. According to the representatives from the Office of the Attorney General, the 2009 legislation creating the committee, among other provisions, was the subject of considerable litigation regarding its constitutionality for over 10 years. In 2018, the Nevada Supreme Court lifted an injunction on the enforcement of the legislation, and Nevada began implementation. The Office of the Attorney General further noted that Nevada is currently compliant with all federal sex offender registration and Notification Act requirements, and the courts have addressed the issues that led to the need to study these specific laws. So at this point, the subcommittee is asked the question, should this committee be terminated or continued? If the subcommittee recommends terminating the committee, as the Office of the Attorney General had requested at the hearing in February, should it be consolidated with another entity? And then the Office of the Attorney General had suggested either the ACAJ or the Nevada Sentencing Commission, or have its duties transferred to another entity. If the subcommittee recommends continuing the committee, does the subcommittee want to recommend any changes concerning the committee? My understanding is that Katie Brady, the Attorney General, is available via conference if the subcommittee should have any questions for the.
Excuse me, just a minute. Can everyone please mute your microphone, please? I'm sorry. Ms. Reedy, can you go back over that? We had a little interruption there.
Okay. At this point, Katie Brady from the Office of the Attorney General, I believe, is on teleconference if the subcommittee has any questions for the committee. However, this is the point where the subcommittee would vote to determine whether this committee is terminated or continued. And if it is terminated, should it be consolidated with another entity, and which entity, or have its duties transferred to another entity? And if the subcommittee recommends continuing the committee, does the subcommittee want to recommend any changes concerning the committee? Thank you.
Thank you. Any questions?
Madam Chair, it's Vice Chair Howdige. I have a question right now. I know that right now Nevada is currently in compliant with all federal sex offender registration and Notification Act requirements. If we do take the Office of the Attorney General's recommendation to terminate this committee or move it into another as a subcommittee, would we still be compliant?
That's a very good question. Ms.
This
O'Grady?
is Katie Brady from the Attorney General's office. Oh, thank you. I can answer that question for you. The SORNA compliance isn't contingent on whether or not this committee exists. So if the committee is either no longer exists or is moved to the advisory committee or the sentencing commission, it won't affect compliance at all.
And if I could, just one more question, Chair. Ms. Brady, would it be more effective being under one of the other two commissions? I was appointed in 2018 to sit on the advisory committee to study laws concerning sex offender registration. And during that time I was appointed, we only met once. So I didn't feel that it was a very effective committee. And so I'm wondering if it would actually be more effective under one of the two commissions that have been recommended, or if one of the two commissions is already assuming these responsibilities and the study of laws concerning sex offender registration is already happening under one of these two commissions, is it necessary to move it, or should we just terminate it? So could you tell me first if whether or not this is already being studied under one of these two commissions? And if it is not, then which one would you recommend it live under?
So this is Katie Brady from the Attorney General's office. To answer your first question, the sex offender registration laws are tied with a lot of other laws that have to do with lifetime supervision and supervision of offenders generally. So I know the ACAJ does deal with some of these issues, and I believe that the Sentencing Commission does as well, but there's no direct mandate that they study the sex offender laws within the outlines of either of those commissions within their statutory mandates. But their statutory mandates are broad enough to cover registration of sex offenders. And as to your second question, the Office of the Attorney General recommends that this commission be moved within the ACAJ or the Sentencing Commission. I think one of the main reasons for this recommendation is the Department of Public Safety, the Division of Parole and Probation, the Nevada Department of Corrections, and the State Board of Parole Commissioners all don't have a voice in the committee as it stands right now. But they do have voices on the ACAJ and the Sentencing Committee, and they can speak as to the practical application of this law and the practical issues that come up with the sex offender registration laws. So it's the position of the Office of the Attorney General that that would be a better place for this commission to reside. Thank you.
Thank you, Madam Chair.
You satisfied?
Yes.
Additional questions or discussions? Hearing none, I will entertain a motion.
I can make the motion, Madam Chair, that the subcommittee recommends consolidating the advisory committee to study laws concerning sex offender registration with the recommendations of the Office of the Attorney General.
Do I hear a second?
Second.
Second, is that Senator Brooks?
Yes, it was.
Okay, so I have a motion made by Vice Chair Huddy and a second by Senator Brooks. Any further discussion?
Just a question, Madam Chair.
Yes.
Are we suggesting either the Advisory Commission on the Administrative Justice or the Sentencing Commission absorb this, or how do we determine where it ends up? Is that a question for the Legislative Commission then?
I believe that.
Or would it be at the recommendation of the Office of the Attorney General?
My understanding is they're making this recommendation that it go to one or the other, and that's what I'm trying to tie the ends on. I would think we would want to make a recommendation where it goes. The Attorney General's office is asking that it go, or recommending that it go to one or the other. Shouldn't we be making recommendations for that, or are we leaving that up to the Legislative Commission for the bill draft?
If I heard correctly, the motion is to let the Attorney General decide and not us. Did I hear that correctly, Vice Chair?
Correct, Chair. I was leaving it to the recommendation of the Office of the Attorney General to consolidate it within the commission that they deem it would most appropriate fit under.
That's the recommendation, Senator Pickard.
Very good. That's all I needed to understand it. Thank you.
Okay, thank you. Any further discussion? It's been moved and properly seconded. All those in favor, Mr. Magalejo, will you do a roll call, please?
Senator Brooks?
Yes.
Senator Pickard?
Yes.
Senator Spearman?
Yes.
Assemblyman Daly?
Yes.
Assemblyman Ellison?
Yes.
And Assemblywoman Howdy.
Yes.
And the motion passes unanimously.
Thank you, sir. And we will move now to item number 14, State Board of Cosmetology.
Okay, Chair Spearman, this is Jennifer Rudy, Committee Policy Analyst. The item number 14, the 1931 legislature created the State Board of Cosmetology, and while it was later modified several times by legislation, the most substantive changes occurred in 2017. The board is currently comprised of 7 members appointed by the governor, and since the subcommittee's review of the board on February 21st, the one vacant position has been appointed. That was the nail technologist position, I believe. Below is the list of the current members and their terms of service on your work session document. While the board did not request any specific statutory changes, it noted that the services provided by estheticians are becoming more diverse, and the statutes may need to be reviewed and possibly updated to reflect this change in the beauty marketplace in the future. The subcommittee previously reviewed the board on April 27th, 2012, and on June 5th, 2012, the subcommittee recommended continuation of the board. Should the board be terminated or continued? If the subcommittee recommends terminating the board, should it be consolidated with another entity or have its duties transferred to another entity? And if the subcommittee recommends continuing the board, does the subcommittee want to recommend any changes concerning the board? I do not believe there were any recommended changes from the State Board of Cosmetology. And there are actually 5 representatives, or at least there were supposed to be, from the board available on Zoom if the subcommittee had any questions.
Thank you. And I think the only embedded in the last paragraph was the review of the esthetician requirements, and that will take place, that the board will do that, correct?
Yes, that is my understanding, that they said in the future that may be an item that they may need some statutory changes, but not yet.
Okay, thank you. Are there any questions or discussion? Item 14.
Madam Chair, I'm happy to make the motion to continue the State Board of Cosmetology without any additional recommendations. I think they do a great job.
I'd like to second that motion, Chair.
Okay, Vice Chair Adegi seconded the motion. Any further discussion? Mr. Melgarejo, please call the roll.
Senator Brooks,
Yes.
Senator Pickard,
Yes.
Senator Spearman,
Yes?
Assemblyman Daly,
Yes.
Assemblyman Ellison,
Yes.
and Assemblywoman Howdigy.
Yes.
Motion passes unanimously.
Thank you, sir. We'll move now to item 15. State Barber Health and Sanitation Board.
Thank you, Chair Spearman. This is Jennifer Rudy, Committee Policy Analyst. The State Barbers Health and Sanitation Board. The 1929 legislature created a State Barbers Health and Sanitation Board. The board is comprised of 4 members. The Chief Medical Officer is an ex officio member or a member of his or her staff designated by the Chief Medical Officer, and 3 members who are licensed barbers appointed by the governor for terms of 4 years. The current members are Nancy Hathaway, Johnny Williams, Royal Byron, and of course the Chief Medical Officer. Just to point out, Royal Byron was appointed since this committee or this board was reviewed in February. He was appointed in July 2020 to replace Nathaniel LaShore, who you will recall had served on the board for approximately 30 years. And he is no longer serving on the board as of July 2020. During the Sunset Subcommittee's February review of the board, no statutory changes were requested. However, some of the issues discussed were testing is normally done on Sundays in a barber school, and the board meets on the same day in the afternoon. Meetings are not streamed over the internet. Those who want to attend a meeting must be present at the location. Members of the board are paid $150 when they inspect facilities, test applicants, or attend board meetings. Pursuant to SB 206 of the 2017 session, members now serve 4-year terms and they cannot serve more than 3 terms. Statewide, there are 1,532 licensees, 12 licensed instructors, 366 barbershops, and 4 barber schools, with the 5th one ready to open in Henderson. That was as of February. I'm not sure if that is open or not. The licensing process takes about a week for applicants who have all the required documents. Reciprocity for military families takes 2 days if their information is complete. The board offers temporary licenses within 1 day for students coming into the state so they can begin work immediately. The board posts its agendas, minutes, and testing materials on its website. The board uses its revenue for operating expenses, and it is trying to save money to update its Internet Access and Licensing Department. According to the board in February, the Division of Enterprise Information Technology Services, Department of Administration, had quoted the board $50,000 to set up an electronic credit card system and $10,000 per year for maintenance. However, I noticed on the minutes of the board's meeting held on May 31st, 2020, the board voted to hire Continental Management Consultants to redo and update the board's website to allow for credit card payments and more online accessibility. That was at the May 31st, 2020 meeting, and that was in their minutes. The estimate included a price range of $8,000 to $12,000 according to minutes of the meeting. Also, according to the agenda, the meeting was held at Masterpiece Barber School. Currently, the board offers tests for barber licenses every other month, and the testing schedule is set during October for the next year. I really need to strike this next sentence because it's the testing schedule set forth in NAC 643.450 is just for the examination for the instructor's license. So I'm sorry, that is an error. The citation for NRS 643, so that's the NRS 643.100, should have been included here as it requires the board to conduct examinations not less than 3 times each year for applicants for licenses as a barber, applicants for licenses as an apprentice, and applicants to enter barber schools. So the board has set a schedule of every other month, but it does not appear in regulation for those 3 different applicants. So it appears they are offering the examination for those 3 applicants more frequently than what is required in NRS 643.100. Then the final bullet point, the board does not offer reciprocity for instructors. They must take the exam, which is offered no more than twice a year per regulation, NAC 643.450. A national testing company is used, which deems that no instructor affiliated with the school can be a proctor. This means the board must bring in outside proctors for the exam. And I do believe Antoinette Maestas, the Secretary Treasurer, is available via teleconference should the subcommittee have any questions for the board. Otherwise, the questions for the subcommittee for this board again are if the subcommittee recommends terminating the board, should it be consolidated with another entity or have its duties transferred to another entity? If the subcommittee recommends continuing the board, does the subcommittee want to recommend any changes concerning the board? Thank you.
Any discussion? Questions?
Madam Chair.
Yes.
I remember this discussion fairly clearly. There was no question in my mind that the existing board, when we did the review, is passionate about what they do. They had a number of members of their community that were there. There's no doubt in my mind that they do what they can with their limited resources. But I was left with a strong impression that this is a board that operates as much as they did 20, 30 years ago. There wasn't a lot of organization that made it accessible to those that were coming in. The testing had to wait until after the instructor was finished with their customer before they could go off and do it. Little, if anything, was available online, though I'm glad to hear they wanted to address it. But ultimately, when you compare that with what the cosmetology board has been able to accomplish over the last couple of years, and particularly since the Board of Cosmetology indicated that they could absorb without doing away with barbers, but they could absorb the operation, I felt pretty strongly that we should probably consolidate the 2. I'm prepared to make a motion to that effect, but that would be premature. Probably ought to talk about it first.
Madam Chair, it's Hannah Brown.
Yes,
to Senator Pickett's point, I think it's deplorable that we have a situation where you can only test instructors twice annually. That's every 6 months. So that means if I come into Las Vegas or Nevada, in January. I can't be tested until June, so I'm going to sit out not being able to work and get a job until then. And I really think the whole testing schedule I find very difficult to accept, because we should have rapid testing. Our goal should be to put people to work. So I do agree with Senator Pickard that some changes do need to be made.
Thank you, Ms. Brown. Additional comments or questions?
Yes,
Madam
I do.
Chair, this is Hampton at my state. Oh, I'm sorry.
I can't see anybody except myself and Ms. Reedy, so just jump in. That's Senator Ellison.
Thank you, Madam Chairman. And I understand that this board is struggling really bad. But did they not say, Mr. Pickard, that they were going to move up the licensing instead of waiting that many months, that they were going to move them up and try to get them out more rapidly? Or did I misunderstand that?
Well, that would probably be a question for staff. My recollection is that they did suggest that they could do better. But as I understood the details of the last board meeting that they had, they didn't actually address those things. They talked about their website and credit card services. They talked about the timing, but they didn't actually make any changes. And if I recall, the cosmetology board, they can get a license out from start to finish within 24 hours if they've met all of their education requirement. They basically have to take the test, which is available online, or at least they can provide it. And then they have to come in. The only thing they have to do in the cosmetology office is to do their practical test, which they schedule at their convenience. And so they can have, and they walk out with a license. So I think what we have is a situation where we're looking at probably one of the best, most efficient boards versus one of the more and most antiquated and inefficient boards. And again, I'm not trying to cast any aspersions on the board members. It just, this is how they have evolved. And I think that under the circumstances, the existing board probably could not implement the kind of changes that we are requesting as quickly as the cosmetology board could put into practice if they just consolidated the boards. And that way too, since we're essentially running in parallels, granted they have slightly different standards, but my guess is that as we consolidate the two, we would have members of the barber board as part of the process so that we could create a system that would essentially put people to work in very short order. And I don't believe that the barber board, particularly given their fiscal restraints, had the capacity, and they suggested at the hearing, as I recall, that they couldn't put into practice much of what we were talking about immediately because they lacked the resources to do it. So under the circumstances, I think that given the totality, it would make more sense in my mind to consolidate the two. Again, not do away with the barber profession, but allow them to step up and into a paradigm and a system that is already set up to accommodate it. I think that's the better option. That's my personal view.
Madam Chair, Hampton at my
Yes.
Madam Chair, Hampton at my the Nevada. Can you hear me?
Yeah, I heard someone say follow up.
Yes, ma'am.
Okay, yes.
Staff, when they give us the report, they said there was so many that were licensed and there was so many getting ready to come online. Could you tell us what that was again? Jennifer, I think you read that off.
Yes, thank you. This is Jennifer Rudy, Committee Policy Analyst. Statewide, as of February 21st, 2020, when they were reviewed, they noted that there are 1,532 licensees, 12 licensed instructors, 366 barber shops, and 4 barber schools, with the 5th one ready to open in Henderson. Thank you.
All right, thank you. And I thought there was a lot more than that. So I understand where Mr. Picker, where you're coming from. I just hate to put any more burden back on the already burdened staff that they've got on the cosmetology board. And has anybody talked to them about being able to take the extra load?
My recollection, Assemblyman, was that at the review, the cosmetology board affirmatively stated that they could handle this, but I don't want to speak for them. If they're still available, maybe they can speak to this.
Yeah, thank you.
Is someone from cosmetology still here?
Senator Spearman, this is Antoinette Maestas with the Nevada State Barber. This is Antoinette Maestas with the Nevada State Barber Board. Can you hear me?
Mm-hmm.
If I could just add, when we're talking about numbers, our numbers aren't as the cosmetology board, but we do have updates. It's 1,618 licensed barbers. You had asked me for the number of females. Out of that is 419 females. We have 148 veterans out of those. Our shops have raised to 392 barber shops. We are still at 4 schools with the 5th one in progress. We are up to 14 instructors at this time. We did implement, we're getting ready to go totally online with our website. That should be, I have a meeting with the web designer Wednesday, and he's telling me within 30 days we should be fully up and going, and everybody will be able to access the web, do everything that they need to do on there, renew license, schedule exams, everything. If we need to increase our number of testing, we have done that already, and we are doing every other month as of now because of the call for it. We don't have 30,000 licensees like the cosmetology board does. That's why we have what we have there. We accommodate, I will tell you that when COVID hit, we had to cancel an exam because everything was closed. As soon as we got the okay to go ahead and do that, we did it immediately to get these students to work, get them out there working. Nobody was working at the time that we had to cancel the exam anyway. But I'd be more than happy to answer any questions that the committee may have. Like I told you, we are updating. We're working on that vigorously to get that going. We took your recommendation at the last hearing, and we finally found somebody in our price range to do that. And it's been in the progress now for about 6 weeks. If you have any questions, I'm more than happy to answer any of them.
Additional questions?
Madam Chair, I believe the Board of Cosmetology is still on. I saw them pop up on the screen. Could we hear from them as well? Because again,
okay.
Senator Pickard had a great point. I believe it was Senator Pickard about their ability to take on the Barbers Board and whether it would hinder their board at all in any way or service to their members.
Okay, someone from Cosmo?
It's Gary Landry, Executive Director.
Can you speak a little, please?
Gary Landry, Executive Director. I just wanted to let the subcommittee know that the Board of Cosmetology is ready to take on any new services that we're required to do by law, and we have the staff available to do that. So there'd be no problem with us doing any of bringing any of the services on under the Board of Cosmetology.
Madam Chairman, I've got a question, if I may.
Yeah, and I was just going to ask just one real quick question. You said you can take on any, what is the significant difference, because we're talking about consolidating You're talking about understanding the requirements, the schooling hours, the practical. How similar or different are the courses for cosmetologists and the courses for barbering?
Courses are pretty much the same except for shaving. Cosmetologists don't do shaving, but all the other services are pretty much in line. And we would just have to study the laws that they have and combine them with our laws. It wouldn't be a difficult task.
Councilman Ellison?
Thank you, Madam Chairman. The question I've got is, for the licensing, I think that's the biggest concern we've got is, if any, but you'll have to tell us, you're going to have to try to take those that are existing and those that are coming on board that you can handle to increase these quicker than what's happening now.
Gary Landry, Executive Director of the Board of Cosmetology. Right now, we do 3,000 new licensees every year, in addition to what we've had in the past. So adding 1,300 is not a big implementation for us.
Thank you.
Madam Chair, if I can ask them just one question.
Yes.
Thank you, Madam Chair. Mr. Landry, appreciate you staying on. Is it fair to say then that you would be managing, but not supplanting, but you would simply manage their existing operation under your systems, and thus you're not changing their world necessarily, you're not changing their licenses, you're not changing their standards, you're not changing their schooling requirements. You would be simply absorbing the administrative side and be able to provide new licensees the ability to get their licenses more quickly and more efficiently service the existing licensees. Is that a fair statement?
That's a fair statement. We don't anticipate getting rid of any of the laws. We would incorporate their laws into our laws and make it one law book that takes care of all licensees, barbers and cosmetologists.
Thank you.
And if I could, Madam Chair, just make one comment too. I know the Barbers Board said that they have 1,618 licensees and they're a smaller board, which is why some of their processes are in place and are different than what the Cosmetology Board is. But just, I think the services that can be provided to students going and getting their barber's license by being by being part of the Cosmetology Board, it would be a great benefit to them. Now they'll be able to go in and take their tests and get their license in the same day, have access to more tests, just like the cosmetologists do. And then again, and have the resources there, something that a larger board can provide because of the resources they have, because of their size. Now, students who are getting their barber's license will also have access to all of that.
Thank you.
Madam Chair, I have a question.
Yeah. Mm-hmm.
And this is for the representative from the Barber Board. It seems, I think they're completely two different crafts, two different histories, two different, completely different business models. And so I can see the benefit of having two different boards. But a question was brought up about access to testing. And Ms. Brown, she said it was unacceptable that testing could be over 6 months, depending on when you fell and when you got to Nevada. I agree. And is there anything are there any plans underway, or is there anything that can be done that can facilitate more rapid testing for folks that are trying to get to work or back to work? But that wouldn't necessarily have an economic impact on your current licensees.
Set my up this Nevada State Barber Board. Yes, we saw the need that we needed to test more frequently, so we did that for licensees. We do not have the demand right now in this office. There's not one application for an instructor. When there is an instructor application, we schedule immediately for that. As far as our license, the regular barbers go, students coming out of school, we work with them significantly. We do set a schedule, but if we saw the need that we had licensed or more students coming all the time, we would definitely up that, and we're willing to do it. If we have to do it every week, right now, there's not the need for it. When the need arises, we will do that. I hope that answered your question, and thank you for seeing the difference, because there is a big difference.
Madam Chair, may I follow up with a question? So,
Yes.
So what's the turnaround? Like, so if a barber moves to Nevada and needs to get licensed in Nevada, or if somebody reaches their hours necessary and wants to test, what's the turnaround from when, you know, a person makes that request to when they would be licensed?
At my SS Nevada State Barber Board. Right now, we are testing every other month because that is the need. I mean, our next test is going to be scheduled for October 4th. We have 3 applications sitting in here. So it depends. Once they take the test, pass the test, they get their license within just a couple of days. Anybody for endorsement, as soon as they get a completed application in here into the office, it's usually within a day.
Oh, so for endorsement from out of state, you can turn that around in a day?
Correct. As soon as they get their application completed in the office, it's usually within a day.
Oh, okay. Thank you. Thank you. That really puts my concerns to rest.
Thank you.
This is Vice Chair Howdy. Madam Chair, if I could just jump in and ask a couple of questions. Obviously, I want to do what's going to be best for the barbers community. And my whole thing is, you know, how can we best serve the community? And so I think the Barbers Board just needs organization. I know that, you know, the need isn't there, but is this something you can work towards? And this is obviously a question for the Barbers Board, the representative from the Barbers Board. I know that you're starting to do this by adding in more test states, but and having the website implemented. Could you just walk me through a little bit now when the website is going to be complete and what services will be offered through the website to students and licensees?
Absolutely. I'm at my SS Nevada State Barber Board. I'm thinking within the next 30 days, I have a meeting, like I said, this Wednesday with the designer. He's got almost everything done. He said he was just going to put the final touches on it. So once that is up and running, they will be able to schedule their exam. They'll be able to renew their licenses. They'll be able to submit a new barbershop application. They'll be able to do everything online, pay online, everything online. So that's going to be within, I'm assuming, the next 30 days complete, because he said it's just the final touches. I'm sorry, what was the next part of the question?
Oh, that you actually covered it, when it would be up and running and what services would be available to your licensees and students on the website. But just one last question, if I could follow up. Is this being done, is there any increases to the licensing fees to pay for this, or is that staying the same?
It stays the same. It's absolutely the same. Our licensing fees right now are renewal is $60 for every 2 years. So it's $30 a year.
Okay, perfect. Thank you. And that's it for my questions, Madam Chair.
Additional questions?
And we've been able to operate off of that.
Yeah, Madam Chairman, I've got one, if I may.
Yes.
It seems like that, you know, you've got one that's a well-oiled machine. You could tell by the brochure they put out was fantastic. But you got one that's now stepped up the plate and started moving forward, it sounds like, to follow what the Cosmopolitan Board is doing. Is there a way to allow them to bring everything up to speed that they said in 30 days, but say 6 months? And at that point in time, after 6 months, if they can't comply, then it automatically goes over to the Cosmetology Board, and you could oversee their website and what they're doing, maybe with a couple of assemblymen or senator people with you, however you see, but it seemed like to me that we give them a task to do. They did do that. And I think the Cosmetology Board has done a great job, and I enjoyed their brochure, but we asked the people at the barber shop, the barber board, to go forward and bring on a website how they're going to fast track the haircut or the application and the stuff like this. Apparently, what I just now heard, that they've done that or starting to do that in less than 30 days. I hate to cut them off at the knees, and if they are going to bring it forward, but at least there is a good operation that can pick it up in 6 months if we had to, and that'd be your decision to make.
Well, I think that would be the decision of the subcommittee, but I hear what you're saying. I do have a question, because this was a point of contention. The board meetings, where they're being held, and as I understand it, there was not an opportunity to for people who wanted to attend online. In this current environment, it's imperative that every board have that as their main protocol for meetings. How are you all doing with board meetings online? To the barber board. Hello? Are they still there?
I apologize. I'm sorry. I apologize for that. I thought I was unmuted. We are working towards getting it teleconference. We can do that now. But Senator Spearman, I'd be more than happy to work with you on a one-on-one basis and see exactly what you want from us. We will get up to speed with this. We're working towards this. I know our licensees do not want to see this board combined. But like I said, I'm willing to work with you guys. The board's willing to work with you. We have stepped it up. Like I said, this website will be totally functional. I'm gonna guess within 30 days. And I do agree with you on the in the time that we're in, we have to be able to do this. So we are available now. We are ready to do teleconference.
Madam Chair, it's Hannah Brown again. Is there any reason that the meetings are continuing to be held in a barber shop rather than a professional environment?
Well, they shouldn't be
Esther.
more. Are you all holding meetings in person?
We are holding meetings in person. And we
Now?
are following the social distance. We are following the social distancing, yes.
No.
Okay, and
We were
where are your
advised by our
meetings
attorney
held?
we could do that.
I'm
They're held
sorry?
at a barber school. Can you hear me?
I can
Can
hear
you hear me?
I can hear
Okay.
you.
They are held at a barber school, and we are following social distancing. We were advised by our attorney, as long as we stayed the 6 feet apart, that we could still do that. But somebody is able to call in now. But if we need to move those meetings to the Grant Sawyer building, we'd be more than happy to do that also.
I don't think you need to do that. I really think that, complying with what every other board has been asked to do, and that is, Zoom takes like 5 minutes to set up, and there's a nominal fee.
Correct.
And
correct.
And just for the sake of everybody's safety and to maximize it, because if you remember correctly, the issue that I and other members of the subcommittee had the last time was the fact that the board's meetings were not accessible to everyone. And being that this is a public entity, it must be accessible to everyone. And so if you're having a meeting in a barber school, what is the capacity of the barber school? Where is it located, and what is the capacity of that school?
It's located at 3510 East Bonanza. It's like 6,000 square feet. We've arrange chairs in there for everybody to be able to come in person. We are doing teleconferencing now. But like I said, if you want us to move to the Grant Sawyer building, like the Cosmetology Board does, we're more than happy to do that too.
Hey, Madam Chair, I have an additional question, and it's about having the testing on Sundays. I've been around a work environment all of my life from a kid, and I never experienced having a test on Sunday. And my question is there any particular reason for that?
Madam Chair, Antoinette Maestas, the reason for that is the school is closed on Sundays, and we want the applicants, the students, to be in a barbershop environment. It's not fair to them to test in a convention hall that is not a barbershop setting. They've got sinks, they've got stations, they've got everything there to demonstrate the practical portion of the exam that they need to do. We've got lather machines, we have it all there.
So, Gary, this question for you for the Council Board. So when you all test, where do you test and how do you test, and how would that be different or similar to what the Barber Board does currently?
Gary Landry, Executive Director, Nevada State Board of
Speak up a little bit.
Okay. We test in testing classrooms in our board office. We have multiple stations set up to test. The practical testing is done at the schools. The schools perform the practical testing. When they say the student is ready, the student comes and tests at the board office and are issued a license that day. Different from the Barber Board. The Barber Board tests the practical and the testing at the barber school.
Where do you all hold your meetings now? Where your meetings held now?
Meetings are now held over Zoom. We use Zoom meetings and hold all our meetings that way. We've had good success.
For
with
how
it.
long?
Since the
Since
emergency was put in, emergency regulations. As soon as the emergency regulations are taken off, we can then go to the Grant Sawyer building. But until then, which will probably be this summer, we're going to hold all our meetings over Zoom, and we've had no problems with Zoom.
Madam Chair, dear with Cheney, I just think Assemblyman Ellison's recommendation is really a great recommendation with regards to a limited time frame in the interim to try to, whether that's a 30 or 60 day kind of entity, to kind of shore up some things and then kind of reevaluate and assess then. I really think that may be the direction to go to. And then if they do not kind of bring it up to kind of par, to kind of go into the other direction.
This is Vice Chair Howdy too, or give them our list of recommendations and have them come back to you during the next interim sunset subcommittee. Just as the other boards do, we give them the list of recommendations we would like to see or the changes we would like made, and then they have this time to work on those changes and then present to the next interim sunset subcommittee. And at that point, we can evaluate their progress.
Additional comments?
Chair Spearman, this is Senator Brooks. I agree with Assemblyman Ellison and Mr. Cheney, as well as Vice Chair Howdy, especially the point that Assemblyman Ellison made about we've asked them to do a thing and then they're doing it and just, not giving them an opportunity to get to that place that we've already asked them to get to, I think just wouldn't be fair and would be a little premature. And so I look forward to seeing them modernize and see how we can help them modernize. But I think right now any action would be unfair on our part until they've shown us what that they can do and what we've asked them to do.
Any additional comments?
Chair Spearman, I like where this conversation has gone. I have no problem. I have no particular interest one way or the other, except to make it more accessible and more efficient. I agree completely that if we came up with a list of recommendations and expected them to do that in a given period of time, that's probably an appropriate way to go. I'd be interested to know how quickly they think they could implement it, because I think that should drive the timeline. I don't think it should be arbitrary that we place on that. I like Assemblywoman Howdige's idea that we put it to the next sunset subcommittee, because that should give them plenty of time. Of course, the two things that remain questions in my mind are, number one, how do the existing 1,500 people pay for this, because it's ultimately going to be coming out of their pocket. And if the current vendor that's doing the website isn't capable under the current pricing structure to add the things that we're requesting, things like testing on demand and without restating everything that's been said. The things that we're going to ask them to do are going to add to the scope of that project, and it'll add cost. So I'm a little hesitant to then say, okay, Barbers of Nevada, if you want your own board independent of the Cosmetology Board, you got to come out of pocket, particularly after the pandemic and the hardship that they've seen. I'm not sure that that's really fair either. But to Assemblyman John Ellison's point, it is kind of cutting them off at the knees if we say, do X, and then they've done as best they can, and then we say, nope, not good enough. That's not right either. So I do like Assemblywoman or Vice Chair Howdige's idea of putting this to the next sunset committee with a list of recommendations as we've outlined, and make sure that they step up. And that could, of course, include conversations and cooperative efforts with the Cosmetology Board, because they've established the model for doing this. There's no reason, and I know Director Landry is likely to agree to offer them or offer their services in assistance. If we could do that, the only question then is, are we losing efficiencies by having two parallel boards? And I don't have any heartburn over maintaining that if they're serving their licensees the way that we're asking them to.
So certainly, I think all the points that have been made heretofore have been valid and I think worthy of consideration. I would put one more requirement there, because I am really disappointed about the in-person meetings because when this started and how quickly it was spreading. And I think the last thing that I said in our last in-person meeting of the subcommittee was to get with Board of Cosmetology and find out how they do what they do, and then mirror that. And so I would encourage you with all deliberate speed to move it online. As I said before, it's simple to do. There's several different apps that you can use. The one that most people are using is Zoom, and you can set it up in like 2 minutes for a nominal fee, and making sure that the outreach is done so people know when the meetings are being held, and making sure that there is an accurate record of the meetings, along with the treasurer's report, and the things that we saw the last time we met on the meeting agenda. Most of them were meeting in private or something like that for personnel matters. If it's truly personnel matters, then that's okay. But I think what I heard from many of the people who testified was that they want more information about what the board does, how it conducts itself, meetings, et cetera, et cetera, et cetera. So I'm gonna ask if we can add to that. There has to be some type of a mentor-mentee relationship between the barber and the cosmetology board. And I think that that's probably easy to do because if I heard Mr. Landry correctly, there's only one thing that differs from barbers and cosmetology, and that is shaving. But other than that, all the other requirements are the same. So if somebody wants to put this together in a motion, number one, we need to have an update of where they are with the recommendations that we made back in, was it February? Where they are then. And we also need them to bring a report to the next legislative session, 2021, in February, about where they are as of from now until then. Where are they with respect to modernization? Where are they with respect to website? Where are they with respect to talking with, counseling with, however you want to call it, mentor-mentee relationship with cosmetology? And I'm also concerned here about the instructor license. We didn't talk about that, but I think it says the instructor license is, what is that? Once a year, twice a year?
That was the testing twice a year, Madam Chair.
Instructor license twice a year?
Yes, correct, I believe.
Twice a year?
That's my understanding, Chairwoman.
Okay. Mr. Landry, how often do you all do instructor licensing?
Do instructor test. We do regular testing 7 times a day and instructor testing about that same frequency. We don't have any restrictions on when they can take the test.
So if we move forward with this recommendation, is it possible to help the members of the barber board to improve their efficiency and offer that more than just twice a year? Is that a possibility? And both can answer that, Cosmo and barbers. Is that a possibility?
Madam Chair, Antoinette Maestas, Nevada State Barber Board. If I could ask Mr. Landry a question, who is doing your instructor testing?
We're doing the instructor testing. We've developed our own test and had it certified through PSI, and it's given through our computer systems, and we provide the testing, both the practical and the theory.
Okay, thank you. Madam Chair, we're more than happy to work and do what we have to do. If we could get a list of what you want done, we will work hard to get all of that done in the time frame that you're putting on us. I think with the website, I think that's going to help tremendously.
And I just want to be clear about one thing. One of the reasons that I'm pressing on this, and I've done this with other boards that were not on our agenda today. Today, there were 18,000 people laid off from MGM. And there are other people who are laid off in other industries and will probably not, their jobs will probably not come back. That means that there are going to be people who are going to be looking for what I call a second act. What else can I do? What else would I be interested in? What else can I do well? And I want to make sure that for all of those skill sets or those skill boards where you have to be trained, tested, monitored, or whatever, want to make sure that the process of entry is safe, efficient, and make sure that the time between testing or when you have testing and when you can go to work, make sure that that is as short as possible, because now we're talking about economic necessity. many of the people. So committee, let me hear, this is what I hear you say, and I'll entertain a motion. Number one, for the Barber Board to become, in essence, a mentee of Cosmo, and to learn all the things that they're doing and how efficient, and learn how they might be able to do their things more efficient, and make sure that the technology that Cosmo has, that the Barber Board is privy to and knows how to set that up under their under their own auspices. Did I miss anything? And to come back to have a report ready for us in February of the 2021 session in terms of progress. And I would say again, then the next report should be available at least by November of 2021. So in the event the Sunset Subcommittee starts before January, at least they know, they have some idea as to how or not the progress has been made.
And I think you mean 2022? Chair? I think you mean 2022, correct? For the interim, not 2021?
Oh, so 2021, if they come back in February and we end in June, most of the time, some committees start like November, December. We may start in January, but I want to make sure that whenever the next subcommittee, when the first meeting of the subcommittee of the next interim, whenever that takes place, that report is ready and ready to be presented.
And that would be
so as not to lose any time.
But interim Sunset Subcommittee, which would be 2022, correct?
Yeah. Mm-hmm. Does that make sense?
Madam Chair, with respect to the recommendations coming in February, I thought that's where you were going with the November report date. But I'm assuming that they can report anytime prior to the February submittal, that they have to submit prior to the beginning of the next session in 2021, and then be prepared to come back to the Sunset Subcommittee whenever the Sunset Subcommittee calls it in the next interim starting in, it would be after the appointments following the 2021 session.
And that's what I mean. The interim, so the next interim would be 21, 22. So whenever the next interim starts, they should be ready to present their updated report the first meeting of the interim Sunset Subcommittee, not the third meeting or the fourth meeting, but be prepared to present that whenever that time is. Some committees start in November. They may have an organizing meeting in November. Others may start in January or February, but whenever that meeting is, then they should be prepared to present that update at that first meeting.
Right, and they're going to get notice of that meeting once the Sunset Subcommittee has been appointed. My recollection is vaguely that we were appointed in October of last year, and then
everybody will get notice, so
right.
It won't be something that'll sneak up on them. I'm saying that, as far as the recommendations go, if we put this and allow, and I think part of the problem, and I think you and Vice Chair Hadigi probably pinpointed it, and that is you have a larger board who has developed some processes that make it more efficient, and they're able to get it done. You have a smaller board that may not have the same types of expertise or access to expertise, and therefore much of what they have been doing has not been modernized and made it more accessible to people, to students and to the public. and to make sure that they're running as efficient as possible. So setting up a mentor, cosmetology board as the mentor, and the barber and health and sanitary board as the mentee. I think that affords them an opportunity to learn and to develop some practices and protocols that will make them at least as efficient.
Right.
At least as efficient.
All right, I think I've got the list then, Madam Chair, if you'd like a motion.
Yes, please. First, are there any other questions or comments that we missed?
Yes, I've got one if I may. And I totally agree with what you're saying, but I thought if during now in the first of the year, before the first meeting, if they don't comply, then it should automatically, not drag it on. But that gives them 5 months to get everything in place. So when the first meeting comes to whichever this is going to go to, probably Commerce and Labor, or Commerce and Labor, at that point in time, it'd probably come to the Senate. And if they haven't complied or can't comply, at that point in time, shouldn't it, instead of waiting till a midterm, shouldn't it just go ahead and transfer over to the cosmetology board? There's no sense in delaying it, but I think they can make it between now and in February. But I think if they listen to the cosmetology board, how they do it and how they get their testing done, I mean, that's the biggest thing they've got. So if they can get that on, they're already working on Zoom and everything else. But the biggest thing is their testing. And if they just listen to the cosmetology board and let them show them how they do it, they should be up and running in your committee in February. And that's what I'm saying. If they're not, then you're just wasting your time and your will. But I think they can do it. If not, then at least you can get the cosmetology board could pick it up and be running with it. That way we can get these people working, not waiting. That's my only thoughts. Thank you, Madam Chairman.
Okay, thank you. It's another consideration.
Madam Chair, I suspect that Ms. O'Grady could probably tell us, but it's my impression that the legislature can do whatever the legislature believes is best. So if the next legislature were to decide after the presentation that we're requiring of the barber board, that we don't need to wait, we're going to make the change, that they could certainly do so at that time. But in fairness to the board, they're going to need someone to step up and say and verify, have you complied or haven't you, to know. So we would either have to reconvene this subcommittee prior to the start of the next session in order to make that recommendation. But I don't think, but again, Ms. O'Grady can probably answer the question, is that even possible within the construct of our recommendations?
I agree with Senator Pickard. I mean, this is going to require a BDR. So, I mean, if the board isn't where it should be by February, I mean, a BDR could be introduced during session. So I don't think we need to make any extra complicated deadlines for that. I think it could just happen that way organically.
So if I'm understanding you, Ms. Gray, we could make the recommendation to bring the progress report to the Committee on Commerce and Labor in February and evaluate the progress at that time and decide whether or not to consolidation or some variation thereof.
Yes.
Committee members, how does that sound?
Madam Chair, I think that makes a lot of sense. I don't mean to dominate, but if I could, before making a motion, let me just run through what I think we've got. We would have a requirement for the barber board to update the legislature in 2021 as to the recommendations that the Sunset Subcommittee made in February. And then also report on progress in web development, modernization, cooperation with the Cosmetology Board, increasing testing, preferably to on-demand, and licensing similarly. And then, of course, not to lose the credit card payment issue. And then, subject to that presentation to the legislature and the legislature's failure is the right word, but if the legislature were to decline to take immediate action, that they would then report to the Sunset Subcommittee after it's constituted following the 2021 session and be prepared at the first meeting to present its progress to date, and then we would revisit whether or not to continue the board, much as we just did with the homeopaths board.
And that's the one I was thinking of. We did last session. Yeah. Okay. Is that your motion?
Well, if Madam Chair wants the motion, yes, that would be my motion.
So I have a motion.
Second.
Did I hear someone?
Yeah, I think that was Mr. Pickard's motion, and I was just second the motion.
Okay, so we have a motion made by Senator Pickard and a second by Assemblyman Ellison. Additional questions?
Madam Chair, I agree with that motion. I think it makes all the sense in the world. And I just want to caution that while the Cosmetology Board is a very well-run board and an incredibly efficient and professional board, and there are similarities between the barber profession and the cosmetology profession, I just don't want to confuse the two or not recognize the distinctions between those two very different business models, training and cultures that are associated with those two businesses. And so I think there's a lot that can be learned from the Cosmetology Board, but barbers and cosmetologists are not the same.
No. Yeah, and I agree. I think there may be some ways that we can look at what some of the other states are already doing: Georgia, Missouri, Oklahoma, Kentucky, and there are probably some others that are escaping me right now. But what I think we're talking about, to your point, Senator Brooks, is consolidating, if we would, consolidating the protocols for training and licensing, but not interfering with whatever the business model would be. Very similar to someone going to culinary school, and one person goes to work in a five-star restaurant and someone else opens up, a restaurant in the local neighborhood. So the training is the same, the business models are different, but you have the same training. So I just want to be clear on that. We're not talking about consolidating cultures. We're talking about looking at ways to help the barber board become more efficient and more accessible and becoming more modernized, so that the protocols that are in place right now for students, for testing, for licensing, all of those things will happen in a way that benefits the customer, the client. So it's been moved and properly seconded. Additional questions? Thank you, Senator Brooks, for your comment, though. Additional questions? Mr. Melgarejo, will you please call the roll?
Senator Brooks,
Yes.
Senator Pickard,
Yes.
Senator Spearman,
Yes.
Assemblyman Daly,
I think he had to leave.
Correct.
He would be back. He had a call to get on at 2:30, but he would try to get back. So I'll tell you what, let's hold the vote open until he gets back, if he can get back in time. And I believe something that we do during session, if someone has to leave to go present a bill, that they can always get back and say whether they are yay or nay. Is that correct, Ms. O'Grady?
I think he has to get back by the time the meeting adjourns today, so.
Okay, okay. So we'll hold it open until we adjourn. If he's not back by then we'll close it with what we have. So those who are present would be yes, and then there would be one excused absence if he's not back. Okay.
Madam Chair, we still have 2 more votes.
Huh?
We still have 2 more votes.
Oh, I'm sorry. I jumped the gun.
Assemblyman Ellison,
Yes, I thought they forgot me.
Assemblywoman Haragi,
Yes.
and it's unanimous with the votes present.
Okay, thank you. So currently we have all yays. We will wait to see if Assemblyman Ellison gets back before we close. So thank you all for the very vigorous discussion. And what I would hope would happen today is that the executive directors of both of those boards would get together and develop a schema scenario of how this mentor-mentee relationship will take place. There's no need to report back to us, but I would like to see something in writing in terms of what that looks like. If you can just submit that, and we'll circulate it to the other members of the committee so that everybody knows what's going on between now and February. Okay? Okay, thank you. So our next item, I'm sorry, any other questions or comments? Okay. So our next item comes with recommendation relating to increasing the diversity of members of certain regulatory bodies.
Thank you, Chair Spearman. This is Jennifer Rudy. The next, there are 3 items on the work session document that are not specifically related to the 15 boards, commissions, and councils that were reviewed this interim by the subcommittee. And the first one is regarding diversity. According to Senate Concurrent Resolution 1 of the 32nd special session of the Nevada Legislature, nearly 49% of Nevada's population is represented by persons of color, including persons who are Black, Indigenous, Hispanic, Asian, or Pacific Islander, and persons of more than one racial or ethnic background. During the 2019 to 2021 interim, the subcommittee reviewed a fraction of the existing professional and occupational boards, commissions, or entities hereinafter referred to as a regulatory body. And part of that review included inquiring about the number of members who are Black, Indigenous, and other persons of color, commonly referred to with the term BIPOC, to continue its education and outreach efforts after the final meeting of the 2019 to 2021 interim. The subcommittee may consider sending a letter to certain regulatory bodies encouraging the recruitment of BIPOC members reflecting the diversity of the state. Thank you, Madam Chair.
Any discussion, committee members? So the purpose of this is to make sure that we're doing all that we can do with respect to outreach, because I think the day and age that we live in right now, SCR 1 declared that racism is a public health crisis, and part of the structural racism is if we continue to allow the excuse, I don't know anyone who's qualified who is in that category. I don't think that that's true at all. I think it will require members of boards and commissions to be a little bit better and a lot more inventive in terms of their outreach, because there are people of several diversities that are available and are skilled and or qualified. You just have to reach out to them. And that goes again to what I was asking of the purchasing, the commission to study governmental purchasing. We have to be really intentional about reaching out to people who do not look like us, go to our same church, live in our same neighborhoods, go to our same schools, remember the same country club, et cetera, et cetera, et cetera. So if we're ever going to dismantle systemic racism, this is one of the ways that I believe that we have to do it. Are there any questions of the committee members as to what we're asking here, or comments?
Madam Chair, I'll just make a comment. I think that what you're saying makes a lot of sense. There's no reason why we can't reach out to our regulatory bodies or any organization for that matter to make this kind of encouragement. This is a no-brainer in my mind. I think that we should have no problem encouraging our regulatory boards to reflect the community.
Additional comments?
Madam Chair, it's Hannah Brown. I certainly agree with Senator Pickard, and we certainly made a concentrated effort with that when I was with Delta, because people don't always come with the knowledge you need, but we were willing to train people, and everyone has to be trained. It doesn't matter what your complexion is. And if you have to put a little more effort into it, we were willing to put a little more effort into it and try to make a difference. Somewhere along the way, we fell off the wagon, but I think we get a little comfortable and complacent. And I can tell you, after having served as president of the Urban Chamber for 8 years, there is not as much patience in dealing with people that don't look exactly like us. And I think we're in an environment now where we have to have a little more patience with people and trying to prepare them and really get them to the point that they can function, because we do have people that have great qualifications. They're just not, they don't have the familiarity in all areas that we would like for them to have, but we can learn.
Thank you, Ms. Brown. Additional comments? I think it's an undisputable fact that representation matters. And when you don't have diversity, members of your board, your executive body, then it makes you poorer in terms of your intellectual capacity and your professional capacity. I'll just say this and then I'll leave it alone. Yesterday was one of my sisters. She would have been 60 had she not died in December of 2016. And I believe she died because the doctor didn't listen to what she was saying about her body and was sent home, and in less than 24 hours was dead. We also know that Assemblywoman Monroe Moreno has had a bill last time that passed to look at why Black women's mortality rate was much larger than white women. So I'm putting that out there to say that everyone should start to get used to doing it so that our boards are more representative of the population here in Nevada. We are no longer just, one color, one ethnicity, one culture. It's multicultural and it's diverse. So that's all I will say about that. So recommendation. We need a vote. Okay, I will entertain a motion.
I'll move to make the recommendation.
So I have a motion by Senator Pickard. Do I have a second?
Second.
I believe Senator Brooks, your mic isn't
Senator
working.
Brooks? Hold on. Who made the motion?
Pickard.
Senator Pickard made the motion. Who seconded it?
I thought I did. John Ellison.
Okay, Assemblyman Ellison. I heard Senator Brooks.
My mic is going in and out.
Okay. All right, we'll give you the next one. So moved by Senator Pickard, seconded by by Assemblyman Ellison. Any additional questions? Margarejo, will you please call the roll?
Thank you, Madam Chair. Senator Brooks?
Yes.
Senator Pickard?
Yes.
Senator Spearman?
Yes.
Assemblyman Daly? Assemblyman Ellison?
Yes.
Assemblywoman Hodeggy?
Yes.
Okay, and we'll do this one just like we've done the last one. Wait for him to come back if he can get back prior to the end of the meeting. So thank you all. Next on the agenda is recommendation relating to the Nevada Board of Homeopathic Medical Examiners.
Thank you, Chair Spearman. This is Jennifer Rudy, Committee Policy Analyst. The next recommendation is to send a letter to certain regulatory bodies urging them to comply with controlling health standards in conducting the business of the body to reduce the transmission of severe acute respiratory syndrome coronavirus 2, the virus that causes COVID-19. The letter should direct the regulatory bodies to communicate with their licensees as necessary to keep them apprised of changes to controlling health standards. Thank you.
Thank you. This one basically is what I call one of those common sense ones. There are certain things that are now law as a matter of the emergency declaration. And until further notice, I don't think that in-person meetings are really prudent. When we have the opportunity and the ability to do it virtual like we are doing now. And so we want to make sure that all of the boards are following the most stringent standards to make sure that at some point we've got to get this disease under control. So any questions on that? Comments?
Madam Chair, this is Senator Brooks.
Mm-hmm.
So when this letter that this motion would propose to send, that it just says to follow the controlling health standards and that's it, or does it specifically say not to meet in person?
Well, it's my understanding that if we say the controlling health standards right now, that would imply, I could be mistaken. And if I am, we can always amend it. And I say that because it was brought to my attention, there were a couple of boards that were getting ready to hold in-person meetings and there was just no way there was going to be able to be social distancing and masks required. So
if
we need to add that.
A group under 50 in a room that had a capacity under 50% and social distancing could take place and masks could be worn, isn't that the controlling health standard? Or am I confused on where we're at?
No, it is, but I guess it would also depend upon what the occupancy number is for that room. 50 people in a space that is 500 square feet or something like that, maybe that can accommodate, but I'm sorry, 5,000 square feet, but if you're talking about 500, there's probably no way that you're going to get 50 in there and be able to comply.
So just to clarify, this letter just says comply with the controlling health standard, whatever that might be.
Mm-hmm.
Okay, thank you.
Should we make it stricter?
I don't know why we would feel we have the authority to do that.
Okay, I'm just asking.
No. I just was curious and on what exactly that it was going to say.
I guess what we're trying to avoid is a board or somebody that's going to, have 30 people and, the size of the room is not as big as what's at Grant Sawyer. So, additional questions, comments, concerns? I'll entertain a motion.
So moved, Chair. Ms. Vice Chair Howdy.
Have a motion by Vice Chair Howdy. Do I hear a second?
Second.
Second from Senator Brooks. Additional questions, discussion? Mr. Marvarejo, please call the roll.
Senator Brooks,
Yes.
Senator Pickard,
Yes.
Senator Spearman,
Yes?
Assemblyman Daly,
Yes.
Assemblyman Ellison,
Yes.
Assemblywoman Howdy.
Yes.
Motion passes unanimously.
Thank you. We've got a couple of other actions, Senator Daly, that we took while you were not here, while you were taking care of your other business. Mr. Marvarejo, you want to read what those are and give them an opportunity to weigh in?
Recommendation 15 was regarding the State Barbers Health Sanitation Board. The committee or subcommittee motion to continue the board, but with several stipulations. One, reporting back to the 81st Legislature, and 81st Legislature taking action, and if they do not take action, then to report back to the next interim sunset subcommittee during their first meeting.
I would go with the recommendation of the board on that and vote yes. Or the committee, excuse me.
Thank you, Salman. The next recommendation was recommendation B in the work session document. And his recommendation is relating to the increasing the diversity of members of certain regulatory bodies and to continue its education and outreach efforts after the final meeting of this sunset subcommittee, and consider sending a letter to certain regulatory bodies encouraging the recruitment of Black, Indigenous, and people of color members, reflecting the diversity of the state.
And I would vote yes along with the committee on that one.
Thank you so much. Chair Spearman, I believe that's all of the motions where Assemblyman Daly was not present.
Thank you, Assemblyman Daly. So now we're at the recommendation relating to the Nevada Board of Homeopathic Medical Examiners. I jumped the gun on the last one. This is the real one, not the other one. This is the real one.
Thank you, Madam Chair. This is Jennifer Rudy, Committee Policy Analyst. This is the final recommendation on the work session document. And per Section 7 of SB 98 from the 2019 session, the terms of all members of the Nevada Board of Homeopathic Medical Examiners expired on June 30th, 2019. However, the past members continue to serve in a custodial manner per NRS 630A.120 and the advice of the Office of the Attorney General. The board submitted a memo dated June 26, 2020 to the subcommittee at the June 30th, 2020 meeting that noted a total outstanding debt to the Office of the Attorney General in the amount of $110,055.93. The subcommittee may consider sending a letter to the board requesting that it report back to the subcommittee during the 2021 to 2023 interim regarding the board's composition and the status of its debt owed to the Office of the Attorney General. Thank you.
Are there any questions? Comments?
Yes, Madam Chair, if I may.
Yes.
I'm a little perplexed why we would simply send another letter to the board requesting that they do what we required after the last sunset subcommittee. And in fact, when we talked to them during the last session and found out that because no one stepped up to take those board positions, we had former members who, well-meaning as they were, and I think it was clear that they were trying to do their best, they just couldn't act because they weren't acting members, they were simply custodians. So my question becomes one of, why are we sending another letter if they cannot do what we required of them after the last committee and the legislative hearing on this? They were, if they can't operate, if they can't appoint new members, if they can't do what boards do, why are we sending them a letter and not just recommending that the legislature do what we recommended after the last interim, which is to consolidate them with the Board of Medical Examiners and be done with this? It appears that they don't have the capacity to appoint members of their board and to start functioning properly because they are so small. That appears to be the case. I just wonder, why are we essentially spinning our wheels and ending up nowhere new?
Can I just interject for a minute? I'm sorry.
Yes.
Chair Spearman, the Senate Bill 89, which was a recommendation from the Sunset Subcommittee last interim, was not transferring the responsibilities of the Board of Homeopathic Medical Examiners to the Board of Medical Examiners. I'm sorry. It was actually, I believe, transferring those duties over to the State Board of Health. I'm just looking at.
And that's probably right. I just remembering the wrong board.
Senator Pickett, I guess your point is this is this prolonging the obvious or the inevitable?
Well, I don't know that I want to characterize it as obvious or inevitable if they are able to do what we ask them to do. I'm just surprised to see this, given during the last legislative session, the custodian, who was the former president, said he couldn't really take any affirmative action because he was merely a custodian waiting for the new board to be put in place. But it sounds like that board is not yet in place, and it's been better part of a year since they were given the initial mandate to do so. So if my question is, if they can't in that space of time do what the prior interim subcommittee, the Sunset Subcommittee, recommended, and that then they came to the legislature and suggested they understood that that was the requirement. If here we are now a year later and we still aren't there, what's the letter going to do that we haven't done already? Why aren't we instead recommending that, since they haven't done as they were required to do, that we're just recommending to the legislature that we make that transfer happen?
Good question.
Yeah,
The committee.
I've got a question, and I can't, there's a lot of people that use homeopathic medicine all the time in medical. So apparently that maybe the people that work with these guys, this board needs to be either updated or create a new one or send it to something else. I don't know where you'd even send this board to, but I totally agree that there's a lot of people use this. I can't believe their board's not jumping on this and fixing the problem.
Yeah, Madam Chairman, if I can jump in, because I was part of that committee. This is exactly the conversation we had during the last interim. And it was decided to roll them up into, and I think Ms. Rudy's correct, it was the Board of Health. And it's not that we're doing away with homeopathic medicine at all. This is about moving them into a structure that can actually administer what the board needs to do, because the Board of Homeopathic Medical Examiners could not get it done, and in fact had amassed a sizable debt to the Attorney General's office for disciplinary actions and other things that they couldn't pay because they don't have enough licensees to cover the cost. And so how they resolve that with the Attorney General's office is ultimately going to be up to them and the AG. But at the end of the day, their board couldn't function, couldn't do the functions that it needed to do. We terminated all of their terms and left them in place only as custodians while we were waiting for the new board, and it sounds like the new board has not yet been appointed, and we're more than a year later. So I'm just asking, why are we repeating the same process we just went through rather than simply saying, okay, you had your time, let's move them up under the Board of Health. Let that board now continue the homeopathic medicine as a practice area, but then allow people who can address the Deputy AG's bill and the other things that need to happen.
Madam Chair, do we have someone from the board here too?
Madam Chair, Senator Daly, if I can.
Anyone here?
Yeah. And I think Senator Pickard is right on base, because as we all know, if we make the recommendation and the Legislative Commission agrees and a bill draft gets done, if people are interested in continuing that board, they'll be motivated then to come to the legislature and make the argument that they can handle the duties. And if they can, then it will be moved into another venue where it can. Just sending another letter, I don't think is the deal. It's not the end of the world either, because you have to get a piece of legislation passed. It's not the easiest thing to do. And then we'll have full session and committees in both houses able to look at this issue, and they can either make the argument for survival or they can't. And that'll be a decision the legislature makes based on the facts. So I think we should go forward with legislation to move them into the Board of Health, if that's where we were before, instead of spinning our wheels, as Senator Pickard said. That's what I would support.
Additional comments? Is there anyone from homeopathic on the line? Do we establish that or no?
Senator Spearman, this is Jennifer Rudy from Committee Policy Analyst. There was not, however, Elliot Malin, a consultant for them, was watching. And so I've just asked Star Litton with our BPS if she can send them a link if you would like to hear from him.
Yes, please. Yes, please.
So that might take a minute for her to get that link over to him and him to access that.
And there, Madam Chair, I know I asked for them, but I'm in line with what Assemblyman Daly said. I think he was correct in saying that, know if a letter is going to do anything, but maybe actually moving forward with Senator Pickard's suggestion would actually bring them to the table when they have to appear in front of Ledge Commission.
And Madam Chair, if I can just pitch in, I agree completely. And to Assemblyman Daly's point, that's exactly what happened when it came before the legislature in this last go around. They did step up and they did come in and say that they were working to accomplish what we asked them to do. And it sounds like that just didn't happen. So I don't mind waiting for them, but I'm happy to make that motion when the committee is ready for it.
Many members, what's your pleasure?
I've got one question, if I may, Madam Chair.
Yes.
Madam Chair, the funding, the money that's in there, that somebody's got to be collecting these funds for membership. Does the Attorney General take that money and then push it over to the next person in line? I don't know. I don't know what the process is, and no matter how we divvy up boards, can somebody answer that question?
Madam Chair, my recollection, although this may have been a conversation we had offline after the last go around, but my understanding is that the deputy or the AG's office would not move that debt over to the Board of Health, that they would simply absorb that cost. They've already absorbed it. It's an outstanding receivable and has been for 4 or 5 years for the most part. And so my recollection is they said that though they would like to get paid for that, they've long since moved past that point. At least that's my recollection of the representations made during the last interim.
Well, it sounds like there won't be any movement away from your original observation, Senator Pickard. Even, is Elliot on with us?
Absorb that cost. They've already absorbed it.
Madam Chair, this is Elliot Mallon on behalf of the State Board of Homeopathic Medical Examiners. I apologize, it took me a second to jump on. I had to get the link, but I was following along, and I'm happy to answer any question that I can answer. The first thing is Senator Pickard, you had mentioned that the board has not been replaced. The authority to appoint the board is vested with the governor, and the governor's office has not appointed a new board in the over 1 year since this bill passed. They have asked repeatedly and sent requests to have the governor's office appoint somebody. I know that the governor's office has been a little busy with COVID. I have talked to the DAG the other day about what the authority of the board is in its current state if there is no appointment made. And we're trying to get clarification to make sure that the board can now implement SB 98 until it is replaced, at least the function of the board and improvement of it. Are there any other questions I can answer?
I guess I have one, Mr. Mallon. I appreciate you stepping up for them. So if I understand what you're saying is that we don't have any clarity on whether or not the current board as custodians can actually take action. It was my understanding during the legislative hearing that they said they could not. But is there a line of authority that suggests that they could, as custodians, they could actually take affirmative action on behalf of the board?
Elliot Mallon for the record. Thank you, Senator Pickard. Yes, the current NRS stipulates that the members of the board continue on until they're appointed or replacements are appointed by the governor's office. There was two conflicting opinions, I believe one from LCB and one from the AG's office. The LCB opinion had, from my understanding, this is before I came on to help them, said that they cannot do anything, and the AG's office said that they can. So we are working. I talked to Dr. Fong, the president of the board, or I guess interim president of the board the other day, about getting clarification on their authority via the AG's office and getting an official opinion. They do have also on that note a plan to repay the debt to the governor's office. That has been on hold because of the unknown authority that they have at this point in time. So we're trying to get that clarification so that way they can fully implement SB 98 and move forward with improving the function of the board.
Well, Madam Chair, with that, then maybe in all fairness, it's not appropriate for us to cut their knees out from under them, just as we were talking about the barber board. But I still think that it would make some sense to move forward with the recommendation to consolidate the board with the Board of Health pending reappointment of the new board by the governor's office and affirmative steps to address the issues as they exist. That way, we've got a solid recommendation, but a way for them to meet their obligations prior to the discussion in the next legislature, so that by then maybe we'll have the right answers, but then we don't have to wait until another interim and then the following legislative session to actually do the work.
So can you say that a little bit more succinctly.
I will certainly try. So my suggestion would be that we move forward with a recommendation to consolidate the homeopathic board with the Board of Health pending a reappointment of the board and a presentation to the legislature during the session where we hear that, so giving them the opportunity to show that they did meet the intent and the requirements of SB 98 and the prior board, at which point the legislature can decide what to do.
You've heard the motion. Is there a second?
Second.
Seconded by Councilman Daly. Further discussion? All those in favor? Aye. Mr. Melgarejo, please call the roll.
Senator Brooks,
Yes.
Senator Pickard,
Yes.
Senator Spearman,
Yes?
Assemblyman Daly,
Yes.
Assemblyman Ellison,
Yes.
Assemblywoman Howdigy.
Yes.
Madam Chair, the motion passes unanimously.
Okay, thank you.
Madam Chairman,
I would just say that, Elliot, for the members of that board, one of the things that we've talked about, and if you've been watching, you've heard me say that, is these boards exist because people are going into those professions and there has to be some type of regulatory body that oversees them. And if they're not functioning efficiently, then it becomes our economic development or even rebound, if you will. You have people that are skilled, can do, want to do, but you don't have an efficient and effective board. So based upon the recommendation, we'll move forward with this, but I still want to believe that there is room for additional comments. But at the same time, even though obviously the AG has absorbed the cost, that is a cost to someone, and it's usually a cost ultimately to the citizens of Nevada. So something to think about. Okay?
Chair Spearman. No.
Hear somebody say something?
yes, ma'am. I was trying to get a clarification on the motion. This gives them time to come to the plate along with the appointment of the governor to try to repair this during this session. Is that correct?
That was my intent, yes. It would
Yes.
Be to make the recommendation to consolidate, but give them the opportunity to present to the legislature why that may not be in the best interests of the state. But it gives us the ability to move if, in fact, the board is not reconstituted and they've not made the appropriate steps, whomever it is that is required to do that.
Thank you. And I'm sure that's what you said. I just want to get clarification. Thank you.
Yeah, and this goes along with the recommendation that we made for the Barber's Board. There's going to be an opportunity to show that they can indeed do what they're supposed to do, but at the same time, if that doesn't happen, then we won't need to wait for another interim to make the consolidation. So.
And Chair Spearman, Elliot Mallon again, for the record. I just want to say thank you for letting me, it's Elliot Mallon again. I just wanted to say thank you for letting me jump on last minute to get some clarification. I will be in contact with every member of the committee as things progress. I will work with the board in making sure everything is followed as the intent of SB 98. And we will follow up again with the governor's office to try to make sure that we move the appointments along. But you have that word from me, and I will communicate this to them, and I appreciate it again. Thank you.
Okay, thank you, thank you, thank you. I think we are now down to item number 8, public comment.
No. I've got one if I may.
Yes?
Yeah, thank you, Madam Chairman. And early on, we had a discussion about the extending help for those individuals for making sure that the banks would honor and back up their hold their payments up at the banking. Problem I got is I just seen, I got the news flash, the governor's going to extend the eviction for 45 days. You know, the problem I've got is the small businesses out there that's extended all this time since March that hasn't been able to, they're still paying water, sewer, garbage, and bank payments and insurance without a dime coming in. So we're being contacted by several that most likely there'll be several that'll be filing throughout the state bankruptcy. And I was just hoping they would do something to extend, you know, some kind of help to these individuals, and that's not going to happen. So to me, I've seen you're going to see a massive amount of bankruptcies filed within the next 10 to 30 days on these small businesses that will go under because they can't afford to make these payments any longer. And I was hoping maybe if you have any contact or anybody that's out there that has any contact, to see what we can do to get help to these individuals, because the only thing I can see is that they will go into bankruptcy. Thank you.
Thank you. I could be mistaken, but I agree with you that they need some help. One of the things that has tied the hands of state executives across the country is the fact that the HEROES Act has been stalled in the Senate now for about 3 months. And some of the money that would go to the people who would support the small businesses won't go there because the people who would spend don't have the money to spend. And if you take into consideration that it's now been a month since the additional $600 a week, which would $2,400 a month, has not gone to individuals. So you are correct. The other thing that I would note as well is that we know that according to doctors and science, that if we can get more people to comply with the health and safety standards, i.e. wearing the mask, we could get a lot closer to bringing this virus under control. And, you know, I don't know about anyone else, but I get incensed when I'm outside and I see people parading around without a mask, and it's like it's a badge of honor. And I want to say, do you understand that not only are you putting people who are in vulnerable populations, you're putting them at risk, but the other thing that you're doing until we can slow this down, then you're also putting the livelihood of many small businesses, and to that extent, some large businesses at risk as well. So there are two things that I think we should hope and pray for. Number one, hope and pray that in the Senate, they will take that bill up, put it on the floor, pass it, so we can get money to the people. And number two, for those of us who are not in the Senate and voting on anything, make sure that we mask up so that it will help us as a state get back to a place where we can open up and people's livelihood can continue. Because you are right. I feel for the people for whom they're hanging on by a thin thread, and it looks like there's no hope in sight. So number one, we've got to get the HEROES Act passed. And number two, we've got to get more people understanding, not me, but what health professionals are saying. Mask up, and that will help us get this thing under control. So you're right, I agree with you. HEROES Act and less mask. So with that, go into public comment. Do we have anyone on the line?
Thank you, Madam Chair. The public line is open and working. There are no callers at this time.
Okay, we'll give it a couple minutes just in case, okay? No one?
Madam Chair, there's still no one on the line. Thank you.
Okay. So with that, we will, are there any other comments, committee members?
Madam Chair, it's Hannah Brown. I would like to just say that it's been interesting and educational, and I've learned a lot and hopefully contributed a little bit.
Yes, ma'am, we thank you. You have. Ms. Rankin?
Thank you, Madam Chairman. I enjoy serving whatever I can do. So thank you very much.
Thank you. Pastor Cheney? Dr. Cheney? Did we lose him? You're still on mute.
I'm here. All right. I'm trying to get it organized here. Okay. There we go. Yes, Madam Chair. I apologize.
Any comments, any closing comments?
You know, it's been amazing. It's been an outstanding journey. Thank you so much for allowing me to be a part of this body. And it's been good, very encouraging. Thank you, Madam Chair, for this opportunity, and the staff. You've been amazing.
Thank you. Additional committee members? Comments? I just want to take some time to thank all of you for your diligence and patience and willingness to change courses immediately as the governor's emergency directive went forth, and we were able to adapt. We would not have been able to be as successful as we have been had it not been for the professionalism and the tenaciousness of our staff at every level. Both broadcast, policy staff, everyone who had a part in pulling all the information together and putting it in writing and making sure that all the questions that I asked you all before the meeting, that you were able to get me answers to, so that during the meeting, I looked halfway intelligent. So I really thank you all for doing that. And thank everyone for your participation. And if you're watching, thank you for watching and paying attention. It is my hope and my prayer that soon we will be able to get this, and we will have, we will be able to get back to, not back to normal, because our normal wasn't that great, but I'm hoping that the lessons that we have learned while in this environment, this pandemic environment, we will appropriate for our new and more improved future. So thank you all. And if there are no other comments going
Madam
once.
Chair, let me just jump in here and congratulate you for doing a fantastic job with this subcommittee. This is the second time I've been on it, and I appreciate your boldness in addressing the issues that we face. And so thank you for your leadership. And Vice Chair Howdige, you were a great second. So thank you for the opportunity to be working with you both.
Thank you, Madam Chairman. You did a great job and you were very fair. God bless you guys.
I'm gonna ditto that.
Well, thank you. That's what lieutenant colonels do.
Yeah, God bless
Awesome.
everyone.
Say again?
I said, God bless everyone.
Yes, God bless everyone. Thank you all. I appreciate it. The best vice chair in the world, except for the other subcommittee that I chair. Have a great vice president in the world too. I mean, vice chair in the world too. So thank you all. Thank you all. Be safe, stay safe. And until we meet again, God bless you all. We are now adjourned.
Okay.